Of the Intact Global Conference. A round of applause. We had a great first day. Every speaker was compelling, engaging, great questions. We want to keep up the energy. It was beautiful. Great to see you all again. Now, a little feedback is, great day, but no breaks. And so we're gonna incorporate some breaks into the schedule today, right? So a little round of applause for that. Yeah. For you, John Geisinger. Again, lunch is going to be served inside today. The Sentinel did a beautiful job, so thank you to the Sentinel. And just so we're all aware, for the live stream and also everyone sitting in here, I'm sure I would say all, but most of you have some type of social media, whether it be Instagram or X or Blue Sky, you name it. Make sure you open your phone and you follow Intact Global Inc., right? At Intact Global Inc. We're trying to boost up the social media. It is one of the pillars of our mission here at Intact Global to educate and engage the public, right? How do we protect children from genital cutting, right? There's been a couple of changes in schedule. One of our speakers fell ill. Certified flu. The other is taking care of his elderly father who's not doing well, and so we do what we can. But we have other great speakers coming in. We got Steve Scott to talk about the anatomy. Hopefully Daniel Stranford will talk maybe a few minutes about what's going on in Europe. Daniel Rold will talk about, okay, how do we get local media engaged? Because that really amplifies our mission. But the theme stays the same. Today it's mostly intact litigators, right? Lawyers who have been engaged in this movement for anywhere from years to decades, right? A lot of experience, litigation, advocacy, policy, you name it. And Tim Hammond, wherever you are, hello, Tim. So Tim asked me to ask you all, grab some literature. We have another room over there with local groups, including GALDEF, who printed out info. It's kind of like preaching to the choir here, so you guys are all aware, but you could give it to other people who are having children. Say, look, this is a handout, so you don't have to stand there and tell them, although you should, look, don't cut your baby. This is harmful. We want to protect all children. So anyway, without further ado, I would like to welcome our first speaker, a longtime friend of mine, a lifelong intactivist, who also, like me, got terminated for his intactivism. And unlike me, he won his case, right? So he brought his case up to the California Supreme Court, some rule that protected banks unfairly. Martin challenged it and prevailed. So kind of a legend there. And also in the movement, we're very excited to welcome Martin Aoa. So please, round of applause for Martin.
Do we have somewhere to keep these? Like, can I set up?
Oh, you can put it down here.
Okay, great.
And did you have a mic? Okay, no lapel mic.
I can just use this. That'll be fine. Ah, right. Thank you. Thanks. Hi, everyone. I'm Martin. As Eric said, I'm a long time intactivist. I really started doing this work when I was 12 years old, and that was 54 years ago. So it's more than half a century I've been doing this, and I'll explain some of that in a minute. But Eric is correct. In the course of my getting fired for my intactivism, I challenged it, and one unexpected result of that was that we ended up overturning California law, 100 years worth of California law in how officers of a financial corporation were treated. So that was a benefit, not just for me, but for many, many people who had cases after mine. So I'm kind of a bridge between, and some of you lived through that with me. Some of you know very well, what happened. That's when I was living here on the West Coast and living in San Francisco. I currently live in the Fort Lauderdale area in Florida. So it was a long trip in here. But I see myself speaking early today as kind of a bridge between the Intact Coalition speakers we had yesterday and the Intact litigators who make up the bulk of today's presentations. Give you a little bit of my background. I'm not a practicing lawyer, but I did go to law school. My history is after William and Mary, this is a shout out for you. We went to the same, Sammer and I went to the same college. After that, I took a break. I worked on Capitol Hill. I went back to college and I started where I had been an undergrad. And after a year of going to college there, I happened to apply for and won a scholarship to get an MBA at the University of Chicago. So I approached them and said, could I transfer into the law program here and I'll do a JD MBA at Chicago. So I continued my law studies up at U of C, but I never sat for the bar because I went straight to Wall Street using the MBA part of my education and to some extent the legal part of it. And so that's where the bulk of my career was, in New York, then Chicago, and ultimately in San Francisco, where I worked for many years. So what I'm talking about today, the main thing, the theme of my talk is triage in the circumcision crisis. And I'm focusing specifically on the United States, but drawing from the history of many other countries. And when I say triage, nurses know what I'm talking about. It's prioritization of the cases that come before you. And in this case, I'm talking about let's go for the most bang for the buck first, and the things that are going to make the greatest difference, and work our way down. Because a lot of people come into activism and they say, you know what, I've been reading up on this subject. It's a terrible situation the US finds itself in, but I'm going to work really hard. And we're going to talk to every mom and dad in America, and we're going to end this in 5 years. That's not how it works. We've tried that. Like people said yesterday, never miss an opportunity to talk to your friends and family and even strangers on the Portland tram. Just talk to anyone about circumcision and make sure they haven't missed the message, because one of the saddest things to hear is the regret of people who say, I never would have done this if I had known. I wouldn't have cut my kid. And that is entirely preventable, and to some extent within our power. I want to make sure I didn't knock off anything important. I don't have a fancy PowerPoint presentation. I have some pictures that I'm going to show you in a few minutes. One of the things that we talked about that is really effective is street activism. Bloodstained Men is a great organization. My friend Jonathan Conte, the late Jonathan Conte, brought the idea over from the UK, where Richard Dunker had started this idea of stationary street art. Just basically men holding hands or standing perfectly still with a red blood stain. Jonathan brought the idea, I think it was to the New Orleans protest, and had these costumes made up with the blood stain. And Brother K ran with the idea. He said, let's turn it into moving art. We're going to carry signs. We're not just going to stand there and have people mull about us like we're statues and try to figure out what the message is. We're going to shout the message at them. So one of the most effective, wonderful protests we had was right here in Portland in 2016, in the summer of 16. And we had in our crew an amazing photographer who lived in Gresham. Now Timothy lives in Florida, but Tim captured us in photos, and I don't know if this is going to work. But some of you have seen this picture before. It's kind of an iconic intactivist image. And that's Brother K in the middle holding up the signs. And if you look at the person who's on the left of the screen in front saying circumcision removes 16 plus functions, that's me. So we were really noticeable here in Portland. We were unmistakable, and people still talk about that protest. And I have a few more pictures from that protest to show you in a bit. But let me jump into a little bit more of my history. They forced us into gym showers when I was 12, junior high school, summer of 1971. I remember it like it was yesterday. And we were all kind of traumatized because we were from an era where it really wasn't normal to undress in front of your friends. Back in the US in the 30s, 40s, 50s, even 60s, it was the most normal thing in the world. boys did their swim practices at school and the swim meets, even the regional and state meets, completely naked. A lot of people don't realize this. They don't remember that. There was no shame in the body. And I'm very much involved with the naturists, the nudist movement in the United States as well. I'm president, my day job is I'm president of one of the largest naturist organizations that covers Canada, the US, and Mexico. And people often say to me, where did this shame that we feel today come from? And I've identified 5 different factors, but one of the factors is actually circumcision. It's the rise of circumcision because there is an unspoken shame associated with that a lot of people don't realize. It started out when, just about all the boys were intact, that everybody looked the same. It didn't matter if you didn't have a swimsuit on at the YMCA or at your high school swim practice, because everybody had a penis that looked pretty much the same. And then as circumcision filtered into this, you had the mix of boys. You had boys with, markedly different penis statuses. And then you got to, several decades later, where the intact boys were very much in the minority, and it was their time to be ashamed. So the circumcised boys initially wanted to hide from the arguably normal boys. And then several decades later, you had the situation reversed, where the intact boys were self-conscious about being different from the norm. So this really struck me the first time I had to get nude with my friends, with my classmates, and I'd known most of these guys from elementary school also. So their initial reaction was to be very uncomfortable in that situation. And we quickly noticed who was cut and who wasn't. It was kind of unmistakable. For many, many years, I resented being forced into that situation because you couldn't get out of it with a doctor's note or a parent's note or anything. But now I see that it was a great bonding experience. It took our friendships to a different, more intimate level. And I am still I'm friends with most of those guys today from when I was 12 years old. One of them, half an hour ago, I just wished him a happy birthday today. So we're still really close friends, and I think that was part of it. But we never lost the idea of why is this circumcision being done? I then went on to high school where we didn't have to shower together, but I was an exchange student in Germany. And first thing I noticed was we did have to shower after PE class there. And I'm going to be talking about that a little bit later on when we do the interviews. Nobody in my class, including me, was circumcised. So my teenage brain was trying to reconcile this. Why 2 of the most economically, technologically, medically advanced countries in the world have such a dramatically different approach to this? Either circumcision is necessary and you need to do it to just about all the boys, or it's unnecessary and potentially harmful and you shouldn't do it to anyone. And so there I stood at 16 years old trying to figure out, how do I reconcile this? How does this make any sense? And so I dedicated myself, from the time we started the showers when I was 12, and really rededicated myself around the time of the US bicentennial to understanding circumcision and knowing what was right and what was wrong. And that led to involvement in this movement for the next 40 years after that. And we have a better handle on it, but we don't have all the answers to fixing it. And we need to do a better job of that. What really stands out to me is that money is a massive factor in this. Now, we have history to draw on from countries like the UK, which got into infant circumcision around the same time we did in the late 19th century. And Australia, New Zealand, Canada, South Africa, other countries where this Anglo idea of infant circumcision as a good intervention had spread. We also know that they managed to get out of it. And South Korea has extricated itself from its schoolboy age circumcision fad, which is almost universal, to dwindling now. So what can we learn from those countries? The easy answer is they have universal health care for the entire nation, and it doesn't pay for circumcision. And when you don't have that incentive, you don't have pressure from the medical profession on parents to get it done. It turns out that the real answer is more complex than that. But the subsidies, the money issue in the United States is a very real problem. And we see that in real time with those states that have eliminated infant circumcision from their Medicaid programs. They almost immediately, almost overnight, within the first year of deleting that, have a lower infant circumcision rate. That happened in my own state of Florida. In 2003, the great activists Van Lewis and his brother Ben, they had been lobbying the Florida legislature for years to get infant circumcision out of Medicaid, and they succeeded in 2003. Our rate went from 70% to about 33% in a period of about 2 years. It was a marvelous thing to see. It was a dramatic change. And then the legislature effectively put it back in 2014, and the rate went right up to 65%. So we can actually track this. We can see the effect of money in the circumcision equation. It's a critically important part. And Florida didn't do it directly. They did it the sneaky way. And be on the lookout for this in the other states that eliminate this. Florida decided to privatize Medicaid. So what they did was they gave a set amount of money to companies that came in with HMOs and PPOs. Florida selected 12 different companies. So each region of the state got somewhere between 3 and 5, depending on the size of the region, of these private companies that were offering health insurance plans, ostensibly as Medicaid, as privatized Medicaid. And Florida said, you have to cover a certain minimum of things, and circumcision was not one of these things. You have to cover a minimum, but anything else that you want to sweeten your plan with on your own dime, go for it. And of those 12 insurers that had been handpicked by Florida to offer private Medicaid programs, 11 of them instantly put circumcision in, saying it's a crowd favorite. And Tim can attest to this, because when he did that research in San Francisco, when we were living in San Francisco, the response from the insurance companies was, we know we can save money by not covering circumcision. We know it's not necessary. That's been clear since the AAP pronounced in 1971 that there's no medical indication for circumcision in the neonatal period. But as Tim said, it's a competitive issue. It's a game of chicken. Unless they all drop it at the same time, then they're going to keep it in so that they're not at a competitive disadvantage. Now, one area that this doesn't typically happen is when Medicaid drops it. What we have seen is that private insurers in the state, and I personally would never have thought that Medicaid was a direct competitor to private insurance, but I guess it is. When a state drops infant circumcision from Medicaid, the private insurers drop it too, like en masse. They all get themselves out of the business, and then parents have nowhere to turn for subsidies, which is a beautiful thing. I'm not one of those who's of the opinion that we have to level the playing field so that poorer families have the same shot at circumcision as richer families. First of all, that overlooks the fact that the trend away from circumcision, infant circumcision, is really coming from the most educated and well-to-do segments of society. But it is a fact that private insurance responds to Medicaid. So we really, I think, I'm going to list that as the #1 most effective thing we can do. And Anthony knows this well, because you have targeted that as a primary project for Intaction. And I think that's the right thing. That's putting the effort where the returns are going to be some of the greatest. Now, why were they paying for this in the first place? I don't know if some of you know this history, but infant circumcision passed the 50% mark in the United States, somewhere around 1933, 1934. Len Glick has this in his book. By the end of World War II, the rate was somewhere in the 65 to 70%. It peaked right around the time I was born, around 1960, at 90%. And some people even say that, among white middle-class families, it was 95%. That's the highest it's ever been here in the United States. What really drove that was two factors. One, a wonderful book, wonderful for the most part, a book called Baby and Child Care by the most renowned pediatrician in the United States, Dr. Benjamin Spock, from a very prominent Presbyterian New England family. And he had a section on circumcision in this book. Now, why this book was significant, and it was a runaway bestseller. It was #2 in sales only after the Bible. Everybody had this book in their house. And for decades, maybe for centuries, mothers had gotten their advice on how to raise children from their own moms and their grandmoms and their aunts and everybody else. But this was part of the new trend in America of individualism. I don't want to have to like reach out to my family for advice. I'll research it myself. And this book answered those questions, told you everything about potty training, told you everything about discipline, told you everything about everything. I remember being fascinated as a kid reading this book and learning about the fontanelle. But there was a section on circumcision, and Benjamin Spock offered parents 3 options. He said, option #1, you can circumcise your child. And I think this is the best option. I think it's the normal one. It's good for health, but the most important factor is psychological, because if all the boys in the neighborhood are circumcised, you don't want Johnny to be the only one with a foreskin, because he might not grow up normal. That's actually the language he used in the book. He won't grow up normal, which some of us took as code for you don't want him to turn out gay, so make sure you cut his foreskin off. Option #2 was, from the day you bring the baby home from the hospital, you can pull back the foreskin, make sure you pull it all the way back, rip the adhesions. It's going to be very painful. There will be a lot of crying by the baby and probably just as much crying by the mother. He actually said that. And he said, but that's your other option. And then he listed a third option, which he said, or you could just leave it alone until he's a teenager. That's what they do in most of the world, but I don't recommend that. So the message was very clear. You really should circumcise your child. Well, simultaneously, the US was experiencing tremendous inflation, and unemployment was practically zero, because we were the first country to really recuperate from World War II, from the tremendous economic hits of that. And we were really headed for a super inflationary period. So President Truman put in wage and price controls, which was a dramatic, draconian approach to this problem. So you couldn't compete for employees on salary or hourly rate or anything like that. You couldn't raise it. What wasn't mentioned was benefits. So suddenly, Americans went from mostly not having health insurance. If they had circumcision done, they paid for it themselves, and it was a $25 fee that you paid to the doctor to get your kid cut back then. But suddenly, every company in America, every employer was offering health insurance and dental insurance and vision insurance and a company car and 2 weeks paid vacation and more. And suddenly, everyone was getting insured through their work. And these insurers took the advice from Dr. Spock in his book and made sure that in the maternity benefit, infant circumcision was included. It was in every damn health plan in this country. So from 1945 to 1960, we went from, 65 to 70% infant circumcision, right on up to 90%. That's how we got ourselves in this universal circumcision problem. And the rate has been coming down since then. I'm going to deliver some bad news to you all. There's a lot of numbers put out there. Some of the misinformation, disinformation that we were talking about yesterday that I think is not helpful to the movement. There's several things that intactivists say that are incorrect and I think ultimately hurt us. One of them is, circumcised men are really unhappy about this and they're not able to function sexually. As much as I'm a dedicated intactivist, that's bullshit. Most circumcised guys have a great sex life. And the fact of the matter is most circumcised men in the United States are happy to be circumcised. They don't have a problem with it. They're either neutral on it or they're happy. Really a minority are dissatisfied. But here's the kicker. when they do these surveys, and we have seen many of these surveys, yes, something like 85% of circumcised American guys are content or even happy about being circumcised, but 90% of intact guys are happy. So the satisfaction rate is even better if you leave your kid alone. That's the part that they leave out, that they don't tell you about that, because it's implied that circumcised men are happy, so intact men must be unhappy, and that's not the case at all. Another thing that is real misinformation that they tell people is that the rate has gone under 50% in the United States. That, you know, we have achieved the tipping point, and they point to things like the 2010 CDC thing that got reported at the Vienna AIDS conference. I was there, I was in person, I was working the Intact America booth at the AIDS conference in Austria, and I was talking to Dr. El Bashauri, who was with the CDC, young guy. He was the one who was narrating when the CDC put on the screen in a session that the US infant circumcision rate had dropped from 56%, which at that point was the most recent HHS hospital discharge survey, which was entirely voluntary. He said it's gone from 56% to 45%, and it's currently 34% in the United States. And of course, we leapt into action. Brian O'Donnell, another Intactivist, was in that session with me. We immediately reported that back to Georgianne Chapin. Georgianne contacted the New York Times, and ultimately the CDC retracted that and said, oh, it was some kind of an error. We had a vendor who ran these numbers for us, and we shared them with the whole world without vetting them. So they had to backpedal on that. But a lot of Intactivists got the wrong message from that and thought that the rate is now really low. And I see it every damn day on social media. I see it on Reddit. I see it on X, Twitter. I see it on Blue Sky. I see it everywhere where Intactivists are saying, well, you know, now a majority of American boys are being left intact. Well, I have a cold bucket of water for you. The US circumcision rate currently stands at somewhere between 70 and 72%. And that is calculated by combining the HHS figures of 56% for the hospital discharge. And again, I stress that that's entirely voluntary. We don't have a data collection system like countries with universal health care do, because they pay out on almost every single procedure. So they keep detailed records. They can tell you down to the last boy in the country, except for the few that are done in private clinics. They can tell you how many circumcisions were done in any given year in their country. We can't. We don't keep data on that. Almost intentionally, we prefer the private system, so that is not made available to the public. But we do have an Intactivist colleague. I'm not going to share his name because he doesn't want any recognition for this, but he is an actuary. He knows statistics very well. He's worked with insurance companies for many years. He knows how to interpret the data, and he paid privately out of his own pocket to purchase the entire US's worth of data from HHS. So instead of those top line numbers that we were getting, like the 56%, he actually got it for every single hospital in the United States. And that's how I know that in Miami, the area where I live, that most of the hospitals have about a 28% infant circumcision rate. Some of that is the high Hispanic population that we have. But there is a particular chain of hospitals owned by Baptist Health where the circumcision rate is 85%. And so it is painfully obvious that that is a revenue center for that hospital. It's no coincidence that the 3 hospitals that they own in our area have an 85, right across the board, 85% circumcision rate, when the regional average is 28%. So something is going on there. They're seeing it as a moneymaker. And so clearly their doctors are being instructed to sort of push this. And this is also the area in South Miami where we had a somewhat famous lawsuit about 10, 12 years ago, where the parents had said, we don't want our son circumcised. The mother was giving birth in the hospital. She said, my family doesn't do it. My husband's family doesn't do it. We see it as mutilation. Their doctor the one who delivered the baby was off the next couple of days, and they had a substitute OB come in who, without paying any attention to the chart, whatever, took the baby off and circumcised him. And the parents sued, and they settled for a really significant amount of money. You can look it up. It's the South Miami case. But that has happened all over the country, that the parents' wishes are not observed. And by having this granular level of information down to every hospital, we can spot the trends. We can spot the individual institutions that are clearly soliciting this the most because they have outlier high infant circumcision rates compared to their areas. And it's no guarantee when a state gets out of the Medicaid business of infant circumcision, because some places, like in California, we've seen this in the East Bay, there are signs in the maternity ward saying, California hasn't paid for infant circumcision on Medicaid since September of 1982, but talk to us because we know ways around that. And what they're basically saying is they're coding it differently. When they put it down for insurance reimbursement, they're putting it down as a different code, which is essentially fraud and subject to triple damages. So there are places where the doctors and the nurses, and most importantly, the hospitals that see this as a revenue center, are not willing to let go of this, even if the state defunds it. So they're looking for sort of wily ways that they can still collect the money for this, which is why the rates are not as low as they could be. They really should be much lower, even here in Oregon, even in Washington State, Nevada, California, and a bunch of other places that don't pay for it. But back to the law side of it. So I ended up doing my law studies, first in Virginia and then in Chicago, in Illinois. And while I don't practice law, I've been a part of many of the legal cases. And I was one of the first founding people of ARC, Attorneys for the Rights of the Child. Steven Svoboda and I, when we were doing our initial interviews for interns for ARC, we did those in my office in San Francisco. And it's really important that we have the legal side of this. We've not had the successes that we should have had over the years, and we've heard some incredibly disappointing things from judges. But the thing that we have got to get, the critical piece, and you'll be hearing this from my colleagues when they come up here and talk about the legal side of this, is we have not proven circumcision is a harm, to the extent that a court wants to hear that. Now, there have been some nuggets. We had the Cologne Appeals Court in 2012 actually state that circumcision was a de facto harm. We had a British judge right around the same time say that circumcision is a harm. Now, we've always relied on English common law for saying parents can do, pretty much whatever they want for their kids, particularly when it's in their best interest. But what we have got to keep hammering home is, number one, infant circumcision is not a medical procedure. For it to be a medical procedure, it would require a diagnosis of illness, there's some disease going on, injury, something has happened to the penis that needs to be repaired, or a birth defect that is, and not just a defect, but a defect that is obstructive and interferes with life functions. Maybe the baby's having trouble peeing or something else. So unless it is illness, injury, or obstructive deformity and has a valid diagnosis of that, there is no medical basis for doing infant circumcision. In fact, I've kind of dismissively taken to calling it recreational circumcision because I can't think of another term that actually describes what we're doing in the United States. And we're doing parents a tremendous disservice by not informing them fully. I mean, informed consent would list not only all of the risks of doing this, but it would also include the benefits and functions of the intact penis. It would talk about the importance of the frenulum, the importance of the foreskin, the importance of the meatal lips at the end of the urethra for keeping the urethra free of pathogens and disease. And those meatal lips, as we were just discussing a few minutes ago, they pretty much disappear in neonatally circumcised boys. Probably less than 20% of men who have been circumcised as infants still have these important meatal lips that close shut. And if you don't know what I'm talking about, approach me later and I will be happy to graphically discuss what the anatomy involved is. But this leads to the disingenuous information being put out by the other side. There are things that by omission and by outright lying, they're really clouding this issue for not just the medical profession, but for the courts. The courts are relying on these things that they're reading and seeing. They're relying on the AAP, they're relying on the CDC, which incidentally, the CDC is not conducting any of its own studies on circumcision. They're relying on HHS, they're relying on the AAP, and they're also kind of misstating what their findings were. But I'll give you an example. We talk about risk-benefit analysis of circumcision, and they say, well, the health benefits are this, this, this. Yes, they're speculative. Yes, they're theoretical, but we consider them to be real potential benefits. And then on the other side, we have risk. What is risk? Risk involves not just surgical risk, which is what the AAP is talking about. They're talking about, did the baby bleed out in the circumstraint? They're not talking about any other risks like skin bridges that develop, skin tags, nicked glands, a crooked scar, keloid scars. They're not talking about any of these complications from circumcision. They're talking about a very narrow subset of risk, which of course benefits their conclusion, their argument. And when they're talking about benefits, they don't highlight the fact that the risks are very real, but the benefits are speculative. And in the real world, in evidence-based medicine, we don't really see these benefits playing out. It's not like the US. There has never been a single study in the United States that has definitively shown that our practice of widespread circumcision since the 19-teens and 20s has ever protected American health to any extent. That study does not exist. So we just like to have this narrative that we're circumcising boys to protect them, but it's not backed up by any real world evidence. So when they talk about risk-benefit is a very real analysis tool. It is the tool that you use when you're choosing between treatments that are absolutely necessary. Let's say you're diagnosed with cancer and your doctor offers you 3 different options for treating it. That's when you look at risk-benefit, because you know that the procedure, something has to happen, and you're trying to look for the least damaging or the one that gives you the best chance of a successful outcome and of surviving. The correct analysis tool for an elective procedure like infant circumcision is not risk-benefit. It has never been risk-benefit. It is advantages, disadvantages. And that would take into account the entire universe of functions of the foreskin and the frenulum. But they don't want to use that analysis tool because they will never be able to get to their conclusion, the one they want, with that. So they mislead the public, and the public says, oh, risk-benefit, that sounds like a great way to evaluate this. No, in medical ethics, that is not the appropriate yardstick for this situation. So that's an example of one of the ways that they mislead us, and the public has no idea because they don't know that that risk-benefit is not the appropriate tool to use for that. Why are insurance companies paying for infant circumcision at all? I saw an article when I lived in San Francisco. I was reading the New York Times, and they had an article called "The Supreme Court of Medicine." And it was a really fascinating profile on a company called Milliman and Robertson. They still exist, but they have a different name. They were bought up by another company. But in 1997, shortly before I was fired from my executive position for my activism, I was really riled up about this. I really, wanted to explore every possible avenue to bring an end to infant circumcision. So what did I do? I researched Milliman and Robertson. What's the next thing I did? I got on the phone to Seattle and called them and told them who I was and told them that I wanted to talk to them about this, because what the article was about was how some of you might remember this. This was around the time that they were kicking moms out of maternity wards within 24 to 48 hours after giving birth. It used to be back in the 50s and 60s that you were in the maternity ward for 5 to 7 days, and every day they came in and put your makeup on you and served you bonbons and fruit. And, you know, it was basically after you gave birth to the baby, it was a vacation in the maternity ward for a while. Milliman came in and said, nope, bottom line, we got to be looking at this. We're going to kick you out after 36 hours. If the baby's healthy, there's no reason you shouldn't be at home. They did this with other things. They opined on things like cataract surgery. Should you do both eyes in one day? They opined, there was almost not a medical procedure that could be done on you that was not decided on by Milliman's expert team. And importantly, about 80% of the health insurance companies in the country contracted with Milliman and Robertson to tell them what should we be paying for and how much should we be paying for it. So I called them up. I talked to their vice president. I'm not going to mention his name right now. His name was David, but I'll save his last name. He was a nice guy, and he was VP for this area for policy stuff. So I explained who I was. I explained that, you know, I was an intactivist. I had to explain what an intactivist was. I told him I'd given interviews to the Times of London, to the Wall Street Journal, to USA Today. I'd been on television. I'd done a bunch of things. I was in Tim's movie, Whose Body, Whose Rights. And if you haven't seen that, by the way, look for it. It's on YouTube, right?
It's on YouTube in the American Archive of Public Broadcasting.
Okay, it's a great movie. It was groundbreaking because no documentary had really been made about this up until then. And as Tim said, it was phenomenally well received. So I mentioned that to David. And I said to him, so let's talk about circumcision. And he was like, what? And I said, well, you guys don't seem to have an opinion on circumcision. You haven't given a recommendation to any of your subscriber companies. I mean, how much should be paid for it? Why is it being paid at all? What are your thoughts on it? Should it be done on a healthy newborn? And he said, well, what do you see as the problem? And I said, okay, well, let's talk about the foreskin. I mean, it's a normal part of anatomy. It's blah, 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 and I talked for like 5 minutes. And there was silence at the other end. And I said, are you still there, David? And he said, yes, I'm just trying to adjust to the fact that you're able to say the word foreskin without stuttering. It just, the few times in my life I've ever had to say that word, I get like really nervous. And I said, well, you know, in your field, you're going to need to get over that. And I talk about foreskins every day. So yeah, I don't stumble over the word, but I would appreciate it if you looked into this for me and told me why you guys have not made an official recommendation on this. And he shared a private story. He said, you know, my son was born here and our insurer was Group Health of Puget Sound. And I said, well, you know, they don't cover it. They dropped it in 1989, I believe it was. And he said, oh, my son was born in 87 and they covered it and we did it. And I said, well, you might want to look into this because, you know, since you guys didn't make a recommendation on it, they looked into it themselves, decided that it was not cost effective and was not helpful. And so they have dropped it. So right there in your own backyard, they're not paying for it. And I believe they might still not be paying for it, but we've had mixed results with this. Tim will remember this. Blue Cross and Blue Shield of Pennsylvania, they dropped infant circumcision in 1986, and they put it right back in 1989 after 3 years of seeing that their competitor health plans did not drop it, and they were tired of being the lone one just hanging out there. So they put it back in. We want to prevent that from happening. And one of the best ways to do that is to get Medicaid circumcision out of your state. So David went and researched this, and he said, I'll call you within a week. I hadn't heard from him in about 10 days. So me being the dogged follower up that I am, I called him again and I was like, hey, remember me? And he said, yeah, I looked into this. I talked to our board of directors. I talked to our ethics panel about it. And he was a good guy. Don't get me wrong. David sincerely wanted to answer my question. He sincerely wanted to help us. But he said, I was told, do not ever say the word circumcision at this company again if you want to continue working here. It was the third rail of medicine. You could not bring it up because it was a hot potato. It had religious overtones, it had cultural overtones, it had historical overtones, and they did not want to go into this. And I thought to myself, if the number one health consultancy in the United States, who is, as the New York Times said, the Supreme Court of medicine, their word was law on what gets covered, if they would not touch infant circumcision, this went even deeper. We talk about going down the rabbit hole on circumcision. This suddenly, opened up, another mile of rabbit hole. That there was a lot of stuff going on because they would not touch it. And David apologized to me. He said, I am so sorry. I didn't know this going into it, but you can appreciate that I can't push this with my superiors because they'll take action against me. So that's how deeply ingrained this is in the United States and what a terrible problem it is. But, so number one, I'm trying not to swear, get the money out of infant circumcision. It has been subsidized for too long and subsidized on the taxpayer dollar. As people said yesterday, 40 to 45% of births in the United States occur under Medicaid. Can you imagine the impact it would have if we got all the states to stop paying for it? Now, we like to say, Britain got out of the circumcising business back in the very early 1950s. The National Health Service came into effect in 1948, July of 1948. In fact, we had a symposium at the University of Oxford to mark that. We were all there in the summer of 98 for the 50th anniversary in 1998. And we had a doctor there, probably the country's top pediatrician, Anthony Rickwood, was that his name, Rickwood? He said, we have an epidemic of later circumcisions in the UK. It's as high as 15% of boys who are being circumcised for phony phimosis. We thought we got out of the circumcision problem in the 1950s, but doctors continued to cut boys anytime a parent would bring the kid in and say, his foreskin's not going back, or he's ballooning, or whatever. The correct thing is for the doctor to say, this is normal, leave him alone, it'll resolve by puberty. But they had a really, I'd say high circumcision rate from toddlers to school-age boys. So he said, we're going to bring that down. And indeed, he made a pledge at our symposium, and within, I think about eight or 10 years, they brought the rate down in the UK from 15% to 5%, which was great. And we need doctors in the US who are pledged to a similar Manhattan Project to tackle this specific problem. But right now, we have not engaged the medical profession to that extent. People say, why can't we emulate what the UK did? Well, again, they have a universal healthcare program that essentially doesn't pay for this. And I want to clear up a mistake. A lot of Americans thinking in American terms are thinking that the UK delisted infant circumcision or took it off their formulary. There is no formulary. That's not how the NHS works. The NHS works on necessary procedures, and if a particular doctor requests something, they'll review it, but they just didn't have doctors coming to them saying, I need to circumcise this particular healthy newborn boy. That's why it isn't getting done. Now, Canada had a formulary, and they used to circumcise with all their provincial health plans, and starting with Alberta in 1982 and then BC in 84, we were talking about this, Mike, the other night at dinner. Province by province, Canada got out of the infant circumcision business, which is what has essentially brought the rate down from about 85% at its peak to 20 to 25%, depending on the region. Now, the Maritimes don't circumcise at all. They haven't done that for decades. It's more a question of Ontario and some of the Western provinces. So, and Canada has a unique situation. They had a law that said if our national health plan, provincial health plans, are in the business of doing a procedure, private medicine cannot compete with us. So if we do knee replacements, there can be no private knee replacements. Once they got out of the circumcision business, it opened up the door for circumcision clinics to proliferate, which is why Neil Pollock started operating clinics all over Canada to do circumcisions. Australia, there's a myth that in Australia, Medicare, their national healthcare program, stopped paying for circumcision, and that's why it ended. That is not entirely correct. To this day, in 2025, Medicare is still paying for infant circumcision in Australia because the legislators cannot get a spine and remove it. There's an allowance of, I think, 250 Australian, which is, I don't know, like 25 cents. And so they're still paying this, and that money can be paid directly to a private circumcision clinic, so that it lowers the cost to the family of getting a baby circumcised. I'm kidding, it's something like $15, but I'm sorry, $150. But the point is that Medicare, circumcision in Australia didn't stop. It went from a peak in the 1950s of 95% to approximately 8 to 10% today. And that did not occur because they defunded circumcision. They're still paying. Now, thank God, they're still paying the same amount in 2025 that they were paying in 1980. So that has had some effect. But that is not the real reason. In New Zealand, it went from 98% in the 1950s to essentially 0% now. And that was, again, not because of a defunding question, because infant circumcision was covered under they had national health care starting in 1939. They were supposed to do it together with the UK because New Zealand and the UK are very closely aligned medically. But something, I don't remember exactly what, happened in 1939 in the UK. Anybody? World War? So they deferred the start of the NHS from 1939 to 1948. But New Zealand went ahead with it. But they got out of the circumcision business. And what do these all have in common? The answer is not they defunded it or it wasn't included in their national health plan, because as we see, some of these countries still kind of pay for it. The medical profession turned against it. Never in the history of the world has any country or culture or society or religion taken up infant circumcision because of a pressing health need. Nowhere. No, not in the US, not in, Canaan in ancient times. Nowhere. Nowhere have they done this because there was a foreskin problem. Similarly, no one has extricated themselves from the circumcision problem because parents suddenly lost interest in it or asked doctors not to do it. It was the medical profession. That is the consistent theme, the medical profession turning against this first. So keep that in mind. I'm not saying it can't happen in the United States, but it would be a bit of a miracle if that happened. So we need to focus on getting the money out of infant circumcision, all the subsidies. And as someone said yesterday, it's a direct payment from the insurance company to the doctor or the hospital. We need to focus on turning the minds of doctors and nurses on this and stopping this being a revenue center for doctors' offices and for hospitals. Those are, in my opinion, the most effective places we can put our resources to getting out of the scourge of infant circumcision in this country. There's a million other things that I want to tell you guys. I hope some of this has been helpful. If you want to follow up with me later, I've got a lot more to say. But thank you for listening. I hope it helps paint a little bit better picture of where we are and maybe puts a roadmap on where we want to go with law cases. So where we're going to go from our historical situation to hopefully much more successful litigation moving forward. Thank you.
Thank you so much. As we promised, we had a great lineup. This mic is picking up, okay. So I guess we'll maybe have a couple questions for Martin. Martin's going to be here, so as you know, he knows practically everything about this movement and the history and how, what works, what doesn't. I see you, Brian, then we'll come to you, Tim, and then Shay, and then we're going to move on to the next speaker, who I'm also excited to introduce. So, Brian.
That was a great speech, Martin.
Thank
You
you.
were talking about reaching healthcare professionals, and I bought this program. I don't know if this could be of use to you or anyone else, but it's like a $6,000 AI program. And what it does is it searches daily billions and billions of Google searches. And it can tell you who is searching for what in the country. So you could pull up infant circumcision or my wife is pregnant or whatever your search criteria is. And it'll update every 24 hours and give you the names, addresses, number of credit cards, home addresses, credit score. I
That's
mean,
scary.
everything on anybody that's doing these searches. And you can file off an advertisement or a leaflet or an informational or something like that. The owner of the company also gave me, we had some problems with the program for a little bit. He gave me a $27,000 upgrade called the B2B software. And what this does is it has all the tax codes listed in the United States for every business. So this would be hospitals and everything. And it gives you all of the employees of these hospitals or car dealerships or whatever you want. And we can fire off informational, whatever you create. So if that would be a benefit, talk to me later.
Yeah, I mean, there could be a lot of uses for that. My feeling is we need to sort of carpet bomb, and I mean this in a non-violent sense. We need to carpet bomb doctors, and we need to carpet bomb hospitals and any other medical professions. Oh, that's the thing. Is this better? I get to say carpet bomb louder. I think we need to really target as many health professionals as we can with factual, useful information to them. And we can determine individually what that is. But there is a lot of good stuff that is not reaching the right people. And it really could make a difference because, as I said, the one clear, consistent, unifying issue in all the places that got away from infant circumcision, and I'm talking about, South Korea is not infant, they were like 10-year-olds, but South Korea, New Zealand, Australia, Canada, South Africa, the Anglo-South Africans. Among the whites in South Africa, you have two big groups. You have the Dutch Afrikaners and you have the English people. The Anglos were doing it and now they're out of that business. So yes, we do need to target them like that. And so I'd love to talk to you about the potential reach of that program. Any other questions? And it should scare you that I have a whole stack of cards of things to talk about, and I only talked about 3 of them while I was standing here.
Martin, thank you.
Who wants to talk next?
So Tim and then Shay, and then we'll go to Joe.
Okay, yeah, Tim.
Thanks for that trip down memory lane.
Yeah.
And thanks for sharing this very valuable history for everyone here. I have a request and a question.
Yeah.
Could you please update the audience on Benjamin Spock and the position he took before he passed?
Yes, so in 1946, in his famous book, Baby and Child Care, as I told you, he offered 3 options for circumcision, but strongly recommended infant circumcision. Benjamin Spock never had a son, but in 1989, in an interview with Red Book magazine, he was asked about his position because he had come under fire from intactivists and some other people about his recommendation to circumcise and the influence it had, and it was a very real damaging influence. And he said, I'm currently, whatever it was, 85 years old. And he said, but if I were to have the good fortune to have a son, I would not circumcise him. I have learned so much over the intervening years. But that comment came 53 years too late, right? I mean, that's how many years there were between his book and when he had that interview with Red Book. But my God, when I think about if he had taken that stance in 1946, what a different landscape we would have today.
Yeah. The question is, and I know I've asked you this personally before, but for the sake of the audience, do you think there'd be any value in repeating your Milliman and Roberts experience today, where the culture may have shifted, and if there is even such a company like Milliman and Roberts, a successor, that could influence insurance companies on this issue?
The answer is yes. I think about this from time to time because I think that no company has an 80% concentration of power like Milliman and Robertson did back in the late 90s. Now it's probably spread across several other companies, but what hasn't changed is that most of the insurers, and forgive me for hesitating because this is a middleman that really shouldn't exist.
Right.
In the United States. They don't have a real job except taking your money and denying you coverage for things. Other countries think we're insane for having this layer in there. But either they have gone to their own in-house evaluation methods of every procedure, or they're continuing to use consultancies, but I don't think anyone has the power that Milliman and Robertson did at that time. So maybe 20% here, 30%
Right.
here, advising the different insurers. But we should definitely find out who those supreme courts of medicine are today and try to convince them to get out of the infant circumcision thing. Because even more than in 1987, when I was doing that project, I think the message of getting out of this will resonate today.
Wow. Hi, Martin. Thank you.
Jay.
This is really great. That was wonderful. You know, I was thinking about this. You talked about advantages and disadvantages, right? And I'm thinking about, unfortunately, the cultural advantages to being circumcised, you know?
And the AAP, by the way, factored that into their horrible 2012 conclusion, because in a subsequent interview, one of the task force members said, oh no, the health benefits definitely don't outweigh the risk. When we said that the potential benefits, we were absolutely including cultural and religious. If you don't add them to the mix, the scale tilts the other way.
Yeah, that's just what I was thinking. I mean, some people are, you know, there's a big spike in Latinos in California circumcising their children because it's this whole concept of, oh, well, they'll fit in better.
Assimilation.
You know, so I was just wondering if that was part of the calculus, and I'm wondering if that's even an excuse for, you know, this is healthier because the kid is going to have an easier life.
Because it helps with assimilation. In my opinion, that's a bullshit reason.
I totally agree. I'm just wondering if that's part of their calculus. It's one of their, yeah.
Well, certainly the AAP took that into account. They didn't say it explicitly. They left the impression that they were just talking about medical benefits, and I think the public bought it that way. I think a lot of people would be surprised and even horrified to learn that they were talking about intangibles like that.
Okay, Martin, you're very popular. We're gonna do 2 more and then no more. Sorry.
Okay.
Okay, maybe 3 more, but make them quick, Martin. And then we're done. Neil, you're last.
Thank you very much. I've learned a great deal at this conference, really, and I think that we would all benefit from having a strategic planning meeting from time to time, so we're not duplicating each other's efforts, going down blind alleys. You know,
Yep.
people like you have enormous wisdom to share with us, and I think that could make us all more effective.
In the early days, we were doing that, but then again, the core group of intactivists were about 40 of us, and some of you were sitting here in the room. We used to have retreats. In fact, the one that's most meaningful to me was in 1994, Queen Anne Hill in Seattle. We rented out 2 houses, and so we had our own little compound for the weekend, and it was a strategic planning / leadership retreat. And we did 3 of those. We also did one in Evanston, Illinois, and we did another memorable one in Cottonwood Canyon at somebody's family home, right? So Steve Scott hosted us for another of those, and they were very effective. But, and it's a curse and a wonderful thing that intactivism is now thousands and thousands of wise people. So I think it would be difficult, but that doesn't mean we shouldn't aim for doing it and see who would be able to come and share their wisdom and try to reduce some of the duplication.
Just one other quick point. Every doctor has liability insurance, medical malpractice insurance.
Mhm.
And if we had enough cases that demonstrated that circumcision is medical malpractice, and at some point we will have enough cases, we need to get that information out to obstetricians and pediatricians because they're all risk averse.
Well, to them and to the insurers, we have to
Right.
say to the insurers, if you want to stop paying out millions of dollars for circumcision cases, and hopefully one day we'll get to that point, we have to let them know. I do want to share two things really quickly. One of them, and let this sink in, before I take the next question, let this sink in, because this is something I've really been focusing on over the last 12 months. 99% of the circumcised males on this planet did not choose it for themselves. Think about how insane that is. They either were routinely circumcised or religiously circumcised, or their parents took them in for, some health issue that could have been solved another way. But of the people that have actually chosen to lose their foreskin, that made that decision for cosmetic or health or whatever their personal reasons were, we're talking about 1% of the circumcised population. That's crazy. Go back and crunch the numbers yourself. You'll come to the same conclusion that I did. And the other really important point I want to make is, you hear people saying, well, circumcision is justified because of these 3 RCTs in Africa back in 2007 that showed that it has a very real, dramatic 60% reduction effect on the uptake of HIV. Cannot stress enough, and this was even stressed in the studies when they were published in the Lancet, it's only applicable to that region, to that cohort, to that time and place. They say, do not extrapolate and make any or reach any conclusions about children or infants from our study. And yet that is exactly what the AAP did. That's exactly what the CDC did. That's exactly what so many of these people advocating infant circumcision are doing, like in North Carolina, where they want to justify continuing it because circumcision has a beneficial effect against HIV. Not a single study has been done to show that this is beneficial in children. In fact, the Canadian study showed just the opposite. There's no benefit. And I can't stress enough what a breach of medical standards, medical ethics it is to extrapolate the findings of one study to another population. You just don't fucking do that. That it?
I have a kind of dangerous question.
Love
and
those.
Also an unusual question. I'm going to include some context. I want to make sure it's very loud and clear. It's important that those of you who have been cut, that you speak to us, because I'm from Florida and I'm actually here because of Dwayne Patrick Van Linker, who's with Bloodstained Men, and now I'm with Bloodstained Men. I'm here all because of that. And I want to add that I'm born in South Miami Beach, Florida, raised in Plantation. And this is where the dangerous question comes in. So I know from personal experience, an HIV medication receiving individual, through Dollars for Doctors, it is known that pharmaceutical companies, for example, will give incentives to doctors to change the medications, like an HIV medication be changing to a new medication, and then that patient being threatened that for even mentioning that they will lose their much needed medication. And so I wondered if circumcision, if there's any benefits from any particles or waves down the ripple pool. And then the other concept is how there's like this behavioral engineering nudging technique that is done with organ donation, that you're automatically an organ donor unless you opt out. So I wonder why there isn't the same application towards this. And then the other thought process that came to mind is a movie that was mandatory to watch in school, which was The Business of Being Born, and kind of how it references how some people have never seen a natural birth because of the encouragement. So I feel like this is similar, and I keep seeing that. So I guess those are some of the territories I'm navigating through this.
Well, you're absolutely right. In a normal world, this would operate differently. But the United States is a very capitalistic, very money-driven society. And so that has really infiltrated the circumcision question. And that's why you're going to see skewed motivations. You're not going to see things the normal way, as you just described. I don't think there's any, particular pharmaceutical or doctor issue about inhibitions, although we have heard anecdotally of many doctors who are afraid to speak out about circumcision within their own practices or at their own hospitals because they will be basically blacklisted. They will be unwelcome in their own professional cohort if they speak out publicly against circumcision, which I think is crazy. How did we get to this point that you can't advocate for children, you can't advocate for natural bodies without a professional repercussion? I mean, yeah, it's happened to many people within our own movement. So I very much appreciate your point on that. And that's one of the things that we're hoping to cure or address with the work that we're doing. And I live in Broward, so.
There we go. Yeah, so my name's Neil,
Hi, Neil.
and my question is, we talked about the money that's gone into the medical community. We didn't really cover anything about what I'll call organ harvesting, and in that regard, for example, Skinmedica,
Right.
which makes a neonatal fibroblast cream, cosmetic cream. Is there nothing that's actually being done to address I call it, I think it should be illegal for them to be able to do that, sell it at a profit.
Yeah.
And it's just not the cosmetic, it's the medical community or the researchers that go along with it. I know there's some benefits that have come from it, but it's got to be able to be collected from something else.
Well, I mean, yes, there are going to be lawsuits about this in the future because they're not, we've talked about informed consent, and that was basically one of the issues that's being brought up by folks. And in New Hampshire, there's an informed consent bill in particular, but the parents are not being told what the use of the skin is. They're basically signing a waiver. They're signing it all away. They're saying the hospital can do whatever they want with it. Traditionally, it was medical detritus, it was medical waste, and it was incinerated or just thrown away. But this has been a rising problem in recent years. I don't happen to consider that it is the biggest problem that we're having with circumcision, because really it started out with the companies that were creating burn tissue, a very beneficial use of this. But you can actually grow the tissue. You can grow a football field size of burn tissue from one infant foreskin. So you don't really have to cut that many children. So you could do it strictly from, you could do it from Jewish bris foreskins and take care of the entire industry's needs. There's no reason that you have to cut 1,450,000 infant boys a year like we do in the United States, which is 72% of the boys, to achieve this. And this isn't just my number. Intact America's out there with a 75% number. And I'm happy to go through my calculations with anyone who wants to see this. But the point is we're cutting an insane number of boys for what might be a very tiny beneficial side effect of it.
It's basically just double dipping, and because the parents are paying for the circumcision and then turning around and the hospital selling it to.
Oh, absolutely. But I don't think it's a significant source of revenue for them yet. It may be in the future. But as others said yesterday, we're spending about $700 million a year to circumcise 1,450,000 American baby boys every year. And then we're spending another $300 to $400 million fixing the complications of that. So it's $1 billion industry before you even factor in the illicit use of that tissue. So I concur with you.
I will contend, and I'll let it go, but I will contend that even one child that's sacrificed for that is
You are
too many.
absolutely right.
So, thank you.
And that's why I had one heck of a quantum Maryland lawsuit.
Yes, absolutely.
Well, thank you so much, Martin. We really appreciate you sharing your considerable knowledge. I'm really happy we were able to make it. And you got a hot mic on, Martin, so.
Got a mic somewhere.
Yeah, let me grab that from you. So we are doing a slight shift in the schedule. So Zenus Bear was next. He will go after lunch, just in terms of timing. So it is my great privilege and honor now to introduce the most published, the leading legal scholar in genital cutting and how we protect children from this type of harm. Also a great privilege of mine that he is co-counsel to me on multiple cases, including the Oregon case. Big round of applause for Peter Adler.
Thank you, Eric. Thank you so much, everybody. It's great to be here. So I teach at University of Massachusetts, and I got an email that said, well, I'd like to give a lightning talk, 2 minutes long. And so I was thinking, well, I'd like to talk about this subject, but I also enjoy using technology in the classroom. So I said, can I give 2 talks? And they said, sure. So my first one was how to use technology to improve your teaching. And so I started talking and everybody was totally into it. They thought it was great. And then I said, okay, fasten your seatbelts. We're going to talk about genital cutting. And their jaws just dropped. So I'm pleased to have a friendly audience and more time. So, yeah, so I want to start talking about how I got into the movement. And I'll just talk from memory. It's sort of etched in my mind. And so my son was born in 1987, and my wife was nursing, and I was, in the middle of the room and just enjoying the peace and quiet and love of having, my son. And then I heard a voice at the door said, "Have you decided whether to circumcise your son yet or not?" So I remember thinking, whoa, I never thought about that. And then thinking, oh, well, there must be some medical reason for it. And then I kind of visualized a, snip of a useless piece of skin. And so he started talking to me, and he said, according to the American Academy of Pediatrics, it's not medically justified. He said, urinary tract infections, 1% can be treated with antibiotics. And then he said, it slightly reduces the risk of penile cancer, but it's a rare disease in old age. And you can avoid penile cancer by washing the penis and not smoking. And then I believe he said it may slightly reduce the risk of some sexually transmitted infections. This was before HIV. And he said, but that's not a reason to circumcise because people can practice safe sex. So I figured, okay, the answer is no. But he kept talking to me. Then he said, well, some parents choose it for religious reasons. And then I said, I'm not religious. And then he said, well, some people choose it for cultural reasons if it's common in the culture, which of course it is in the United States. And I was starting to get annoyed. So I said, I don't care what people in other cultures do. I was thinking of my son, who cares what other cultures do? And so then here's the, what really got me started in the movement. He said some parents choose it for aesthetic reasons. And I said, no, personal reasons. I said, well, what do you mean? He said, well, some parents choose it if the father is circumcised, they want the son to be circumcised. And I remember thinking, like, matching penises. And I remember thinking that there can't be any law that allows that. I started thinking back to torts class in 1983 and thinking, doctors have to justify operations, but he just told me it's not justified. So the whole thing was, threatening, confusing. Well, I left out, my wife's a physician, makes every medical decision for the family. And I said, I need your help. Can you help with this? She said, you have a penis, dear, you decide. Sweetheart, she said, you decide. Yeah, so I mean, this was all, very uncomfortable. And I'd say it took until now to fully understand what happened in that 2 to 3 minutes, 2 to 5. And what did I choose? Well, I'll let you know. We'll come back to this. Yeah, so I have kind of a privileged background. I'm quite fortunate. I went to Dartmouth College, graduated Phi Beta Kappa. I went to Cambridge University, got a master's degree with honors. I went to Virginia Law School where Samar is. I was on the Law Review and the Journal of International Law, and I published an article in the Law Review. So I became a partner in litigation in a Boston area law firm, practiced law starting in 1983. But I actually like teaching and scholarship a lot more. So, Tim said, what's our wheelhouse? My wheelhouse is legal scholarship and writing legal arguments. So I've written 10 articles about genital cutting in the law, published in some leading journals. One is Journal of Law, Medicine, and Ethics with Stephen Svoboda and Robert Van Houw. Then I published Circumcision is a Fraud in a Cornell Law Journal. Then last year I was awarded a fellowship to Cambridge University to do legal research, and I wrote 2 more articles there that I'm going to talk about. In fact, one of them is the basis for this speech or talk. So, I'm a litigator. I was a legal advisor in the case against the American Academy of Pediatrics. The AAP moved to dismiss. The judge gave us a chance to amend the pleadings. He said, you're alleging fraud. Tell me what they knew, when they knew it, how do you know they intended to defraud the public? And so I spent 85 hours researching this, and I gave it to the lead lawyer, and he didn't use it. So then I went to the client and said, trust me, this is important. And he went to the lawyer who said, don't worry about it, and we lost the case. Now, I'm not saying we would have won it with my research, but that's no way to fight against the American Academy of Pediatrics. If you're going to take on the medical profession, you better have a lot of firepower and have a lot of money behind it. So I was lead counsel in a lawsuit against the Commonwealth of Massachusetts. And it was based on an article I wrote saying it's unlawful to use Medicaid to pay for circumcision. So I remember co-counsel and I, we found out who our judge was, and he was Jewish. And we're thinking, oh my gosh, like we're going to lose. And it turned out the opposite was true. So I think this is really important to say. The judge was Jewish, but he's completely neutral. And he ruled in our favor in a 26-page erudite opinion. So it was a huge win. By the way, I didn't want to bring the suit, but Ronald Goldman, the psychologist, was going to bring it anyway by himself. So I figured it'd be better to have a lawyer. But anyway, we lost on appeal. When I went to argue on appeal, 2 of the judges, the men, they were just like this with their arms crossed. Like, we're not even listening to you. And the decision, I don't really understand the decision. I think it's wrong. But unfortunately, it's a decision against us. So it's an example of how, you can bring a case and lose and establish bad precedent. I'm really proud to be co-counsel in this lawsuit. I work with Eric. We all know how wonderful he is. But it's been such a pleasure working with him on another lawsuit and this one. I used to represent him after his Harvard place, so I know him going back forever. We're friends for life. But he's a tremendous lawyer. So I'm going to call him Eric the Brave. And we're really lucky to have Lake to have joined us here, where he used the Equal Protection Clause to get marriage equality. The right of gay marriage in Oregon is a tremendous accomplishment. And he's very well, he's so well regarded. We're very fortunate. I'm going to call him Lake the Great. So then we have Samer, who also went to Virginia Law School, so he must be good. And for Tuel, he's only half baked. I mean, another year and a half, how good is he going to be? So he's Samer the Hammer. So the title of the talk is If Your Genitals Have Been Cut, You Can Sue. What are the challenges? and this is how my talk is going to proceed, so it's a roadmap. What are our rights, and what claims can we bring? What defenses will physicians and hospitals assert, and are they valid? And if they're not, then what? What is the deadline to sue? Must we bring a malpractice action somebody talked about? Joe, I think. Can we win without a trial? Now, that's a new idea. How large might the damages be? I've never heard that discussed. And why should people sue if you've been cut? So, I mean, to be clear, this is a battle of David against Goliath. So no plaintiff has ever won a lawsuit, to our knowledge, in the world about male genital cutting. My talk is about genital cutting of males, females, and intersex children. So it's a pretty big problem if you've never won a lawsuit, called a novel legal theory. Judges hate that. So you don't just need a lawyer. I think you need a lawyer knowledgeable in this field. I mean, everything we've talked about for yesterday, you know, we all know this. In Spanish, I guess it's called consabido, or common knowledge. But you get another lawyer, they're starting from square one. To be honest, I think you need Eric. The defendants, they couldn't be more powerful. And, you know, I think they're desperate. Doctors were desperate enough to preserve male genital cutting that they issued a truly astoundingly bad guidelines in 2012. And Jews are desperate to defend circumcision as a religious right. And in the Bolt v. Bolt case in Oregon, which John Geisker helped prosecute very successfully, Jewish associations gathered together, and they came like a ton of bricks, and they wanted to circumcise that boy so bad. The father was Jewish, and they didn't care at all whether he didn't want to be circumcised. You know, so these are very powerful defendants. And people believe physicians, everything they say, you know, MD, surgeon. So there's a great article by Sarah Waldyke talking about how circumcision is a deeply embedded cultural norm. So in some countries, boys are circumcised in puberty when they think that's fine. They think it's horrible that we circumcise boys in infancy. And then here it's the other way around. We think, well, how could you ever circumcise, you know, a boy around puberty? And then Michael talked about traditions, you know, in Africa that, you know, go back so far. So there's a huge amount of cultural bias. So Martin Frisch and a group of 38 European physicians and ethicists all said that the American Academy of Pediatrics 2012 guidelines were culturally biased. So I think judges may be culturally biased. Okay, good likelihood, good likelihood. And so in fact, in the Hieronymus case in Florida that Martin was very helpful in, was Judge Gillens, and his son was likely circumcised, and he just said, I just don't get it, like everybody's circumcised. So he just didn't get it. It was completely culturally biased. Interestingly, there was so much backlash. He got removed from that jurisdiction. I don't know if they were related. And again, there's this problem that you can't bring suit and lose. Establish bad precedent would be very bad. In the law, we ask, what are the material facts, the ones that are of legal relevance? So these seem to be, to me, indisputable facts. If you leave a child alone when they're healthy, it's unnecessary to cut their private parts. They're going to stay healthy. I mean, it's really important. There's a study by Sneppen in Denmark said that only 1.5% of boys are ever going to need to be circumcised. But Martin Frisch of Denmark wrote me just the other day, and he said the real number's 0.6%, and he explained why. I don't fully understand it. But even that might be high. So the answer is virtually never necessary. And so then, if you cut somebody's genitals, I mean, it's irreversible. It's performed without consent. And then, sometimes not mentioned, it's over the objection of the child. They may be an infant, but they sure make clear they don't want to be circumcised. And Martin has just made really clear that, more than 99% of boys, they're forced, the circumcision forced, they don't volunteer for it. And according to Robert Van Houw, 1 in 10,000 men volunteers to be circumcised. It can be inferred that no boy would choose it for himself if fully informed. So then it's extremely painful in every case. Robert Van Houw made affidavit that it risks more than 50 complications, including death. Not to mention psychological harm that we've heard about from some people. And it causes serious harm in every case. So we're transitioning then to what are the rights of the child. And this is something Michael touched upon yesterday, so there'll be some repetition. I find I need to hear things 3 times before I remember them, so I think it won't hurt. So on the left is a trio of rights that are related: the right to bodily integrity, the right to autonomy, the right to privacy. It's also a right to health and life, to be free from torture, cruelty, inhuman, and degrading treatment, to freedom of religion, and to equal protection, the basis of this lawsuit. So at first, my research was just about US law, but US law is derived from English law. It's part of the common law in all the English-speaking countries. Basically, the laws in the US are the same as in other English-speaking countries. That's a lot of countries. But there are even more countries, or civil law countries, and all of these rights exist in civil law countries. Those include Europe, Asia, Central and South America. You have a large part of the developed world. So in addition, these rights exist under international law. So international law is mostly by treaty, like a contract where governments agree to be bound by the treaty. But there's also something in international law called customary international law. And where most nations agree to something and they agree to be bound, then all the nations are bound. So for example, the United States has inconceivably not signed the Convention for the Rights of the Child, but it still applies to the United States. What I'm leading up to is, what my conclusion is, all these rights are universal everywhere in the world. Sorry, I skipped a few there. Gosh, I skipped quite a lot. Where are we? Oh, I'm going the wrong way. So the right to bodily integrity, as you can imagine, is the right to be left alone. The right to autonomy is the right to make decisions for oneself. And the right to privacy is the right to make intimate personal decisions for oneself. So this right to bodily integrity dates back to the 18th century in England. And Blackstone, in his commentaries on the laws of England, discussed the inalienable rights of man. And he said that a person has the right to uninterrupted enjoyment of one's life, limbs, body, and health. It's the right to be free from physical interference. It prohibits even a minor contact if it is unwanted. So genital cutting is a profound violation of the right to bodily integrity. And the Council of Europe has expressed, quote, deep concern, and then it mentioned female genital mutilation, male circumcision for religious and non-medical reasons, and intersex genital cutting. So Attorneys for the Rights of the Child has translated international cases, and I read them all in the course of writing this paper. And they're all very favorable to us. They together talk about all of these rights that I just mentioned. So in 2013, the Swiss court said there's a right to bodily integrity in medicine, and it's an important right. So the right to autonomy, it's the same as self-determination, liberty, or freedom, the fundamental value of the United States. So if you have a right to be left alone, you also have the right to make decisions about one's own body. Now, children also have these rights, but to respect the rights of autonomy of a child, you have to wait until they're adults. If you cut them when they're children, you violate their right to autonomy. Autonomy includes their case law in the US saying it includes the right to elect treatment and to decline treatment, even if it results in death. In other words, every person has a right to say no to an operation they don't want. So this German case you heard about in Cologne, Germany in 2012, and it held that boys, it was a religious circumcision, by the way, and the court held that boys have a right to bodily integrity and self-determination. So the right to privacy, it's a subset of the right to autonomy, and it gives even more protection in intimate matters. I only just realized this in the course of writing the paper, so I hadn't thought of this since 2011. So there's a Montana court that said few matters more directly implicate personal autonomy and individual privacy than medical judgments affecting one's bodily integrity and health. Bodily autonomy is violated by a surgical operation, which is called an invasion of the body, imposed on me against my will. So this isn't just an operation when one's genitals are cut, but it's cutting one's sex organs and affecting one's sex life. So in my opinion, it definitely violates the right to autonomy. And well, it doesn't matter what my opinion is, the European Court of Human Rights said that. They interpreted the European Convention on Human Rights to encompass privacy as well as bodily integrity and self-determination, ensuring that individuals can freely exercise their autonomy in sexual matters. So the right to health and life, it's actually part of the right to personal security. The International Convention on Civil and Political Rights states everyone has the right to life, liberty, and security of the person. It's also part of the Universal Declaration of Human Rights. It's simply the right to be safe. So genital cutting harms all boys and men and girls and intersex children, something that the American Academy left out in its 2012 guidelines. So genital cutting violates the right to health and life. There's also a right under international human rights documents to be free from torture, cruelty, inhuman or degrading treatment. Genital cutting, unless medically necessary, is all of the above. In fact, the United Nations has stated that genital mutilation of all kinds constitutes torture and torture, cruel, and an outrage on human dignity, and it called for an end to them. So freedom of religion is usually invoked by the proponents of circumcision, but in fact, it's one of the rights that children have from which it can be argued that they should not be cut. So this freedom of religion in the United States is guaranteed by the First Amendment. It's part of the Declaration of the Rights of Man in France, dating back to 1789, and civil law countries. It's part of these human rights treaties, Universal Declaration on Human Rights, and the International Covenant on Civil and political rights, excuse me. So again, these cases in Europe are coming in very favorably for us. this Swiss case said, and it was a circumcision case, it seems justified to refrain from inalterably identifying the child with a particular faith. But they didn't use the words, but basically they're saying freedom of religion protects a boy from being marked as belonging to a religion that they may later renounce. So this right to equal protection, that's the focus of this lawsuit. Again, it's a universal right under international law as well. It's the duty to treat people and sexes equally. And sex is a category that's entitled to so-called strict scrutiny. It's the most protected category. So what this means, if you're going to discriminate on the basis of sex, you need a very, very good reason to do so, such as biological differences. So an example is that women may have reproductive rights that men who can't give birth don't have. Male and female genitalia and intersex genitalia need to be treated the same way. Male and female genital cutting both have the same sacrificial origins as a way of sacrifice to the gods for a good harvest, for example, involving bloodletting. They're both advanced in ancient times for similar reasons, like suppressing sexuality and because it's so supposedly cleaner. The places they're performed are both usually the same throughout the world. You may not know that females' genitals were cut in the United States up until about 1950. So doctors advanced reasons for that too, just like they do for male genital cutting. The key point, I think, that Steve talked about yesterday, and I didn't fully understand, maybe, as he said, a diagram would have helped. But the bottom line is that the male and female genitalia are identical in early gestation, and then they become analogous or homologous parts, which is to say very, very similar. So for example, the foreskin of the penis and the clitoral hood, they're both highly sensitive, erogenous, and functional tissue. I conclude it's impossible to treat them differently from the legal perspective. So now we're into remedies, if you will. So you're cut, what is it a crime, and what claims can you bring? You know, we've talked about how in 1997, the US Congress passed a law making female genital cutting a federal crime. But interestingly, there are notes when Congress made that finding, and it said female genital mutilation is a statutory a crime. I'm sorry, it's also a statutory crime in 41 states. Congress said it violates the girl's federal and state constitutional and statutory rights. What it was saying is it was already a crime. We didn't need to pass this law. We just wanted to make it really clear. So we passed this law saying it's unlawful and a crime unless medically necessary. So what I'm leading up to is if it was already criminal and male and female intersex genitalia must be treated the same, then so are all forms of genital cutting. So it constitutes criminal assault. Let me just see if I can scroll down here. So there was a 2006 circumcision case in Washington State where a father circumcised his son in a bathtub for religious reasons.
With a hunting knife.
Excuse me?
With a hunting knife. With
a hunting knife. And the court was shocked, and it said it's a clear case of criminal assault. Genital cutting is also child abuse. There's an excellent article by William Brigman in 1984, 1985. It was a really great insight, and he said if you cut off living tissue from a healthy child, it's a case of child abuse. you can't justify it on medical grounds. It's unnecessary and it's harmful. And so the bottom line is it's child abuse, even if it's a pinprick of a girl's clitoris or genitalia. It's a federal offense under the U.S. Child Abuse Prevention and Treatment Act and the Victims of Child Abuse Act. So the Royal Dutch concluded correctly, when it comes to the integrity of the girl's body, no single compromise must be made. So what that means is a doctor, nurse, medical profession doesn't even have the right to touch a boy's penis unless they have a valid medical reason to do so. Any touching violates the rights of the child. All right, so the heart of it, what civil claims can children bring? So other scholars had written that it constitutes a battery. It took me a long time to sort of realize what all the claims were that you could bring, and even up until last year when I was doing this research. So a battery is defined as any harmful or offensive conduct. So, genital cutting, as we said, harms all boys and men, and it's certainly an offensive and unwanted contact. So in addition, I hope you all can follow this, even if you're not lawyers, but I think so. I think these are all fairly clear concepts and that you don't need buzzwords to explain. But you've heard the concept of fully informed consent, that, to be valid, a medical procedure must have permission of a person entitled to authorize it who is fully informed. And we all know that, we'll get to it, but doctors don't come close to fully informed parents about circumcision at all. So that makes the operation is legally invalid. It's a battery. Circumcising a boy or a girl by lay people, or a boy or girl, constitutes false imprisonment. It's when you physically restrain somebody without a valid reason. It's intentional infliction of emotional distress. The definition of that is extreme and outrageous conduct or reckless conduct. That causes plaintiffs severe or extreme emotional distress, which genital cutting does. So there's a 2015 case in England by Judge Sir James Mumby, and he said both male and female genital cutting can cause significant harm, and the latter is sometimes more severe than the former. Thus, genital cutting satisfies, well, he didn't say this, I'm saying this, satisfies the elements of intentional infliction of emotional distress. This is an important argument for us to make when people say female genital cutting is worse. Well, maybe sometimes it's worse, but male genital cutting removes half of the penile tissue, and it turns the shaft into an external organ. So it's really a radical deformation of the penis. Somebody yesterday talked about trust, and this again, I realized one day this is a breach of trust. So a physician has a fiduciary duty to the patient. Physician has an even greater fiduciary duty to a child because a child's below the age of reason or decision making. So this imbalance of power is incredible. The physician has superior knowledge of medicine, and the infant can't even reason or speak. And the doctor has the power to do whatever they want to the child's body, restricted only by the rules of medical ethics and their conscience and so on. And physicians, it's an egregious violation of that trust. So there's a UVA professor, Hafemeister, he wrote an article called the Physicians Have a Fiduciary Duty to Just Say No to Services That Are Not Medically Indicated. And as Martin just said, in 1971, the American Academy of Pediatrics said there is no medical indication to circumcise a baby boy. Of course there isn't, they're healthy. And so Hofmeister says, well, this crosses a line that no physician is allowed to cross, to operate on a healthy child. And he said, regardless of the explanation given for it. So boys, anybody whose genitals are cut by a physician has a breach of fiduciary duty. So I think lay practitioners also do. If you take control of somebody's body, you have a duty, you know, to protect their health. In my view, we took it out of the paper, just my paper with Stephen. Svoboda, we just didn't want to raise a controversial issue. So it's also a case of unjust enrichment. To establish unjust enrichment, a defendant must receive a benefit. The plaintiff suffers a loss, and the defendant can't justify it. So we've said genital cutting violates all the rights of the child, and the doctor, the hospital, the pharmaceutical and cosmetics companies all end up with the boys' foreskins. They don't have a right to it, and it's a multi-billion-dollar per year industry, that's for sure. Pharmaceutical companies don't do anything that doesn't involve billions of dollars. So we don't know the number. Martin says maybe it's going to get bigger later, but my guess is billions of dollars are involved, or they wouldn't be buying the foreskins. All right, so what defenses can we expect doctors and physicians to assert? Seems they fall into three categories. So one is specious or preposterous claims. The next claim is it's a parental right. We had questions about that. And the third one is it's medicine. So, you know, dating back to 1875 in the United States or thereabouts, doctors have given the most preposterous reasons for male genital mutilation. And one of the most egregious is that babies don't feel pain, which they argued until 100 years. It seems sort of obvious if you watch a child writhing in pain that they're in pain. So the next, as we've talked about, is prevent masturbation. Well, you know, who has a right to prevent somebody from, you know, enjoying their sex organs however they want to? But it's because of the puritanical influence. It's another reason that physicians were able to medicalize it by, that was essentially a fear of the day. You know, sex was a dirty thing, so doctors said, oh, we can help with that. Then the claim is made that a baby won't remember. Well, you know, you could justify anything by saying, well, a person won't remember it. So then the claim is, well, we get to it, that the doctor said to me, well, if we don't circumcise them now, we'll need to do it later. Well, that's untrue. You know, that's somewhere between 0.6 and 1.5% are going to need it. Then the claim is made it's better in infancy. I mean, later it's going to cost more, and, you know, the boy will be awake and you might need general anesthesia. So it actually might be better if you were going to do it at all later, because a boy could express his opinion, or a young man, and you could have general anesthesia, and also the foreskin will have separated from the glands by then. It won't have to be forced apart. The argument that it avoids embarrassment in the locker room. You know, some countries, there are more intact boys than circumcised. You know, it's going to happen. There's globalization. People move around. Make the son's penis match the father's, I think, is preposterous. And that the opposition is anti-Semitic. So then the next claim is it's a parental right. So you may not realize this, or perhaps you do, but the real claim is that parents can do whatever they want for any reason or no reason. So according to the American Academy of Pediatrics, dating back to 1975. Personal reasons are okay, meaning, the look of the penis. Cultural reasons, social reasons. I think at one time they talked about, social pressures or something, complying with pressure, maybe even the weather. Religious reasons, a bad reason to spite one's ex. And I've had to handle about 4 of those cases, and they're awful, where, the wife doesn't want the boy to be circumcised, and the ex wants them to be circumcised despite the ex. It's awful. It should never happen. But the bottom line is no reason is required. So do parents have that right? And the answer is clearly no. Well, in 2012, the court in Cologne, Germany said it violates the rights of boys to bodily integrity and self-determination. And then the court also said that the boys' rights supersede the parents' rights. So back in the US or anywhere, the rule is that when parents are acting as their legal representatives for the son, as their proxy, they represent the child. So it doesn't matter what the parents' preferences are, they have a duty, as Michael said, to act in the best interests of the child. That's the major rule about how children should be treated under the law. But also, there's absolutely no substance to the claim that a person has a right to modify another person's body other than for a valid medical reason. These individual rights that date back to the 18th century in England, they're rights that adhere to individuals. They're not a right they belong to individuals. You can't impose your right on somebody else. It's a non-starter. But let's talk about this religious right specifically. So for the same reason, there's no religious right to modify another person's body. Again, it's a non-starter. Let's see. So there was a famous case in Massachusetts, 1944, Prince versus Massachusetts, where a parent was having a child hand out religious leaflets on a highway, and the court said, that's dangerous. The child could get killed. You're not allowed to do that. And so yesterday, one of the speakers said that the state has a right to protect children over the right to religion. So in this Oregon case, Bolt v. Bolt, that John Geisinger worked on, the father wanted to circumcise the boy for religious reasons, and the court interviewed the boy and found out he didn't want to be circumcised and stopped the circumcision. Now, it seems to me if there was a religious right to circumcise, he couldn't have done that. So a consensus seems to be building in Europe based on several cases I've read on attorneys for the rights of the child's site that translated them, that there is no religious right to circumcise. It's very favorable for us. The Cologne case we've talked about. Then there was a 2013 Swiss court that prohibited a religious circumcision on equal protection grounds. By the way, the Supreme Court famously noted that human sacrifices could not be excused by religious belief, as an example. And then there was a UK case of religious circumcision of 2 Muslim boys. Sorry, the parents were Muslim. They wanted their children to be Muslim. And the court said, well, they have the right to decide when they become adults. All right, so then we get to the defense. It's medicine. So it has an array of medical benefits. That's what the San Francisco legislation said. An array of medical benefits? What benefits? So the doctors have claimed since 1875 that it cures more than 100 diseases. And interestingly, it's often the disease of the day, fear of masturbation, or when tuberculosis was the biggest problem, or when syphilis was the biggest problem. So all these claims have been disproved. So the circumcision rate was falling, and in 2012, the AAP claimed new evidence shows that it prevents HIV. And so as Martin said, the Canadian study shows that it does not prevent HIV at all in the United States. But boys are not at risk of adult diseases. that even if it reduced it by 60% in absolute terms, which sounds great, that's only 1.3% in real terms. What that means is if you have sex with a woman who has HIV, you're going to get HIV and over time, and you'd better protect yourself or not have sex. So I've come to the conclusion that it has no medical benefits, not even potential medical benefits. A medical benefit would be a medical reason to choose it. There are no medical reasons to choose it. In my view, it's not medicine. It's still violence after all these years, still crazy after all these years. So even if these claims are true, it doesn't benefit most boys or men. As we said, UTIs can be treated. Boys are not at risk of adult diseases. It's unproven whether it reduces penile cancer, and it doesn't reduce HIV in North America. But the whole idea of a preventive amputation of a body part is insane. I mean, if you cut off fingertips, they wouldn't become diseased, but then you wouldn't be able to use the fingertips. People like to use their fingertips. It's like scarification. Do we mark people's, heads? It's all crazy. So that sort of led me to conclude that circumcision is a fraud. So a fraud is any form of deceit where you intend to defraud somebody, so you tend to deceive somebody either through a statement or an omission, and the person relies on what you say, and they are deceived, and then harm results. So at first I was thinking, well, it's medical fraud, but then over time it became clear that this fraud permeates the entire sales cycle. There's false advertising, like saying it's a parent's right or it's good for your health. So targeting the helpless targets infants unable to object. Robert Darby, the great historian of circumcision, wrote. But it also targets mothers. The mother has just given birth and they're often out of it. And so they're targeting somebody who's incapacitated. But moreover, even the fathers, they only give them a minute to decide, a couple of minutes. So that's duress. And then, as I said yesterday in answer when I asked a question, according to Intact America, physicians solicit parental consent 8 times on average. So it's badgering. So if parents say no, would you like son circumcised? They don't give a reason. You say no. They keep asking. They just keep coming and asking. I mean, at some point, the parents fold. So that's a big reason that the circumcision rate is so high. So what's this medical fraud? So as Martin said, well, first of all, they don't tell you anything about the foreskin. It's erogenous, functional. People like to have it. They understate the risks. They assign no value to the foreskin. So the AAP said the benefits outweigh the risk. And they left out the harm. They assign no value to it. Imagine saying like a preventive mastectomy is a good idea and leave out that women, value their breasts. And they certainly don't disclose the pain, the risks, the harms. A legal fraud is when you have a legal right and somebody tricks you out of it. And so the AAP should know by now that children have legal rights, but they argue they don't. They argue it's a parental right, and they argue they have a claim to do this when doctors absolutely are not allowed to operate on a healthy child. So that constitutes legal fraud. The first article I wrote was about how it's unlawful to use Medicaid to pay for circumcision. Medicaid only pays for surgery that's medically necessary. It does not pay for elective, cosmetic, experimental surgery. So in my view, all these, let me add, the doctors falsely swear on a form that it's medically necessary to circumcise the boy at birth or later, and they use false diagnoses, so they know they're lying. So it's a case of intentional fraud. And all these states, somewhere between 14 and 17 have ended coverage. All the other ones, they're enabling the fraud. although they may not know it. And the sale of foreskins, the parents aren't told. If the parents were told, they probably would say no. So let's see. Where is the next slide? Yeah, so one day I was thinking, well, should it be the burden on the child to prove that a doctor defrauded them? That doesn't make sense. It's hard to prove fraud. You can prove it through circumstantial evidence, and some states recklessness is enough. And I remember this doctrine of constructive fraud. So it sounds fancy, what is it? Basically, a physician has a duty to justify every procedure. And if they can't do it, fraud is presumed. And the rule is to prevent unfairness. So children, and when they become adults, they don't need to prove intent to defraud. So this is a powerful tool. So let's revisit the pitch to me. So a doctor came to the door, offered it to me. Well, they're not allowed to perform it. It violates all the rules of medical ethics. They're only allowed to operate when it's medically necessary. They're not allowed to solicit it. I knew nothing about it, so it was unfair surprise. They took unfair advantage of me. And my wife said, you decide. She was incapacitated. I remember now she had a really glassy-eyed look. She was out of it. And doctors know that, and they should know that, because they need to know that when a patient signs a form that they're able to give consent. They target children unable to object, as Robert Darby said. He told me it's not medically justified. Then why the hell are you offering to cut off part of my son's penis? It's best performed in infancy. Well, it's best not performed at all. And he forgot to mention what the foreskin is, what circumcision is, the pain, the risk, the harms, the risk of trauma, regret, and anger. So I said no. Thank you. I'm very proud of that. Lucky though, lucky. Yeah, so when is the deadline to sue? So this is the second paper I wrote at Cambridge. I was going to write another paper, and then I was thinking, wait, it seems unfair that, well, no, let me back up. I'm finding people coming forward and say, can I sue? And by the time they come forward and say, can I sue? The answer is always, you're too late. And I was thinking, well, how come they didn't come forward earlier? Well, they only just became intactivists, and they only just read articles like saying circumcision is a fraud. So in the Levine case, the start of it was somebody heard about my article, and then he said, it's a fraud. Well, tell me more. And then he brought a lawsuit. So there's this rule called the discovery rule, and it says that it would be unfair to force a person to bring suit, or to say they're barred from bringing a suit before they discovered, or should have discovered, that they have a legal claim. So then I was thinking, well, what does somebody whose genitals are cut, what do they have to know to bring a suit? Well, first of all, they have to know they were cut. Now, it might seem obvious if your genitals were cut. But if you were an infant, you won't know that until some point when you discover it. And it turns out quite a lot of circumcised men don't know they're circumcised. Then you have to know you were harmed. And the AAP says it's not harmful. So most people don't know that they were harmed. They can still have sex. And then importantly, you need to know you were wrong, meaning you have some legal claim that you can bring. And what I realized, it's impossible to know that. Even if you heard all the intactivists talk and heard about all of the lawyers talk, there's never been a case. Nobody's ever won. Nobody knows for sure they could win. And so I conclude anyone can sue anytime, no matter when they were cut. So I'm just finishing that paper up, but I hope to publish it this year. So next thing, somebody talked, Joe, about malpractice action. It's reasonable to think you need to bring a malpractice action. And David Llewellyn, all of his lawsuits, the penis lawyer, they're malpractice actions. But I was thinking malpractice is when you do something negligently. You know, you had the right to perform it, but you did it badly. But genital cutting or male circumcision, you're not allowed to do it. It's not part of your license. It crosses a boundary, as we've said, in fact, even into criminality, regardless of the reasons advanced for it. So in my opinion, they're not acting as doctors, they're acting as a layperson. So there is a problem if a statute says in order to sue a doctor for anything, you have to bring a malpractice action. You know, it's pretty much black and white. But I think I would make this argument, if it ever needed to be made, it'd be better to bring a lawsuit where there was a malpractice as well, and then go through malpractice and bring these other claims. But in my opinion, the doctor's not acting as a doctor, but as a layperson. It's not a malpractice claim, and it's much simpler, fewer obstacles. All right, can I win without a trial? Yeah, I'm getting to the end. I'm pleased to tell you, thank you for your patience, yeah. Eric did tell me I had a little more time. Yeah, so, you know, when is genital cutting justified? So I was thinking, well, it needs to be medically necessary. But because it's such a violation of such a key right, it has to be essential to the child's health. And then if the child's old enough, the child has to consent as well. But if it can be deferred until adulthood, it has to be deferred in order to respect the child's autonomy. So unless those conditions are present, it's indefensible. And that's the title of the article that Stephen Svoboda and I just finished. Genital cutting is legally indefensible and grounds for summary judgment. Summary judgment, okay, it's a legal buzzword, but it just means there's no need for a trial. So if you are a girl or a woman, you were cut, you know, and you go to court, you say you want damages. Is there a need for a trial? There's no need for a trial. You just say I was cut. They didn't have a right to do this. And a boy or intersex person could say the same thing. I see no possible defenses, so I believe there's a right to summary judgment to win without a trial. So then I was wondering, well, you know, what could the damages be? And can make this short, but you know, one's private parts, they're private, they're priceless, right? I think you would argue that it messed up your sex life, made you really unhappy. And I think the sky's the limit in the damages that people could win. But I haven't fully thought through class action, but I think because genital cutting is indefensible, I believe a class action is possible at the right time. This isn't the right time. You need society to be on board, but I think a class action is possible. I looked it up quickly, and it seems if liability is clear and the only issue is damages, you could have separate hearings on damages. You know, why should a person sue? I being anybody's genitals are cut. I mean, one is to get compensation. You can never get, you know, your full genitalia back. But also, George Denniston of Doctors Opposing Circumcision, he's firmly of the belief that unless doctors are held financially accountable, this will never stop. I mean, I think that's really clear to me. Just think about it. A study came out saying it removes the most sensitive part of the penis. Did the AAP care about that? Then the AAP's own committee said it can cause neurological damage. Don't cause pain to infants. Did they care? Then it doesn't reduce HIV. Did they disclose that? Boys can die. Do they care? I conclude they don't care about the health of boys and men, those who perform this. They only care about the money. And so lawsuits are the only way to protect the next generation. And then I think If we are able to stop male genital cutting here, it will help end female genital cutting around the world as well, and intersex genital cutting. So the good news is it violates many rights. You have many claims. European courts seem to be deciding in that favor. You can sue anytime. It's not malpractice. You have a right to win without a trial. So the bad news, these are unproven legal ideas. I'm absolutely persuaded they're correct, but you have to fight the fact that nobody's ever won a case. Powerful adversaries, judges inclined to be culturally biased, need a specialized lawyer, need a lot of money, and you can't afford to lose. So there's the last slide, which has mentions 3 of my papers. I'll just go to that. These are the 3 papers, or actually there's 4, that give backup for everything I've said today. So just email me if you like, pwadler2@gmail.com. I'd be happy to send you any of these papers. And that's it for the talk. Thank you so much. Down on the legal causes of action if you're circumcised, right? If someone cut off part of your body, part of your genitals, right? And how can you get legal litigation, right? And so these are lawsuits that we are likely to bring depending on resources. So this is another pitch. You know, if you want to see more intact litigation like in Oregon, become a monthly donor, right? Click become a monthly donor on intactlegal.org. Or donate to the GoFundMe. So we've got some questions. We've got about 15 minutes before lunch. We're going to start with you, Tim. So you're in first. Oh, sure. Thanks. Well, let me give this to Tim, and then I'll get the slide.
Thanks again, Peter, for that excellent presentation. I have a comment and I have a question. The comment is that one of GALDAF's board members, and this is under the radar and it's not widely known, our secretary of GALDAF was born in Windsor, Ontario, Canada, and he has single-handedly sued the hospital and his circumciser for his circumcision. He's 24 years old, brilliant young gay man. And unfortunately, he contacted 30 attorneys in the province of Ontario, and not one of them would touch his case. But he is single-handedly doing it himself. So there is some hope. It's ongoing, and we're hoping for a positive result on that.
That's great. I certainly hope so. Abraham Lincoln said that a person who represents himself has a fool for a client. And so it's just very hard to win a case pro se. Eric Anderson is another fine man who's trying hard, but it's so difficult. Like, you know, he just doesn't know the rules, and some courts, they won't listen to you at all if you're pro se by yourself.
Yeah, this is a little different because they are listening to him, but you know, there's a whole lot of hoo-ha going on around that. But he's really, really brilliant because he knows the law and he's also in medical school. So he's got that going for him. My question is about the Oregon case. You referred earlier to the Sir James Munby case in the UK. And if I'm not mistaken about that, that involved a Muslim family with a son and a daughter, and they wanted to circumcise both. Is that much true, as far as you know?
I know it was at least one Muslim boy.
Yeah. My understanding is it was a girl and a boy. And Munby said, you are absolutely correct, that in some cases, male circumcision can be greater and more harmful than some forms of female circumcision. But the way he wiggled out of it, to my understanding, was to say female genital cutting is totally unacceptable in the UK. Nevertheless, male genital cutting still falls within the bounds of acceptable parenting practices. So my question is, do you anticipate that coming from the Oregon court? And if it does, how would you respond to that?
Yeah, well, first of all, thank you for bringing up that I might be mistaken in my conclusion. I thought, I thought that it was a religious case where the judge said you can't circumcise a boy for religious reasons. So I will look more closely at that case. Yeah, it seems in the Oregon case, I think you're asking, will it be argued that parents have a right to elect this?
Not necessarily a right, but identifying male circumcision as being normative in this culture versus female circumcision, which is non-normative in our society. And my question is, if that is brought up by the court, how do you respond to them trying to argue against you or dismiss the case if they say, well, it's a normative practice in our culture, so we can't rule against that?
So first of all, I think Eric or Samar might be able to answer better than I can, but I think we would say you can't have different laws for the sexes unless you can justify it based on biological differences, which there aren't any.
So normative parenting practices be damned would be kind of the conclusion, right? You just have to adhere to the law.
Well, I guess if we got into it, we'd have to say there is no parental right to cut either sex's genitals. I'm not sure I fully answered, but these, how about we go think about that?
Well, Sam, who was also the drafter of the complaint, also has a response, I think.
So I think if we go back to the Prince v. Massachusetts case that Peter was talking about earlier, and how there's kind of a universe of acceptable parental child rearing practices that the state can, from time to time limit. I think what we see is over time there's been an evolution of the scope, and it's been narrowing in terms of the acceptable practices that parents are allowed to do in child rearing. And so just a few decades ago, parents could probably ruthlessly beat their children for disciplinary reasons, but over time the law has shifted such that in tort cases you can sue your parents potentially for discipline that goes beyond what society considers normative. And so I think it would absolutely be an evolution for the court in this case to say this is outside of the scope. That would be a step they would have to take, but it's not without precedent that the state has over time diminished the universe of acceptable practices that parents are allowed to engage in for child rearing purposes. And I think this would be just another step in that evolution.
Great. Thank you so much, Sarah. Oh, another question from Aliana. Here, mind if I? Thank you.
So I wanted to thank you for mentioning that female genital cutting has happened in the US, and wanted to mention that I've talked to some people who have experienced it, older people who have experienced it probably from time that more people are thinking of, but I've also spoke to some younger people who have experienced female genital cutting through the Genital Autonomy Collective, and the examples that come to mind was someone who was very heavily pressured by their husband for aesthetic and sexual preference reasons to get a labia reduction, and came to very deeply regret it and practice some restoration afterward. And I'm curious how something like that might have different opportunities to pursue legally. Also, that involved flying out of the country to do it, and that's a whole deal, I'm sure. And the other one that's...
Could I answer that just so I can remember that one?
I just want to mention one other term real quickly, which is the
Okay.
husband stitch, which I've also heard from someone as well more recently that's experienced that. And with that as well, how a case like that, if they pursue something legally, how that could maybe benefit or expand to legal protections for male genital cutting and intersex genital cutting.
So I think the problem with that case is that the woman consented even though she was pressured. So she went to a doctor and said she wanted, her genitals altered in some fashion. And if she's of adult age, she would have the right to do that. And so I don't think she has any legal claim, unfortunately.
Mhm. And the other one being the husband stitch, the person who experiencing that is very obviously that you were talking about under, they've just given birth. So they are not really able to consent. And sometimes that, I mean, it's called the husband stitch because it's deferred to the husband to make that decision. I don't know if people are familiar with that term, but it's basically after someone with a vulva gives birth, they will literally stitch the vagina to be tighter, which is not based in any science that actually does anything and often causes complications and pain later.
Well, I think that would be what we call actionable. It seemed to me that you would most definitely be able to bring a claim that violates federal statutory law, it's a crime, state statutory law, and violates all the rights I talked about. You'd have all the claims I talked about.
And to continue that, what I asked earlier about the earlier one, expanding that to how that might impact male genital cutting and intersectional cutting legally. If there is a case like that, could that impact?
That would be very helpful to have cases about female genital cutting, yes, to have females bring suit under all these theories, and the courts would be much more inclined toward them, and then they would state their rationales, and very likely the same reasoning would apply to males. That's a great idea. That would be a good way to start. So I do think it's not the right time to bring lawsuits to recover damages. It's sort of bad news if you think that was my conclusion. It's more like you have the right, but it's going to be very difficult, and I don't know the time's right and wouldn't want to lose.
Thank you. Also, I am curious if you had thoughts on the like legal rights tensions that, how do I pronounce your name, Samir? Samer, okay. Had mentioned on like parents versus states' rights and in regards to like trans issues and also versus like the, sorry.
No, it's fine.
Like,
I think the rights are all the same. I talked about for, trans intersex people, regardless of sex. The whole point is from the legal standpoint, you have to just treat the genitalia the same way. It has to be medically necessary, essential to the child's well-being with the child's consent wherever possible, and otherwise defer it until adulthood.
Thank you.
Yeah, thank you, Allie.
Well, thank you so much, Eliana. And you bring up a really good point because we're going to break for lunch in just a minute. But if, Intact Global's mission is to protect all children from genital cutting. So if there are women out there in the US who've been harmed by this, then we would love to talk with you to consider maybe you could be a representative plaintiff as well. Obviously the universe of women or females who've been cut in the US is much smaller than men and intersex individuals. Daniel will have your presentation after lunch because, we're
I was going to say that episiotomies are very common. Although I've heard that the increase in episiotomies are very common practice. And very dangerous to the clitoris. Right.
So, how do you pronounce that? Episiotomy.
Episiotomy.
Okay. Well, anyway, if there's any women who've been out there who've been injured by an episiotomy, who wants to bring a legal claim. I'm sorry, Ali, we're going to break for lunch, but
Really short thought.
Yeah, what's up?
If the case about the labia reduction, there may have been domestic violence in it, and that contributes to that even, so they consented as well.
Oh, anyway, let's do one last round of applause for Peter. Thank you, Peter. All right, we're gonna break for lunch for an hour. So if you're on the live stream, we're just gonna have a static stream for an hour. And half hour in, if you want to get an interview, if you haven't been interviewed yet, Leaf, I think you mentioned anyone else. We're doing interviews in the room behind that room right there. And yeah, we'll resume in about at 2 p.m. Pacific time. Thanks, guys.
So I think in Massachusetts and other states, they've extended the statute of limitations.
Okay, we're about to get started in a minute, so if you guys could either take your seats or, or just be quiet, All right, well, thank you so much. So this is the final half of the final day of Intact Global's inaugural conference. It's been, oh, thank you. So it's been a great conference. We're going to wrap up strong. We have a very, very strong speaker who is joining us to kick off after lunch. And as mentioned before, Intact Global's mission is to protect as many children as possible, primarily from protecting them from non-religious, medically unnecessary genital cutting, euphemistically termed circumcision. At the same time, we want to open the dialogue with religious communities, both Jewish and Muslim. And to that effect, we're very, very pleased to welcome our next speaker. She's also a civil litigator in Los Angeles, primarily with a focus on education, business, and civil litigation. So she also comes from a Jewish community in Los Angeles, and we really look forward to hearing from Deborah. Her talk is titled Dangers of Cultural Conditioning. So if we could give a big round of applause to Deborah Ashian. Yeah. And I'm just going to mic you up right here. Looking good.
Thank you so much. And I'll use this mic?
Yeah, please use this mic about that distance.
Hello, everybody. Okay, let's do this. Dangers of cultural conditioning. What is cultural conditioning? This is a good place to start. Cultural conditioning is a process through which we absorb and interpret the influences, norms, and messaging from our environment and translate them into what we believe to be acceptable behaviors. Cultural conditioning can lead to specific behaviors considered acceptable in some cultural contexts and not in others. Eventually, these behaviors become internalized and we no longer act with conscious thought. It is my opinion that misinformation coupled with cultural conditioning supported by religious ideologies is a dangerous combination. This is glaringly obvious when analyzing the motivation and actions of a terrorist, for example, who is culturally conditioned to hate, is given misinformation by people he trusts, which is then supported by his extreme religious ideologies. As a society, we are quick to point fingers, calling these individuals brainwashed, uneducated, or crazy. Upon deep reflection, it has become clear to me that no one, including myself, is immune from the dangers of cultural conditioning. September 1986. September 9th, 1986 was a very special day for me. This was the day I became a big sister. As a 6-year-old child, I was of course very excited when my mother gave birth to a healthy baby boy. I remember my father taking me to the hospital and picking me up so I could see my new brother through the glass window. I still remember the moment I saw him for the first time. I was filled with joy and overcome with an innate feeling wanting to immediately protect him. The next memory I have of my baby brother was 8 days later. We were at my uncle's house for his circumcision ceremony. The ceremony was taking place in the living room, which had a door leading to the backyard that was left ajar. I was standing right outside the door looking in. I was told what was going to happen and that it was necessary for his well-being. I couldn't see my baby brother because he was surrounded by a group of adults hovering over him in a circle. The next thing I heard was my baby brother screaming at the top of his lungs. To this day, I can still hear his screams in my head, his specific screams. It was an extremely high-pitched sound, the sound of torture. I felt very helpless as I was unable to protect him. I felt faint, and I began to quietly cry to myself. I distinctly remember thinking, what are these crazy people doing to my baby brother? Since then, I have attended at least 50 circumcision ceremonies. Attending these ceremonies became very normal for me. I attended one every time a family member or a friend had a baby boy. Following the ceremony, there was always a party. Sometimes it was a small party. Other times it was a very large and lavish party. As a kid, I would run around these parties and play with my cousins. As an adult, I attended out of respect for a long-standing tradition within my culture. In the Jewish culture, circumcision is considered a covenant between Abraham and the God of the Jewish people. We are taught it is a mitzvah, a good deed, to attend the ceremony, and in fact, we are encouraged to pray during the circumcision itself. Oftentimes, you will see the women raise their hands upward with their palms open, praying to God for forgiveness of their sins. As an adult, I rationalized to myself that the visceral reaction I experienced at my brother's circumcision ceremony was nothing more than that of a young child not understanding what was going on. I dismissed my own intuition and common sense and relied on the advice of doctors in my community, claiming it was a necessary medical procedure. I was conditioned to believe that male infant circumcision is normal, but the truth is that male circumcision is not normal. There is nothing normal about strapping a baby boy to a board, spreading his legs, and cutting his genitals. I am the perfect example of how one is culturally conditioned. I started my story in September 1986. I would like to fast forward to January 2023, just a little over 2 years ago. One night in January 2023, I was scrolling through Facebook and came across an article titled, 4 New York Babies Get Herpes from Jewish Circumcision Rite in the Past 6 Months. The article was dated February 25, 2020. I was confused as to why a baby would contract herpes from a circumcision. As I read the article, I was horrified. The article detailed what is known as metzitza bepeh. Metzitza bepeh is a controversial ritual practice in which the mohel, after removing the baby's foreskin, places his mouth on the open wound and sucks out blood by oral suction. This is repeated up to 3 times. I would like to make it clear, this practice is only done in an extremely small subset of an ultra-Orthodox community sect called the Haredis. Most rabbis denounce it, and most Jewish people have never even heard of it. This was indeed the first time I had ever heard of it. I was beyond disturbed. I proceeded to search for information regarding this horrific practice. While doing so, I came across countless articles regarding the lifelong harmful effects of circumcision, none of which I was aware of. It was always my understanding that circumcision is done in the best interest of the child's health long term. In an effort to further educate myself, I decided to do some research. I spent the next few weeks doing what I do best, researching and analyzing the facts. I read countless articles, both for and against circumcision. I watched many videos by doctors, I watched documentaries, I reviewed studies, I cross-referenced the studies, I attempted to validate the studies, and I spoke with licensed physicians. And I also researched the origins of circumcision. In the end, I came to the following conclusion. The claim that circumcision is healthier and cleaner is 100% absolutely false. And I will explain to Thank you. Thank you. And I will explain to you why. With facts, I will explain to you why. But before I do so, I would like to briefly talk about the origins of circumcision. The origins of circumcision date back thousands of years to a time when civilizations engaged in human sacrifice, animal sacrifice, and blood sacrifice. Blood sacrifice rituals or blood rituals are ancient religious practices that involve the offering of blood to a deity or supernatural entity. These rituals have been documented in various civilizations throughout history. Researcher Charles S. Allison traces blood rituals as far back as the Babylonians, Canaanites, and ancient nomadic tribes. In ancient Mesopotamia civilizations, blood sacrifice rituals were performed to appease the gods and to ensure fertility. In ancient Egyptian civilizations, sacrificial animals were slaughtered and their blood was poured onto altars or in sacred pools. In ancient Maya civilizations, human sacrifices were offered to the sun god. In medieval times, according to Norse mythology, blood sacrifices were made to Odin and other gods. And in Celtic cultures, both animal and human sacrifices were routinely made. Although the origins of circumcision date back to a time period when blood was considered a holy form of sacrifice, some argue Jewish circumcision is not a blood sacrifice because it is not intended as a sacrifice, but rather it is considered a mark of the covenant. Assuming Jewish circumcision is not intended as a sacrifice, it is nonetheless a blood ritual, often referred to as blood of the covenant. And in fact, any man who wishes to convert into the faith who is already circumcised must still undergo what is called hatafat dambrit, the ritual drawing of blood. Hatafat dambrit requires drawing a small drop of blood from the area where the foreskin used to be. Before doing my research, I had no idea circumcision is a pre-medieval tribal blood ritual. However, as it turns out, some people are aware that it is. As posted by Eran Sadet, cultural conditioning is so powerful that it manipulates human instincts to act against their most basic moral foundations. But circumcision is not just a regulation of instinct. It is one of the most striking examples of making people believe they are doing something good while committing an act that in any other context would be considered a grotesque violation of human rights. I personally consider any type of blood ritual barbaric and inhumane and believe there is no place for it in today's society. As I mentioned earlier, at the end of my research, I came to the conclusion that the claim circumcision is healthier and cleaner is 100% absolutely false. I would like to now share with you some of my findings. I compiled a short list of the most relevant facts. For most of you sitting here today, none of this is going to be new, so I ask that you bear with me. But for most Americans, including myself, this information is not only new, but shocking, especially because it was ingrained in our minds that circumcision is healthier and in the best interest of the child. The following is a list of 10 undisputed facts. Undisputed fact number 1, foreskin is not a birth defect, meaning a baby boy born with foreskin is considered healthy. The absence of foreskin is a birth defect. The birth defect is called apostia, which is a congenital anomaly and is the result of a developmental issue during the formation of the male genitalia. Undisputed fact number 2, foreskin is a body part. I repeat, foreskin is a body part. Foreskin is not just an extra piece of skin, as some people say. The adult foreskin is highly vascularized and has a densely innervated bilayer tissue with a surface area of up to 90 centimeters. This is the size of approximately a 3x5 index card. The tissue is highly dynamic and biochemically functions as a gliding mechanism. During intercourse, the foreskin essentially unfolds and glides, facilitating movement, reducing friction, and retaining fluids. The foreskin is the primary erogenous zone of the male organ and is divided into 4 subsections: the inner mucosa, the ridge band, the frenulum, and the outer foreskin. The foreskin is a protective layer, much like how the eyelid protects the eye. The glands and inner mucosa are physically protected against external irritation and contaminants while maintaining a healthy, moist surface. There are also specialized immunological properties which defend against common microbes. The foreskin is an antimicrobial body part.
Say it again.
The foreskin is an antimicrobial body part. Undisputed fact number 3. The foreskin has a purpose and function. For the male infant, the purpose and function of the foreskin is to protect from urine, dirt, and feces. For the male adult, the purpose and function of the foreskin is to allow for self-lubrication during sexual intercourse, among other things. I spoke with a handful of doctors currently performing male infant circumcision. I asked them all the same question. Without fail, they all gave the same answer. Question: what is the purpose and function of the foreskin? Answer: there is none. An interesting side note, the lubrication industry, which is a multi-billion-dollar industry, is the #1 promoter of circumcision worldwide. Undisputed fact number 4. Infant foreskins are sold to pharmaceutical companies. The foreskin contains valuable stem cells and fibroblasts, which they use to create and sell high-end beauty products, including wrinkle-free creams. Medical entrepreneurs have made millions in profit from newborn foreskin. According to one company, the American Type Culture Collection Incorporated, headquartered in Virginia, the baby foreskin is even available in various ethnicities. Undisputed fact number 5. Circumcision is a non-therapeutic surgical procedure, meaning there is no medical necessity or illness that requires a corrective procedure. There is no disease, there is no defect that needs to be treated. It is the only surgery done in an attempt to reduce the likelihood of a potential illness that may or may not ever occur. And like in all surgeries, there are risks associated with it, including infection, injury to the urethra, erectile dysfunction, and less commonly, penile amputation. Circumcision can also cause meatal stenosis, a condition where the opening narrows and becomes too small. This would require a corrective surgery. Undisputed fact number 6. Circumcision causes permanent, irreversible damage to thousands of nerve endings, called Meissner's corpuscles. Meissner's corpuscles are in the foreskin and are a type of rapidly adapting low-threshold receptors. Their stimulation contributes to sexual sensations. Undisputed fact number 7. The studies claiming circumcision reduces the likelihood of HIV or sexually transmitted diseases are questionable at best. Not only are these studies outdated, they were mostly conducted in African countries where there is already a higher likelihood of HIV and transmitted diseases. And many of the participants who agreed to be circumcised were advised to use protection while engaging in sexual intercourse due to the open wound. These studies also lack the proper follow-up with the participants involved. We all know the only way to prevent HIV and sexually transmitted diseases is abstinence. And the best way to reduce the likelihood of HIV or STDs is to use proper contraceptives. Undisputed fact number 8. The most cited reason for circumcision by doctors today is to reduce the likelihood of urinary tract infections. So let's talk about urinary tract infections. Do you know what the chance of getting a UTI is in boys from infancy to 10 years old? 1.1 to 1.6%. If your baby happens to fall within the 1.1 to 1.6% and gets a UTI during the first 3 months of life, those are often part of a syndrome called gram-negative sepsis. Did you know that young men rarely develop UTIs? In young men, the prevalence of bacteria in the urine is 0.1% or less. Do you know what the chance of getting a UTI for an adult male younger than 50 years old is? It is approximately 5 to 8 per 10,000 men. And in the less than 2% chance that a male infant or a male adult does in fact get a UTI, the UTI either resolves itself on its own without any treatment or with a simple antibiotic. It turns out that circumcision doesn't really prevent anything. The only thing it does is prevent normal sexual functioning. Undisputed fact number 9. Circumcision is genital mutilation and deprives the child of bodily autonomy. To all my woman warriors out there who believe in my body, my choice, what about his body, his choice? Thank you. Male bodily autonomy is just as important as female bodily autonomy, and child bodily autonomy should never be contingent on the child's sex. We must protect all children equally. Circumcision is a permanent alteration of the child's genitals. Thankfully, the current climate on both sides of the aisle is one that is focused on the child's right to bodily integrity. This is a bipartisan issue and should be treated as such. Undisputed fact number 10. No medical association recommends routine neonatal circumcision. And most doctors outside of the United States overwhelmingly oppose circumcision, stating it is unethical and medically unnecessary. What is deeply troubling to me are the doctors in my community. There are hundreds of doctors in my community, many of whom are highly distinguished in their field of medicine. To them, I would like to pose the following question. Why is it that you fail to join the majority of your colleagues worldwide who overwhelmingly oppose male infant circumcision, stating it is unethical and medically unnecessary? Why is it that you hold the dissenting view on this particular issue? Why is it that you would never advise a patient to amputate a healthy body part as a prophylactic measure, yet you do so with such ease when it comes to the male foreskin? The only reasonable answer is cultural conditioning. Because these doctors, like myself, have been culturally conditioned to believe it is normal. And just so you know, these are some of the smartest people I know. They are too smart, in my opinion, to hold the wrong view on such a clear-cut issue. This is precisely why cultural conditioning is so dangerous. I believe that if these same exact doctors were raised in a different culture, one that did not normalize circumcision, they would be the first to resoundingly reject the practice. When history looks back upon us, the doctors currently performing male infant circumcision will be regarded as some of the most incompetent doctors of this century. I'm going to read that again. When history looks back upon us, The doctors currently performing male infant circumcision will be regarded as some of the most incompetent doctors of this century, especially in light of the fact that not too long ago, in the 1970s, doctors in the United States were performing female genital mutilation under the same false claim that it was healthier and cleaner. It is only a matter of time before the mama bears and the papa bears wake up and realize they have been lied to by doctors and so-called experts. And when that happens, there will be a lot of explaining to do. It's true. Briefly, I would like to touch upon the First Amendment, very briefly. Some may argue that male infant circumcision is inextricable from their religion and therefore is protected under the US Constitution. As an American who cherishes the Constitution and as an officer of the court, it is incumbent upon me to inform you there is no absolute right to religion. Erwin Chemerinsky, leading expert in constitutional law, commented on a case regarding female genital mutilation and said the following: "There is no absolute right to religion in the United States," noting many parents over the years have fought for the right to refuse their child medical care because of religious beliefs, but those parents, many of whom were Jehovah's Witnesses or Christian Scientists, have consistently lost those cases. I would like to conclude with the following. I am a proud member of the Jewish community. I was raised in a traditional Jewish home. I attended a Jewish day school, and I had a bat mitzvah. I studied the Torah, the Talmud, and the Mishnah Torah. Maimonides, author of the Mishnah Torah and personal physician to the Salah ad-Din, was approximately 800 years ahead of his time when he said there is no medical benefit to circumcision. He explained that the reason for circumcision is to inflict pain on the male organ in an attempt to prevent impure thoughts or impure actions. That being said, Maimonides still appreciated the significance of the Brit Milah on the 8th day. And although I no longer agree with it, I too still appreciate the significance of the Brit Milah on the 8th day. I also understand the importance of maintaining tradition. And I believe we can maintain this tradition without injuring the baby. You can have a Brit Milah where you recite all of the prayers, announce the Hebrew name of the baby, and have a symbolic circumcision, where in lieu of cutting the baby, you cut a piece of fruit, a pomegranate, for example, which some people are now doing. Alternatively, you can have a Brit Shalom, where you recite all of the prayers and announce the Hebrew name of the baby. You can also choose to have no brit at all, and your baby will still be a member of the Jewish community. And if anyone tries to tell you otherwise, you can tell them this: God doesn't make mistakes. People do. Thank you. Thank you so much. Thank you so much.
Well, thank you so much, Deborah. That was a stunning talk, brought me to tears. I think we really all needed to hear that. So another round of applause for Deborah.
Thank you so much. Thank you.
So we'll get the flight, but not immediately, so we have some time for a few questions. So we got Tim over here. Thank you, please. Tim Hamilton.
Oh no, not Tim again. Sorry. I have a quick anecdote and then a piece of information to share. Dr. Christopher Guest, who some of you know, is a physician in Ontario, Canada, summed up the argument about circumcision to prevent STDs and said that the real way to do that is through other means, abstinence, but primarily condom use. He said it boils down to this one question that I think would really strike a chord in many people. It's that you can choose to use a condom every time, or you can choose to cut off part of your dick and use a condom every time. The second thing, and please forgive me, I don't mean this to come across as Jew-splaining, but I had the extreme privilege and honor of interviewing Miriam Pollack for my video, Whose Body, Whose Rights. She's a Jewish feminist who used to live in the Bay Area, now she lives in Israel. And she taught me something that I didn't know, and this is that in the early days of Judaism, and still today among many Orthodox Jews, women's menstrual blood was considered polluting, and that the spilling of male blood from the genital organ was considered to be redeeming. And so from her perspective, male circumcision is a form of misogyny and anti-feminist thinking, contrasting the two forms of blood. So for me, that was a real mind opener about how sexist male genital mutilation really is. I just wanted to share that.
Yeah, sure. No, I've never heard of that. I know that in Orthodox communities, women, after their monthly cycle, do go to what's called a mikveh. It's basically essentially a bathhouse where they submerge themselves in water. My understanding is this was done historically, and there's still some quote unquote mikvehs in stone in the old city of Jerusalem that I've actually visited. And it was basically, back then there weren't showers. So in an attempt to maintain cleanliness and being healthy, actually, is my understanding of why they would go to the mikveh. It's still continued as a tradition today, but it is not associated with women's blood being viewed negatively. I've never heard of that, and to be honest, I don't agree with that statement. And in terms of male circumcision blood, I mean, blood, as I mentioned, was considered a holy form of sacrifice in many civilizations, in the medieval and ancient civilizations. So there is probably some truth to the male circumcision ceremony.
Hi. Question about the nature of the nerves that are cut off. When you were talking about that, I've heard some doctors admit, yes, there are nerves there, but those aren't the important ones. The ones that really matter are in the head of the penis. And I've always wondered, do you know where that came from? Like the dismissal of the nerves in the foreskin as sexually pleasurable?
That's a great question. I'm not a doctor. But my understanding is that they are contained in the foreskin and are permanently severed, and there is a dulling of sensation. Actually, among the Jewish community, it is accepted that there is a dulling of sensation, and parents are willing to exchange that in exchange for the alleged lifelong health benefits of circumcision. So that's one thing that I have known for many years, that there are permanent there are nerve endings in I think they're called Meissner's corpuscles, and you can ask a physician more about that. I don't want to represent something that I'm not educated in properly, but that's my understanding. The Meissner's corpuscles, thousands of them are severed, and that's where the sensation comes. I mean, I think we have them in like our fingers and in other parts of our body as well.
There's two studies that you should look at for that. One is Dr. Sorrell's study, where they did a 5-10 measure mapping of the penis. You can actually have a really nice graphic that's got red and purple and from exactly what the sensitive parts are, as well as Taylor Rockwood's histology study, where they found hydrogen corpuscles in the plants and the big band of evidence. So they literally have microscopic pictures of the hydrogen corpuscles in the brain. That was before chat.
Yeah, I mean, I've seen those. I'm just trying to figure out how to counter their dismissal of those as important. Like, yes, we cut those off, but those aren't important.
Well, this is their lacking. So they're lacking the tissues that are the only thing they know is right. But the science is clear. There's no question. The majority of nerves, at least 75%.
All right.
Thank you, Deborah, for that. I've been writing notes, and one of the biggest problems in Africa, especially on this issue, is the othering. When it is FGM, men are called upon. You come and fight with us and stuff like that. And now that it is men and boys who are suffering, okay, not all women, but majority of them are now saying it is your problem. And I've been looking at most of the families, you have the single mother, issue where most decisions are taken by the mothers because the men are out there. And for me, to hear you stand out to speak against this is really reassuring that now there's a shift that the women need to protect their babies and the future fathers, because there's a problem with fatherhood. And it is the women that are supposed also to help, the men to sort this issue. So I'm really happy that this is happening. Now, the last question I have. Have you ever received counterattacks to what you're doing, both from your community as a Jew, but also as a woman, especially from fellow women?
That's a great question.
Because some women love their circumcision, and then you're telling them don't love circumcision.
No, that's a great question. A few women have asked me why I care and why I'm doing this, and that this is not a woman's problem. This is a man's decision. Why do you even care? This is a human rights issue.
Yeah.
This is child abuse. This is sexual assault on a minor with a permanent modification of his genitals without his consent. I didn't even talk about consent, but the consent is a big issue when it comes to circumcision. And in my opinion, parents should not have the right to modify their child's genitals under any circumstance, especially when they're causing harm. So in the Jewish community, I'm going to be honest, most people think this is healthier for the child. Nobody enjoys it. Nobody who attends a circumcision. Many of the women start crying. Most of the men start cringing. The baby starts screaming. It is horrific. And I've probably attended more than anyone in this room. And they're deeply troubling. The mothers, one or two of my friends, one of my friends I know that during the circumcision ceremony, she went upstairs and stuck her head out the window because she couldn't bear to hear her child scream in agony. So nobody really enjoys this. They really think and believe and truly believe that it's done for the health benefits. And they think, well, they go to the doctor says, yeah, I've done it. I've had my own kids circumcised. So a parent, obviously, they're like, well, if the doctor did this in the best health interest of their own child, then I'm a bad parent if I don't do this for the best interest of my child. And then they're told lies, and then they're given misinformation, and then their rabbis are telling them, they're not going to be a member of the Jewish community, all yada, 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 nonsense. But I believe that in my community, which is a highly educated community, I believe that once they get the facts and the information and the misinformation is dispelled, and they learn that what they're doing is very harmful to their child and permanently damaging their child. I do think there's going to be a shift, and I definitely think it's going to be with the mothers, because right now, as I mentioned earlier, the current climate is one of putting child's needs and child bodily integrity first. Women are doing a lot of research. I don't want to conflate the issues, but they're doing a lot of research on vaccines, and they're doing a lot of research on the current, like the food dyes that are being retracted. Red dye 40, I believe is the name. And so they've been very instrumental, and it's the mothers who have been doing that. And it is a female issue. This is about your baby, and the first week that your baby is born is the only mammal that is surgically modified within the first week of being born. I mean, it's crazy. Imagine a dog has a baby and then takes them to the dog doctor to have the dog's genitals modified for health reasons. I mean, it's nonsense. But when you're culturally conditioned to believe that this is the right thing to do, and doctors, you know, highly educated doctors are telling you this is the right thing to do, especially as a first-time mother, you're so, you know, I don't have any children, but I mean, to be honest, if I had had a son 2 years ago before I read this article, I would have, it's the default. You do it in the best interest of the child. So I'm so happy that I came across this article, and I wanted to encourage, actually publicly, all of the human rights activists, especially the Intact activists, to continue doing what you're doing. Even a simple post on Facebook, you never know who's going to come across it. I came across it. I don't know who even posted it. I don't even remember. But obviously it was an Intactivist. And so I believe what you're doing is, Shay said yesterday, God's work. And to keep doing what you're doing, because you never know who's going to come across it. You just need one person in one community. And I definitely believe that Jewish persons should be talking to the Jewish communities, Muslim persons should be talking to the Muslim communities, Christians should be speaking to the Christian communities. It's my understanding in that religion that, you know, Christ died for the sins and it's no longer required according to the New Testament. I don't know that much about it, but I have studied Christ consciousness and the values of Christ consciousness, which resonate deeply with me. And so, yeah. Any other questions? I hope that answered your question. Yeah.
But you're popular. You've got tons of questions. I wanted to talk about, thank you for this so much. I wanted to talk about cultural conditioning a little bit, because in the paper that I wrote, one of the things I quoted Gallagher, who wrote a book about the history of circumcision. And one of the things that a lot of Jews don't understand is the reason why we circumcise, among many, is actually the sacrifice of pleasure, right? It's actually just so that the ridge band has these nerve endings that are sympathetic to the nerve endings in the walls of the vagina and the anus, right? So not only does the person with the penis have lots of pleasure, but also their partner has a lot of pleasure, right? So it's actually a sacrifice of pleasure, right, for the purpose of being in a part of the tribe. And that there's a cultural conditioning all around that. But what I found really interesting in that study was that it changed over time. So before the Roman times, it was just that tip ridge band that was cut. So for the most part, Jews looked like they just kind of had like a 3-skin instead of a 4-skin. So there was still a lot there. And what was happening was Jews, a lot of us either we want to assimilate or we don't want to assimilate. We have a whole spectrum of Jews going through that. So Jews who were, in the gyms around Roman times, they wanted to look exactly, so they would stretch it out a little bit and do this procedure to make it look like they had the same 4-skin instead of a 3-skin. And then there was a kind of an issue in the community. I actually want to read this.
Sure.
To discourage men from trying to restore their foreskins, the traditional operation was revised. Mila, as the first state of circumcision is called, simply meant cutting off a portion of the infant's foreskin. Still, enough of it usually remained to enable a surgeon to create something resembling an uncircumcised penis. To prevent this, probably around the middle of the 2nd century, rabbis augmented Mila with Perriguey, a radical ablation of the foreskin that bared the glands entirely, like took off the entire foreskin off the glands. Once established, Perriguey was deemed essential to circumcision. If the mole failed to cut away enough tissue, the operation was deemed insufficient to comply with God's covenant. That's Gallagher, page 17. So
I'm rolling my eyes.
I know. I know.
As you're reading.
Right. And you'll see the same, this same trend you'll see with Kikuyu women in Kenya, that the more the group is persecuted by outside colonial forces, the more they feel they need to cut deeper, they need to cut more, they're trying to take away our identity. We have to cut more. We have to make sure that it's more permanent. We have to make sure that it can't be, it has to be visible. You got to feel it. You got to know it. This is who you are. This is your identity. And then that becomes a part of the cultural conditioning as well. So,
Correct.
yeah.
Yes, I agree with that.
Yeah.
Absolutely.
Thanks.
It's kind of crazy.
Yeah.
Cutting off body parts, genitalia.
Thank you, Deborah. It's an impressive presentation. I'd like to share it with many of my friends who
Oh,
are
thank
really
you.
uninformed at this point. But
Thank
to counter one of the defenses of circumcision about HIV, we now have some very effective prophylactic drugs for HIV, Truvada, Descovy, drugs like that. They are 100% more effective than circumcision. And any doctor who says that circumcision, will prevent HIV is a quack, because that's not true.
Well, it's counterintuitive. You remove a protective layer that protects against infections in order to prevent infections. I mean, make that make sense? I don't understand. It's ridiculous. It's this whole thing. The fact that we're even here today is crazy. This is 2025, and I know in 20 years, I watch documentaries and they say in modern times, but we're not going to be modern times in 100 years from now. So I don't want to say in modern times, but in my lifetime in 2025, the fact that circumcision occurs is insane. Okay.
Hi, thank you for presenting. I have a question on the specifics of separating cultural conditioning from faith and spirituality, since it can, both provide instructions for life, and one seems to be kind of a subconscious instruction, and one as we follow religiously, if you forgive the double usage of that word, redundancy. But yeah, and then follow-up question to that, if you have any specific sort of differences between the two states. Follow-up to that would be in a faith community, especially in faiths that we're accustomed to in Western worlds, where even the word faith kind of denotes a hierarchy of decision, of thinking, of kind of a top-down mentality of power, literally. How would you suggest finding empowerment in addressing that system?
That's a great question. I don't know. Addressing hierarchy in the world of power. I don't know. I think that's beyond my pay grade for my purposes here today. That's a great question.
I think maybe if it helps narrow it down, is it the science versus faith, sort of conversation and dialogue? Maybe how would you approach someone who is deeply religious?
I see.
Authority within that spiritual.
Understood. Okay, so basically, correct me if I'm wrong. How would I approach a rabbi, for example, who is deeply religious and has authority in the community? From a religious perspective, is that what you're saying?
Yeah, and maybe even just stepping out of your lane, essentially, by approaching questioning, I think is one of the biggest conditionings, at least I got from faith growing up, was that the head of the church is our leader, and then in faith are religious, the bottom of the house is the leader. And so obviously it's punishable to disobey. And so I'm wondering, fighting that and recognizing how is that different from cultural conditioning, especially in this sense. It's one of the systems of power that's kind of stepping in the place of faith would be the dogma, which we religiously adhere to, but without religion.
Okay, I'm going to try to answer. There's a lot. I'm going to tell you from my perspective. I grew up with two brothers, and so I was kind of a tomboy. But feminism was something very important to me and also to my family. So I kind of grew up, both of my brothers are doctors. and they both attended Vanderbilt Medical School. So education and financial independence was always very important values in my household. And there was never a focus on marriage necessarily. It was always about education. Actually, the day I graduated law school, at the ceremony, my father came up to me and said, when are you going to start medical school? So I'm serious. Yeah, and I'm not done yet, just give me one more second. But in terms of religion and spirituality, I feel like a lot of people do give reference to the rabbis or the head of the church, and they are males. And I do think you have to approach them delicately without abusing their ego. And in that sense, I think the best way to approach them is to first approach the doctors in the community, who can then approach. I think I would personally love to have a few doctors in my community get on board. And I think, now that I'm standing up, it might lead to a few more doctors looking into it and maybe like agreeing with me, but it is very taboo. Nobody in my community supports me. My father is very proud of me and supports me that I'm here today giving a speech. And my mother supports me privately, but not publicly. She's very afraid for me, actually. She's like, what if people, all, come at you or, ostracize you? And she's very concerned for me in that sense. So I do think there is a male hierarchy. I do think that's an issue, but there's a lot more female attorneys, a lot more female judges, which I see more and more in the courts every day. So that's a good thing, but also approaching the doctors who can then approach, female or male doctors, who will then approach these figures in the community saying, well, what you're doing is very harmful, and maybe you're not aware of it, but as a doctor, you shouldn't be, you're harming people. And maybe that's probably the best approach I can think of on the spot.
Yeah, thank you.
I'm a Jewish man, and something struck me when you were talking about more women speaking out about this than men in the Jewish community. And I've come to understand my circumcision as not just a physical wound, a sexual wound. I understand it as a spiritual wound. And to explain, the circumcision cut off part of my penis, but it also cut me off from my Jewish community. And I think there's a lot of Jewish men in this room. I'm not going to say that I know what their experiences are, but when I live in or am a member of a community that would do this to me, I'm not feeling like I belong there. When I'm a member of, I'm a physician, when I'm a member of the physician community, and they could do this to me, I don't fully belong there. When I live in a country that allows this to happen, I don't fully belong here. This is a spiritual injury. And the reason I'm bringing that up is that I think, and this is just intuition, is that the Jewish men that would speak up against this have already left. And I'm just curious if you have any thoughts on that.
I don't think so, necessarily. They left out of the country, you mean? Or out of the faith, you mean? Is that what you mean? I don't think so. I think there's a lot of really, like the Gen Zs, and there's a lot of people in my community that are very forward-thinking. Gay marriage is accepted in my community. There was a beautiful lesbian wedding in my community, and the parents that are uber wealthy had like $1 million wedding for them in Mexico as a symbol to show the community that, they are deserving of these lavish weddings too, and it's not to be hidden. And so I do think there's like a shift in, I'm from a Jewish community in Los Angeles, and obviously from the West Coast were a lot more liberal. And I don't think that the Jewish men have all necessarily left. I think they're unaware still. I think most of them are in dormant mode, like I was.
The point I was making is that the men who feel wounded by circumcision specifically, I find it very hard to identify as being Jewish. In a way, it's a relationship to a dysfunctional family. If my family did this to me, how can I be a member of that family? And I think that a number of Jewish men, I'm aware of the Jewish men who have been harmed by this through communities outside of the Jewish circle. So I think within the Jewish circle, there's a lack of awareness of how many Jewish men are affected by this because they've already moved away from the community.
I hear what you're saying. I think there's a lot that are unaware that they've been affected by it, though.
Yeah.
So you're saying the ones that have been affected maybe have already drifted out of the community?
Is not within the circle.
I don't think there's any voice within the circle at all. I think in my community, the men who have been injured, there are some men that that do acknowledge being injured, but I feel most of them are unaware that they've been injured, either spiritually or physically at all. Personally, I'm a very proud Jew, and I want to make that clear. But as I'm getting older, I'm a lot less religious. I'm a lot more spiritual. I don't believe in labels. Religions tend to divide. The original intention of a religion is to provide, guidance and solace and really love. The basis of all religions are their good intentions, but unfortunately, they've turned into labels and killing and death and murder. And so I've kind of drifted away from, religion as an ideology. I'm much more spiritual. So I don't know if I'm the right person to answer this question.
Okay, well, Deborah, you're very popular. I know you have a flight to catch.
No, I have some time. No
Okay,
problem.
well, we're going to do 4 more comments.
Sure, no problem.
And then, Aliana, we're going to go with you just since you're here, if you're ready.
Sure.
I'm going to pin this.
So this wasn't the first thing I wanted to mention, but I want to contribute to the discussion just now that I have an Islamic background, and I mean, the Islamic side of my family definitely doesn't know how I feel on this issue aside from my father, because I never felt comfortable connecting to that side of the family.
Okay.
And on my Jewish heritage, I even avoided learning about Jewish culture because I just felt no connection. So when I contribute that, I also feel that sort of an injury to my heritage and spirituality and faith. But what I really wanted to mention was on the discussion that I think Joe was talking about on alternatives for HIV, not even alternatives, how it's treated now. And Joe was talking about Descovy and Truvada, which are PrEP, pre-exposure prophylaxis, which you can take to prevent an HIV infection, and it's extremely effective. I also really want to bring attention to post-exposure prophylaxis that people should be aware of, because circumcision obviously doesn't prevent HIV, but PEP, I don't remember what the actual name of the medications are called. Sorry? It's the same ones? So anyways, I actually took something differently. I was exposed to HIV one time, and in this ER visit, and it was an ER visit, no one else would deal with that. On a sort of a notice, of course, it's an emergency. And the doctor in the ER told me, it's inevitable, but it's inevitable that you will eventually catch HIV if I continue to stay with that partner, which is not at all true. Prevention is extremely effective, and people become undetectable after they've been on treatment long enough, and they cannot pass it on regardless if the other person is on PrEP or uses condoms or, yeah. And I want to mention that they specifically did not mention circumcision in this visit at all. They didn't be like, so is your partner circumcised who has HIV? And because it's ridiculous. There was no need to mention it because circumcision does not prevent HIV. They did not mention it at all. And I would like to hope that doctors in the future are much more positive around HIV prevention, and hopefully this contributes to preventing male genital cutting as well, because circumcision does not prevent HIV, but PrEP and PEP do prevent HIV, and people can become undetectable and untransmissible. Thank you so much. I thought that was very important to share.
Thank you. I agree. It was very important to share. Thank you for sharing.
So I'm going to come over to Trina, and just kind of to follow up on Lee's point, as a Jewish doctor and I'm a Jewish lawyer, right? You know, you got all the bases covered, not the Jewish lawyer. Is it definitely pushed me away from the faith, which is easy to believe, right? It's like something that would do this to you. It's hard to really get behind, right? It's like, oh, am I really part of this community that harms children in such an egregious way, including myself, right? It's not. So anyway, we have a few more comments. And then before you leave, Deborah, I want all the lawyers and soon-to-be lawyers to get up here and take a picture, but we're going to finish some comments. I'm just putting that out there because, it's going to be a great photo op. Anyway.
I understand we live in a genital cutting culture, but I have a hard to ask question that I feel like is important that I personally get the information, whether you distribute that information to me or not. It's more so how to answer like Jewish family members. For those who are doing this medical practice.
Alleged.
Say again?
Alleged.
Alleged, thank you.
It's a legal term.
Yeah, sorry, it's hard to
It's
not
my
share the
favorite
feelings.
legal word. Alleged.
The question is, how do we answer the question of, how do we answer those who are doing this because they're afraid they won't get into heaven if they don't do this?
Okay, that's a great question. I'm not what are you asking?
In Judaism, no heaven.
I don't believe, I've never, my understanding is that if you don't accept Jesus Christ and in the Christian faith, that you won't be allowed into heaven. I don't know enough about that. That's the only time. From a religious perspective? Yeah, so the only time I've ever heard of not being allowed into heaven in any context, in any religion, is if you don't accept Jesus Christ in the Christian faith. So it's not really a big notion in the Jewish faith that you won't be accepted into heaven if you are or if not circumcised, but
what is the spiritual purpose of genital cutting?
Well, I don't think there is any, and I think the proffered ones are nonsense. So I mean, I don't want to what's the spiritual purpose of amputating a body part that God intended to be as part of it? Honestly, I think it's they say it's blasphemy if I get up here and I speak against circumcision. I think it's blasphemy when you mutilate God's creation. God created.
I think there's a sociological function too. Like if you're going to cut your baby in front of everybody, it's a sacrifice you can't fake, right? As Deborah was saying, parents don't want to do this, but they have to show that they're in. So it's like, look, I'm so committed to this tribe that I will subject my child to extreme pain and literally bleed him to show my devotion because I can't fake that, right? I think that's the sociological, and it's one of the reasons why, Judaism, Jews, we really stick together. But as Leif and I were saying, it's like, look, well, do I want to stick together with someone who's doing that to children? It's a hard
You
sell.
can stick together and just modify the
Correct.
tradition.
Yes. Anyway, Martin, another.
There's
Jewish
a lot
lawyer.
of beautiful things about the Jewish culture that I very much value, and that this is probably the only thing in the Jewish culture that I'm repulsed by. Everything else, whether I agree with it or not, it's a beautiful culture. Everybody supports each other. It's about life. The focus is on life. It's always on saving life. It's always on maintaining and preserving your health. And that is why I'm here today to say it's okay to be Jewish and not do circumcision or have your child be circumcised, you still can be a very proud member of the Jewish community. And just, you know, there's a lot of things Jewish people do that they're commanded to do. They're supposed to observe the Sabbath. They're supposed to keep kosher. They're supposed to, you know, officially marriage in the Jewish faith is only between a man and a woman. But a lot of these things have been modified. Everything essentially almost has been modified, and almost no one follows most of these things, especially in my community. Most people, they don't maintain the rules of kashrut, which are kosher. Most of them drive on the Sabbath. Most of them do a lot of these things. But the one thing across the board, despite, it doesn't matter your level of education, level of religiosity, financial status, it makes no difference. Across the board, this is one thing, it's almost like zombies. Nobody questions. And unfortunately, the medical field supports it. So I think if the medical field did not support it in the United States, there would be a big shift, at least in my community, because it's very like education based. Most of my friends are either doctors, lawyers, accountants, dentists. I mean, from my grade school, like everyone it was MBA. I mean, it's all about education, which that's also something about the Jewish culture that I really like. It's about self-education and promoting your, furthering your research and education on all topics. And one of the main tenets of Judaism is to question. It's all about the questions. Rabbis encourage questions. But this thing nobody wants to question. But I'm here to question it. And yeah.
An excellent talk, Deborah.
Thank you so
for
much.
it. You also should pick stocks because you're reading my mind on the things that I want to say. So you're obviously clairvoyant.
If anyone has recommendations, let me
So in the context of cultural conditioning, let me work backwards from the things I was going to say. And you touched on that just now. There are certain basic tenets of Judaism. Kind of an overriding one is tikkun olam, to heal the world, basically, to do no harm, to leave the world a better place than you came into it. And I think as we, and I'm going to use a pejorative here, as we work to end the scourge of circumcision, we are doing that healing work. We are doing that, leaving the world a better place and getting rid of something that is not really helpful. And another tenet of Judaism is science prevails.
Yes.
When we learn something, we are willing to change our behavior in Judaism to match the latest science. Personally, I think germ theory and the harms of Mitzitza B'Pei and things like that should have put an end to that because we have the science there. But when germ theory came about, Reform Judaism said, you know what, it's kind of unhealthy to leave a scar on the baby. Should we be doing this? And they had a big debate. You know, Reform Judaism, which is the largest sect of Judaism in the United States, started in Austria and Germany, and they actually held a big convention to determine whether they should continue requiring infant circumcision. And they reached kind of a compromise. While they did decide to continue with the requirement of infant circumcision, and by the way, if you don't do it, the obligation remains on the child to eventually get it done. And there are exceptions. If the child is sick, there's a few reasons why you don't do it on the 8th day, but that remains with the boy or the man for the rest of his life. But in the late 1880s, Reform Judaism in the United States voted that circumcision is not required of converts. So if you're an adult man.
Wait, I'm sorry, say that again.
In the United States Convention of Reform Judaism in the late 1880s,
okay,
they took a vote to modify within the religion such that if a man converts to Judaism, he's not born into it by bloodline, but he converts to Reform Judaism, neither he nor his sons have to be circumcised.
That's
Yes,
great.
It's optional.
I've never heard of that. In my research, it said even reform, in the reform community, it's required, but
It is.
I'm happy to hear that it's not.
It is required if you're Jewish by bloodline.
I see.
But if you are already grown and you're past the bris time, you don't have to get circumcised to be fully Reformed Jewish. And we had a big discussion about this in Orlando because the biennial Reformed Jewish Congress, they had a bunch of transgender and other issues that they wanted to talk about. It's a very forward-looking sect of Judaism. The United States is the only country in the world where Reform Judaism is the largest sect of Judaism. Elsewhere around the world, it's a minority sect. And what we would call conservative or orthodox, it really dominates everywhere else in the world, the UK, Australia, mainland Europe. But I think this is a really promising thing. People have said, if religions have changed in the past, why are they suddenly set in stone? Right. In other words, from a cultural standpoint, if we have changed what the operation of circumcision is, if we have changed who has to get circumcised to join the religion, why can't we continue evolving on this issue? So a lot of people don't realize that converts to Reform Judaism do not have to get circumcised. It really comes down to the recommendation of the rabbi, but the convert can still say no. Again, in the context of cultural conditioning, Che brought up the question of epispasm, which was the early form of foreskin restoration that guys who had the 3 skin were able to do. But that section of the Talmud, and you mentioned that you're familiar with the Talmud on this, it really says some remarkable things. And I want people to think about the bris party in this regard. Not only did the Council of Rabbis in 140 AD radicalize the circumcision procedure to add peria, which they said the membrane shall not touch the corona of the glands. So it has to be cut so thoroughly that it doesn't touch any part of the glands when they're done. They also said this is no longer safe for fathers to do because the original Abrahamic instruction was for the dad to cut his son. Joseph circumcised Jesus. There were no mohels at that time. Mohels came along 100 years after Jesus. So they said, we're going to create the new job category of mohel because you have to be surgically trained to do this, or we're going to start killing Jewish boys right and left with this surgery.
And
so
they still kill up to 100 the babies die per
140
year.
a year, yeah.
Reported in the United States. So
Right. Who
that's
knows?
reported. So there's a lot of kids that they probably report as something else, like bleeding. I don't know. Who
Exactly.
knows? But children die still because of it. It's crazy.
It is crazy
For
and
a
dangerous.
non-required surgical, like I had to have a surgery done personally, and my brother is like, go get a second opinion. And I was like, okay. I was just gonna be like, okay, well, this doctor seems legit. I've been going to her for like 10 years. I went to the second doctor, and the second doctor, an Asian American doctor in Los Angeles, part of the UCLA group, looked at my file and was like, wait, she recommended surgery? Because she was like, no, wait, you don't even need a surgery. We could do a little like, simple in-office procedure. And the thing is, there's such a high, having surgery done is always the last resort, okay? Under any circumstance, every doctor knows that. Even my doctor said, oh, if you want, you can get a second opinion, you know? And everyone tells you the last thing you should do is surgery. But here, the second the infant is born, they perform a surgery on a healthy child. The child is healthy. What are you doing?
No second opinion.
It's crazy. Oh, many opinions, just not from.
But
it's crazy.
As we know, within the legal profession.
Like once you see it for what it is, you can't unsee it. And I don't know how. I haven't been able to see it for so many. I saw it as a 6-year-old. I saw it very clearly. But then I don't know. They're like, oh, the doctors. Right. You know, doctors were saying smoking is healthy in the 1950s. You know, doctors. You know, I mean, I have respect for the practice of medicine, but this is not medicine. This is not medicine. This is crazy.
Right. But your point is well taken, that if there are deaths from this procedure, you're not really asking for informed consent if you don't document that. You have to tell parents that there's a risk of death from this, or it doesn't count as informed consent. So they have to know the risk of morbidity and mortality from it.
But
So
it's
the-
very it's minimized, and the mother's like in labor.
So the next step of the Talmud, after they said, you have to remove this much foreskin, and we have to create the job category of moil, and this is what it has to be, and the moil will actually go on trial if they don't do it correctly. But the last stage was, and you have to have a gathering. They didn't call it a party, they didn't call it a bris party, but they basically said it has to be witnessed by the community and by the family. Some of you have probably heard that bridesmaids, and I don't know if this is true or not, but bridesmaids were first instituted to run after and knock down the bride if she tries to escape at the altar. And that was their purpose. And similarly, in a bris, the reason that you have the family, the community,
some of those bridesmaids.
a minion there is to make sure that the parents don't change their mind.
Oh,
Because-
interesting.
And that is actually stated in the Talmud. They say that you have to circumcise within 8 days, and their reasoning has nothing to do with vitamin K in the bloodstream. It has to do with the fact that parents tend to fall in love with their child by the first week. So do it before they really see him as a human.
Well, the mother actually develops, I read about this also. The mother develops a connection. That's why it's so much harder for the mother to do it than the father to.
So just in the context of cultural conditioning, I wanted to just let you know what that whole section of the Rabbinical Council says. It tells you how to increase the circumcision. It tells you about the moil, and it tells you that you have to have the community involved so that you don't run off. There's a marvelous movie called A Price Above Rubies, if any of you want to watch it, about the Orthodox community in New York. And there is an obstinate young woman who thinks for herself, and when it comes time for her son's bris, she doesn't want to hand him over. And the community basically rips the child out of her arms in order to do it. And that is what that 140 AD gathering of the rabbis was anticipating, that was going to have to happen. The circumcision was going to happen one way or the other, even if the mother didn't want it to happen. And then the last thing I wanted to say addresses Carrie, which is you were asking about the hierarchy. And of course, within the Catholic Church or the Episcopal Church, any of those, you have priests and bishops, etc. Judaism rejected the priestly class. They said, you know what, these people are corrupt. They're working on their own self-interest, and there's substantial evidence that circumcision did not start with Abraham. It actually started with the Jewish priests around 800 BC, and as a rallying point, because after the diaspora, the Jews didn't all know each other. They ended up in different countries, and they were all coming back together. And the priest said, we need to have a unifying rite, a unifying procedure. And that's where circumcision comes from. And you can even see in the Bible where some people were questioning this, going, wait, we used to do what? And the priest said, relax, you just lost the custom while you were off in the other countries. But now that we're all back together again, we need to start doing this. Judaism was fed up with the corrupt priests. They kicked them out. There are no more priests in Judaism, and rabbis are basically teachers. Rabbis don't tell you what to do. Unlike in some Christian sects where you kind of have to follow the hierarchy, there's no real hierarchy in Judaism. There's essentially 3 classes of clergy. There's rabbis, there's cantors who do the singing in the synagogue, and there's moils. Moils are considered minor clergy. So that's all that's left in Judaism, which means who's making the decisions? Just like you said, we're making the decisions. It's left to the wisdom of the individual people. There are rules and laws that we're supposed to follow, but at the end of the day, it's each individual's or each individual family's decision on what they're going to do.
Well, thank you for that. You provided a lot of context. I didn't know a lot of the history of, the priests and things of that nature, but I appreciate that. Thank you so much.
Okay, we have one last comment from John Geishiker, and then we're gonna get through the program here.
My comment has lost its timeliness, unfortunately, with some very good comments from other people. I wanted to bounce off of Dr. Leaf's comment about Jews being alienated from their own spiritual and even family background because of their circumcision. I get those calls all the time. I mean, Doc has my personal phone number is on Doc's website and about 20 other websites. And so I get calls from angry Jewish men. And the favorite comment is, what were my parents thinking? They're atheists. They never go to temple. They don't observe the high holy days. They don't keep kosher.
Yeah, well,
What were they
that's-
thinking?
Well, the doctors.
And
Then
so I understand their anger completely, and I understand your anger completely.
I would be an angry man, regardless of my religion. I mean, if you know, I'm going to be honest with you. When I hear or see a video of a woman who's been genitally mutilated, I feel bad for her. And now, when I go to a family function, I look at all of the men and all of the male children, and I actually view them as victims of genital mutilation, and I feel bad for them. I try not to do it. I like consciously have to not think about it, but yeah, I'm sure there's a lot of angry men across the board in every religion. Yeah.
Okay, well, thank you so much, Deborah, for coming and knocking it out of the house and providing some much needed context and education to the Jewish community and also just the broader community.
Thank you so much.
So we're going to get all the lawyers up here for a nice photo op before you have to head out. And then we're going to have the lawyers and hopefully all the plaintiffs, if you can get a hold of Dane. Oh, good. Okay, let's get the lawyers first. Come on, guys. Yeah. I think on the stage, right? Yeah.
Bruchim?
Okay,
I've
you guys
heard
are
of
all
it.
taller than me, so.
It's a Jewish
No, I'm
organization
kidding. It's fine.
Yeah,
you're a lawyer. Yeah.
Jewish families that are choosing not to circumcise.
Oh, that's great.
So they're way too many.
It's all-
Okay. Michael.
I mean, oh, that's great. That's wonderful.
This is for the press.
Excuse me. No. Wait, there was another female lawyer, no?
Was there?
Am I the only one?
I know.
Okay.
That's an honor.
Yeah.
It is an honor.
Okay, everyone look at Shay. And then everyone else. 1, 2, say mitzvah.
Yeah,
Mitzvah. Say money. Okay. All right, and then Dane's coming.
Wait, and all the plaintiffs.
Yeah. So is Dane coming, Sarah? Okay.
For skin, for the win.
Okay. Well, maybe we'll.
When you come in.
Do you want to come up here, Sarah?
When you come in.
Well, we could come back. I mean, when do you leave?
No.
Now.
But it's okay. You can do
Okay.
it with the plaintiffs another time. No problem.
Yeah.
The actual picture.
I should have given them more of a heads up.
Oh no.
Oh no.
That was my mistake.
Oh, you need to put that shit.
It doesn't matter.
Yeah.
My belly is sticking out. Okay, there we go. Okay.
Give everybody the picture.
Someone's got to get a good picture of these multiple devices.
We'll probably make a 3D scan.
Exactly.
Oh, more light.
When Dane comes in, we'll be like, ah. Yeah.
I know, right? Yes. Uganda. Canadian.
I'm Canadian.
You're Canadian.
Oh, there you go.
I'm English. That's why it's so nice.
Someone needs to take a picture
I'm
of
not.
my phone.
No.
Do you want to do it on your phone? Where is it?
It's over here, but it's.
We can hold Dane's picture. Yeah, when Dane
Okay.
gets here, we'll. Okay, maybe we'll do one.
You know what?
No,
Look
mine
at
is
this.
blocked.
No, I can. Oh, well, whatever.
Oh, thank you so much.
Here. Will you take one for Debbie? One more. Take like 5.
Okay. We're gonna keep
But, like
modeling.
really high, like from the sky. Yeah.
Stand by the chair.
Oh, you're a lawyer, David. Yeah.
Get up, David. Wait, we have to do that again. Everyone get your camera. We missed
Yeah.
one.
I'm sorry, David. Yeah, David, you can get behind. Get behind me.
You stand in
Yeah.
the front.
Okay.
Yeah, you're in the front.
Okay, what do I do with my
center, right?
hands?
Yeah.
Okay.
All right.
Money, yes.
Yes.
Dane, there he is. Okay. Dane, please. And Sarah Cecil, let's. Okay, this is the legal team and the plaintiffs. Great to see you, Dane.
Yes. I'm taking
Please, here, come with us, right in the front. Yeah,
It's a family. Okay, do you want to be in the middle?
No, it's
Okay.
okay, no problem.
All right.
Yeah,
no problem. I'll be
make sure everybody. Yeah, Dana's. Yeah. Say mitzvah. Mitzvah. All right, this is for the press. So, you guys were asking for press pictures. Will?
Yeah, so tell us if we need to adjust or do
Yeah.
anything, or if any of us are looking silly.
Yeah.
Yeah. No, happy.
Yeah, exactly. This is Portland, baby. Yeah, this is for you, Portland, all the children here and also around the country. All right, someone's got to get a good pic or a good clip, so thank you so much. Thank you, guys. Yeah. Thank you. Sorry about the short notice. I was like, Deborah was leaving. I was like, this is the moment. Yeah, we got it done.
Thank you again for that talk.
Okay.
That's great. And I really appreciate kind of the humanizing of the Jewish community.
Yeah.
Sometimes I feel like we're under attack.
Yeah, we are.
Deborah, can I grab that from you? Thank you. Great job.
Can I give you your phone back?
Yeah, let's charge that bad boy. Oh. Yeah. Give me a second. Let me set this up, and then we'll get a quick photo. Where do you want to take the photo? Up here? Okay, yeah. All right, why don't we take a 3-minute or 4-minute break, and then we'll come back, and Zenas is going to give his talk. All right, let's take a... Well, thank you so much for coming, Keon. Yeah, it's great to meet you too, Elizabeth. Okay, well, of course.
Congratulations on your big day tonight.
we got actually a fair number of speakers to get through in 2 hours. And I know everyone is a phenomenal speaker and we all have questions, and that's great. And we're going to continue with the questions. But I'm going to start, just moving the program along, right? So, but yeah, a big hook. We're going to get the Dave Chappelle Wrap It Up box, right? It's like, okay, guys. Not with the speakers, but with the questions. Even though we love the questions, we only have so much time here. So anyways, it's my great pleasure now to introduce our next speaker, who has been a litigator in fighting for civil rights for his career, successful business litigator, civil rights litigator, lifelong intactivist who's done intactivist litigation in the past, and who also believes that now is the time where we're going to make real gains, right? We've already filed the Hadachek v. Oregon case, and this individual has filed previous impact intact litigation. So if we could get a big round of applause for Zenus Bear, please. And here's your clicker right here, and I'm gonna mic you up.
Okay. All right. Thank you very much. I should have Anthony Lasquardo here to raise up the volume of energy in the room. So welcome to Portland. My name is Zenus Bear, and as indicated by Eric, I practice in northern Minnesota. I come from a background of Hutterite and Mennonite. My parents were both old order Mennonites living the horse and buggy life. 8th grade education was the maximum in southern Ontario. They left the Mennonite community, joined the Hutterite community in Manitoba, and then migrated to North Dakota at another Hutterite community where I was born. So I come from the Anabaptist tradition of Mennonite and Hutterite who have no tradition of cutting, but yet I was cut by a roving doctor because I was home birth. I was cut by a roving doctor, and my dad always said he thinks he has Jewish blood in him. And the only evidence I can see of Jewishness is a cut penis. That's all that I can find. And my siblings have had the 23andMe DNA testing done, and there's no evidence of Jewish genetics in there. I've been in practice in Minnesota since 1980. Civil litigation primarily. So let's continue on. I want to put this into a little bit of a perspective. Humans are survival machines for the selfish gene. The universe is infinite, stretching as we speak. 500 billion galaxies. The Milky Way galaxy is 100,000 light years in diameter. Our solar system, 26,000 light years from the center of the Milky Way. The sun contains 99.85% of all matter of the solar system. Planets contain 0.135% of the matter of the solar system. Earth is one of the 4 inner planets. Humans are a speck of dust containing 4.7 times 10 to the minus 17th power of the matter and mass of the universe. No indication that cutting changes the genetic code, irrespective of religion, culture, race, socioeconomic status. Genes have not been listening to the genital cutters. Why do we care? First, before I go, why do we care? I want to say a word to Sierra, Dane, and Cecil. They have an excellent representation by Peter, Samir, and Eric. They have put together they have put together a complaint that will be difficult for any court, in my estimation, to dismiss out of hand. That there is a progression of the whole abuse of children contained in that 72-page complaint like I have never seen in any other complaint. So, as a disclaimer on the next slide, you'll see a penis, natural born penis, about an hour old, same child, 10 days old, after a Plastibell procedure. So if you're squeamish about photos, turn away. Now, I was given a topic to talk about state versus constitutionality, and I thought, what the hell do I know, Northern Minnesota, about state versus federal constitution? So I took liberties to narrow it down because it's just such a broad topic. What do I know about that? I'll leave that to Lawrence Tribe and others that have written books and textbooks on that topic. So I hope to cover today that a baby is human. And the focus of my talk is that we should focus on the baby, not on the parents, not on medical doctors, not on anybody else, not on the religious beliefs. Focus on the baby. And this discussion that just happened the last hour or so is a reason that I think it is very wise that you did not include the religious aspect in this attack. So thank you very much for doing that. So I hope to cover the human is a right of privacy, the genital autonomy, and the fairness in the judicial system, and cover a few tales from the trenches. Most of the sites I use in this presentation are Minnesota sites, but I presume that most of the other states and jurisdictions have similar laws, similar protections for children. The Minnesota legislature, in response to a bill that was trying to stop, or there was this notion that babies were born alive and then were being killed after an abortion. So the legislature passed a bill saying that a live-born baby boy is, quote, fully recognized as a human person under the law. And that is the law in the state of Minnesota. At common law, a child born alive and with an existence independent of and separate from its mother were considered a human being. That's the common law in the state of Minnesota, which I think somebody else cited Blackstone, which I will get to in a moment. And we must focus on the rights of the child, not on the parent or religious desires. Bodily integrity, basic human rights are protected under the 5th and the 14th Amendments. The 5th Amendment protects against the loss of life, liberty, or property without due process of law. But the 5th Amendment only applies to federal court action. So if the federal court or federal entities deprive someone of life, liberty, or property without due process of law, the 5th Amendment kicks in. If it is done by the states, before the 14th Amendment, there was no remedy unless the state had a similar provision. The 14th Amendment of the Constitution incorporated those protections that we have in the 5th Amendment to prominent. Now, this involves an adult that was subject to involuntary procedures. The second case that reaches the same conclusion dealt with fluoridation of water in Brainerd, Minnesota, where the court held that no right is held more sacred or is more carefully guarded by the common law than the right of every individual to the possession and control of his own person, free from all restraint or interference of others, unless by clear and unquestionable authority of law. We get into the discussion about parental rights, the parental patriae argument, and the rights of the child. The personal autonomy is a basic human right in Minnesota. And just as an aside, the only case that I know of worldwide that has analyzed this issue from the child's perspective is the Cologne, Germany case. There they got it right. They analyzed it from the child's perspective, not the parent or the religious doctrine perspective. So genital tissue is constitutionally protected, FGM litigation, I see I have FMG litigation there, but that my spell check didn't get that. The genital tissue is protected by law both on federal side and on the state side. It's a felony imprisonment for over 1 year if found guilty. If a medical doctor even nicks or does anything to the labia or genital tissue of a female, he's subject to criminal penalties up to a felony, which is defined as being subject to imprisonment for more than 1 year. That's the definition of a felony in Minnesota, at least. It may also be the same in other states. And if you look at this, house pets, dogs, cats, other things, they are protected criminally from gratuitous genital alteration under the cruelty to animal statute, but yet it does not apply to humans. So the baby boy's right is to an uninterrupted right of bodily integrity. During the circumcision, we all know what happens. I don't need to go with that. And it is right that many people have talked about this today, that it is still a wonder why we in 2025 need to be discussing why it is wrong and illegal to cut the genitals of a one-day-old infant who does everything in his capacity to say no. They squirm, they move their arms, their legs, they're kicking. And what does the medical establishment do? Velcro straps. Velcro straps and a circumstraint. And I've always thought it would be a good thought experiment to think about any one of us going to another world where we don't speak the language, we don't know the culture, we don't know anything about them, and we land on their planet, and one of the requirements is to set foot on the planet, like stepping the foot inside of Abraham's door in Genesis 17, that you have to have your genitals altered, your penis cut. And if, hypothetically, they strap an adult down and you do everything you can to say, no, 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 don't do this, would it be a crime? Would it be criminal conduct? All of us would say in America, that would be the definition of false imprisonment, assault in the first degree, depraved indifferences, and a whole host of other crimes that would be in play. Not to mention criminal sexual conduct. And somebody yesterday mentioned that the first experience that these children have is to be cut. The first sexual experience is the traumatic severing of the foreskin. So I want to go over some lessons I learned in the practice of law. And the first case is the Fishbeck versus state of North Dakota. And again, I want to say that this was in 1997. 1997, almost 30 years ago. I challenged the FGM the statute in the state of North Dakota at the request of Dwayne Voskuil and Jody McLaughlin. They were early intactivists who approached me and persuaded me to take this case on a constitutional equal protection basis. I understand Dwayne just recently passed away, but Jody is living up in Washington. But the facts were basically that the dad wanted a circumcision, mom did not. This was right after the FGM statute was passed in the state of North Dakota. And it's a felony to cut any female genital tissue. And we pursued it on the basis of an under-inclusive statute. So the under-inclusive statute was that because genital tissue is genital tissue, and if you're protecting females, there's no reason not to protect males from the same assault on their genital tissue. So the outcome was the case was dismissed at the trial court level without a hearing. Dismissed without a hearing based on standing. And standing is an arcane argument that is available to defendants, which they use when they can convince the courts to do it. The court observed that McLaughlin and Voskuil, their convictions were very sincere, but they have no personal stake in the outcome. And the mom, Mrs. Donna Fishbeck, they said the injury to her son, this is if it is an injury, is in the past. And therefore, since we were asking the statute to be declared unconstitutional, we were not asking for money damages. So they said, we cannot give you a remedy. And so there they said, that's how they dismissed it. And I appealed it to the 8th Circuit Court of Appeals. They issued, I think, a 2-page opinion citing one case, and if I remember right, it was a case out of Wyoming, the Wildlife Association versus the Lujan. Yeah, that's the case, yeah. So the lesson I learned from that is that the Constitution takes a back seat to cultural or religious norms. Now, I want to go back again and talk about the complaint that's been filed in Oregon. It's a much more comprehensive document than I did 30 years ago. You have all of the history of circumcision, all of that history in there, and I think it will be a difficult task for the court to dismiss it without addressing the substantive issues. Another study of unfairness in the courtroom is the Flatt versus Cantak case, and I think some of you might have been there. Dan was there to observe the court proceedings. So the facts were that the boy was circed by the MD. The nurse had mom, who was a lawyer, sign a consent. She claimed that the only risk that was described was the infection. And so she sued both the MD and the hospital. The hospital was dismissed on summary judgment because the hospital has no duty to obtain informed consent. That is a non-delegable duty on the doctor. The doctor has to be involved in that informed consent discussion. So the hospital was dismissed because it had no duty, and the jury was shielded from photos of an intact penis, surgical tools, circumstraints, videotape of the procedure, animation of the foreskin, even deprived Dr. Cold of the ability to use illustrations to show the jury what the function of the foreskin was. He was there trying to draw pictures freehand on a chalkboard. And this was, the trial court made these rulings. Finally, the verdict was no negligence at all. But let's look at the evidence that was omitted. You have the circumstraint. You have the child the strapped to the circumstraint, before and after. You have the cutting. Then you have all the other tools of the trade, the Gomco clamp, the forceps, the tweezers, the cutting instruments. Those are the documents that were disallowed before the jury. And why? The court disallowed these visual evidence because it was too prejudicial. The prejudice outweighed the probative value, is the analysis she made. And so we'll get to the concurrence opinion in Flatt versus Cantac at the Supreme Court level of North Dakota stated that although the trial court is afforded wide discretion in deciding whether to admit or exclude evidence, I remain concerned that the cumulative effect of the trial court's decision limiting the plaintiff's evidence may have denied them a fair trial. Do you think? But I cannot say that my concern rises to a conviction that a new trial need be ordered. This is what we deal with in the judicial system. And fairness in the judicial system is not guaranteed. I should mention that the personal cost of bringing this action, there was a cost judgment assessed against the plaintiffs because they lost. And that cost judgment included expert witness fees for the defendant, deposition costs, travel costs to take depositions in California, one in San Diego, one in Sacramento, and one in Grand Forks, North Dakota. And so the cost judgment was in excess of $60,000 levied against that infant boy. What? Yes, that child got a judgment levied against him, but the parents under the statute are responsible for that judgment. I paid those expenses out of my own pocket. So the personal cost to bringing these actions is not insignificant unless you have a client that has an unlimited checkbook. The next case I just want to briefly talk about is the MGL versus Zabazinski. And you'll notice that all of these cases have appellate court numbers on them because these are all appellate court decisions. And typically when I take a case, I might settle with a doctor and push the other issue on the hospital to the appellate court. But in this case, the facts were that the nurse asked, "Are you going to circumcise him?" Yes. The parents did not know circumcision involved cutting. And I think somebody else said they don't, many people didn't know that they were circumcised even as 18-year-olds. But the parents told me that they had no idea that it involved cutting skin. There was no signed informed consent chart. The hospital, by policy, exempted the circumcision from signed informed consent requirements, and it was dismissed on summary judgment. Both the hospital and the medical doctor were dismissed on summary judgment. In this case, the expert witness, I believe it was either Dr. Van Houw or Dr. Cold, put an expert report together. Dr. Van Houw's credentials were attacked because he is a conscientious objector from doing circumcisions. He does not do circumcisions. And so the court said he is not qualified to give an opinion about the function of a foreskin or the cutting of a foreskin. That is how wacky our court system can be, especially with this issue. The outcome was a dismissal, and I appealed it. There was no appeal. The Supreme Court declined review, and so we were stuck with that dismissal. And the lesson I learned there, courts view circumcision from an infant viewpoint. Legal procedure trumps substantive human rights. The next case is DNN versus Thielander. A child was born with a cystic lesion on his trachea. They scheduled him for surgery to remove that lesion. And the nurse on the black surgical board wrote circumcision and gastrostomy. And there was the MD failed to review the chart, which stated no consent for circumcision given. There was no circ marked in the chart. The outcome was that the jury trial was waived by their first attorney, who was a large Minneapolis PI attorney who had valued the case at $5,000. So they waived the jury trial right. And then the clients came to see me to see what could be done. We arbitrated the case in St. Paul, and the arbitrator awarded $40,000, denied punitive damages, and I believe that Brian Morris was the expert witness for the hospital and doctor in this case. In that examination, I got Brian Morris to admit that he did not circumcise his own son. So the legal profession really lacks precedent to value a foreskin. The next case I want to talk about is DNN versus Berestka. There was no informed discussion at all. Doctor comes in, are there any circumcisions to do? Nurse says yes. Doctor says, set them up. The doctor settled for a confidential amount. The defense used that Baer decision as an award as a maximum limit. The hospital was dismissed on summary judgment that the duty was non-delegable. That is, the duty to make sure that informed consent was given. The lesson I learned here is that we need to, when these cases are brought, focus on the duty of the hospital to have the proper procedures in place to ensure that doctors do the right thing. And that is one of the things. And the other thing is sue on common law, the duty to protect the patient from harm, and use the federal regulations to describe the duty. Now, just a few reflections from the trenches. I've described a number of cases. Each of them are individual tort claims against a doctor or a hospital. That's not a way to rapidly change culture. And so anytime you bring an individual case against an individual doctor, you may get money damages to that one individual. It doesn't change the culture unless you are bombarding the courts with multiple complaints in multiple jurisdictions at multiple times. And I would say that we have to use existing laws to protect children. And there are many laws that protect children that are in place already that apply squarely to the issue of criminal conduct by cutting genitalia. And we have to focus on the rights of the child who is being cut. Too often, medical doctors will say, well, the parents wanted it. The parents asked for it. The parents agreed to it. That is a tale that is told that has no absolute merit. But it is persuasive to judges because the child can't talk. Child can't tell the judge what his preference is. It is the parents. So we have to focus on the child's constitutional rights, not the parents' right or whatever they have, feeling that they have a religious obligation to do it to their child. So finally, the future litigation, we need more clients and more lawyers willing to fight this fight. Because we can't, as a lawyer, I can't go out and find clients and have, I'll pay you to be a client. That's frowned upon. It's called champerty and maintenance, I think is what the terms are, where you're, ginning up litigation. We need a case for controversy, a child that is injured. Ideally, the plaintiff would be like Dane if he's under 18 and he is represented by his parents. There you have a marked injury because he has suffered the assault, the cutting, the mutilation. He has suffered that and continues to suffer that. And I would say that, we can all wait for a perfect case, but I think the strategy is best by bringing any case you have where you can make the arguments that genital cutting is wrong. Absolutely, that it is wrong. And if you can make that argument to a court, in Minnesota, there are 87 counties. That means there are 87 district courts and probably 200 judges in Minnesota. So if one of those 200 judges agreed with you, you would have a base to start on. Then it goes up to the appellate court and it winds its way up. So I think that the active campaign to target boys and parents and some groups and entities might pass it off as a college fund. But you have to be careful because those cost judgments, you have to be willing to absorb those, otherwise you're going to lose your clients. But so I'm almost done. So that's my talk today, and thank you very much for listening.
Okay, great. Thank you so much, Zenas.
You're welcome.
So Zenas was on the movement when it was not quite as fighting uphill, especially 30 years ago. Geez. So we're gonna have a few questions. I know there's a lot of questions, and so we're gonna make it quick. So I'm gonna go Doug, Michelle, Daniel, and then Shay, I may cut you off because we gotta go. So Doug, let's.
Like California, they have I just reading the Civil Rights Department got updated. So there's like a 1-year statute from the time that minor turns 18 to file a discrimination claim under any causes. Does that happen in Minnesota? Do they have like a similar process? That might be like to get the judgment from the discrimination agency, then enforce it in court. Could that be a very way to do an asymmetrical low-cost strategy?
In Minnesota, the law is that if an infant child is injured, they have until their 18th birthday plus 2 years to bring a cause of action against the wrongdoer, whether it's the hospital, the doctor, and that's where you get that 18-year-old. If you can get those, that would be a good plaintiff to have to sue on the constitutional rights or damages. But damages, again, only bring you back to money in your pocket, not changing culture, except the issue of if you get enough judgments against doctors, their insurance companies are going to say, we have to do something about this. We're not going to be able to continue paying those judgments by doing improper surgery, or not improper surgery, but mutilation of children.
Okay.
Yeah, yeah.
Okay. As Zenas mentioned, I did attend the Flat versus Cantac trial in Fargo. And the hospital in Fargo is the biggest hospital for like 200 miles around or something like that. And it's the biggest employer in Fargo. So it's not just a problem with biased judges, it's biased juries. Because in this case, virtually everybody in the jury pool either worked at the hospital, had a family member who worked at the hospital, or one of their best friends worked at the hospital. And they weren't exactly inclined to find the hospital, liable for a lot of money or anything like that. The one person in the jury pool who admitted that they did not cut their own son was immediately let
Stricken.
go by the defense.
Yeah.
So it's not just the judges who are biased, it is trying to find a fair jury.
Right. And just to respond to that, as my recollection is, the jury pool was like 27 or 28 citizens of Cass County, North Dakota. And I think 14 or 15 of them were either employees or spouses of employees of the very hospital that was being sued. And I asked the court to nullify the jury panel and bring in a new panel. Bring in a panel that is not geared so tightly towards the medical establishment. And the defense argued, well, the members who are working in the medical establishment are also citizens, members of the community. And if they say they can be fair, we're not going to deal with that. So that was a non-issue, but thank you for bringing that up, Dan.
I'm wondering if you ever thought about bringing a movie of a child having this done to them for the people who don't know what that means. We've seen these photos where children are crying and they're tied down. And I mean, I think if people saw this, I don't know if you ever tried, it just came onto me that for people who don't know what circumcision is, and they think it's a little cut, but if they see what happens to a baby and how they cry and cry and cry.
Yeah, in fact, I did have the Jim Garrigus, I don't know if anybody is familiar with the Jim Garrigus teaching videos. You are? But the Jim Garrigus teaching videos, I tried to introduce them. He has a video, a teaching video of a Gomco clamp procedure, a Mogan clamp procedure, and a Plastabell procedure, all on one videotape. That was dismissed and disallowed at pretrial. They would not allow that to be shown. And it is one of the issues.
Well, as Zenas said, so it's, there's a whole body of law with rules of evidence, right? I was thinking what makes sense. There's two
prejudice outweighed the probative value.
And in plain English, it's like, let's say you're suing your landlord, right? Because he raised your rent too high. And so you try to show the jury the landlord kicking a dog, right? Like that has nothing to do with the issue at bar, but everyone's going to not like it. So they're going to be prejudiced against it.
Right.
Now, this makes no sense because it's probative. We're talking about what you're doing to the baby.
Right,
really.
exactly.
So,
Yeah.
But that's a judge has the power to do that, should be overturned on appeal, hopefully 30 years later.
Right.
So we got one last question from Shay, then we do a power talk from Daniel, and then we're going to hear from Lynn. So, okay.
I had to beg to be the last person to ask this. So if you became a judge, hypothetically, would you have to recuse yourself because of your views? Because I mean, we need better judges as well.
Yeah.
You said there's 200 judges, right?
Yes, yeah. I don't think that I would have to recuse myself because I think I can sit fairly in judgment of somebody who's advocating cutting genital tissue of a non-consenting one-day-old boy. I know that in my heart, that is wrong. I don't have to go to a law. I know that is absolutely forbidden by my morals, by basically society, and it is prohibited by assault in the first degree and other types of things. And one other point, in the child protection statutes, the law says on discipline, it's talking about discipline. And reasonable discipline can be asserted against a child, but it says cutting is never permitted as reasonable discipline. And so that is a clear statement that if you cut a child, that goes beyond the acceptable.
Well, thank you so much, Zenas. We appreciate all your work.
Thank you. Thank you for coming. Oh, you're welcome.
Yeah, so hopefully, we hope to work with Zenas in the future again. Daniel, you ready? So we're going to have a quick power talk, 10 minutes, because this is an Intact Litigator Day. And although Daniel may not be a litigator, he is what a lot of people on the live stream and watching afterwards can do. He does a lot of hard work in reaching out to press contacts, right? Saying, look, you guys, we all care about this. We're all here. Most of us flew in, some from Uganda, some from Australia, Canada, you name it, obviously the US. But if you care about protecting children from genital cutting, how you can help is finding press contacts, amplifying this lawsuit, this equal protection challenge, other cases, controversies, newsworthy events in the Intactivist movement, and telling the press, right? And so Daniel's going to give us a crash course on the internet, a crash course, and how you collect media, how you reach out to them, and then we're going to wrap up with the last two talks. So I do, yes. All right. What we're going to do. Oops, well, it's a different program. There we go, and just use this this guy right there, and don't touch anything else.
Mine right there? Okay, I can't see my screen, so I'm going to look at you. Okay, so this is about what you can do for activism. So I'm going to kind of go through this quickly, but I think you're going to get most of the points here. This is basic marketing. This is like 101.
Yeah.
Every company in the world basically does this, so I don't see why we can't. I'm sure we have lawyers, doctors, and stuff. I'm sure we can do this basic stuff. So this is to give something, all of you, something you can do that is actually effective and efficient, rather than do social media posts and all that kind of stuff. I mean, social media posts are valuable, but this is a way of doing something much more valuable. So I used to be a check practitioner. I was an orthopedic rehab therapist. That's what I should be doing. I shouldn't be doing this, but I can't be passionate for this. But in my business, I was an orthopedic rehab specialist. So I was very good at my job, but I was struggling to get clients until I learned how to market myself. Okay, and it was all about marketing. The funny thing is, when I met Anthony Squadro at the,
sorry, I'm going to take this mic and
Anthony Squadro, when he gave his talk at the 2015 Child Rights Convention, I was very impressed with the way he was talking, and it actually hit a thread with me because I had struggled in my business to get people to, even though I was a really good trainer. I mean, I was doing these lab tests. I don't know if you know any trainers that do lab tests, like hormone tests and stuff like that. I mean, this is stuff that most trainers don't even know about. And you know, this is a first rib angle test. So I'm doing all these different tests. I was very good at my business. The point is that I had to get good at marketing in order to get my clients to sign up for me. So anyways, this was my first protest. When at this protest, I did 4 protests with the Bloodstained Men, one of the best times of my life. And I noticed that we didn't have that much media coverage. In fact, the only person that showed up to do any media coverage was a student reporter that happened to drive by and saw the protest. And I was like, well, why can't we get more coverage of these really important events? Because, you know, a lot of these small towns, they don't have anything to cover. So in 2018, I started a media program, and in 5 days, I got 8 media articles published. So I literally spent the whole time. Okay, so these are the pictures. Now, I didn't do this. I don't want to take credit for this because this is the Bloodstained Men's, but I had an influence on this, and I was able to double their media outreach in the times that I was doing this program. So I have valid, like legit statistics behind what I'm talking about. Okay, and we got 238 media articles published in 2.5 years. So here, I'm gonna go through these quick, but these are all of them. I just want you to see them. This one right here, that's 60,000 views on a media post. They were, this is the funny part, is they were blocked in, I think it was, is this in Mobile, Alabama or something like that? They were blocked from actually protesting by the police, which is against the Constitution. And then we ended up getting 60,000 views. So it was actually beneficial because we wouldn't have got 60,000 views on that protest, right? And the media coverage, okay, so I had one of these medias back in the day when I was first started doing this, and it had the old school counters, if you remember back in the day from like the 1990s HTML, and would count the number of website viewers. This article was from a rinky-dink newspaper from a small town, had 13,000 views. Now, if you think how many men or women drove by that protest during that day, how many people saw the event, and how many people were actually, talked about it on social media and were influenced by social media, as compared to how many are influenced by the time if we get one media article published. So we're probably 10xing the influence of that protest just by getting one media article published. And you think all the money that we have to spend to get that protest out there, to get the activists there, to get the signs, to get the road crew, everything that we have to do, the airplanes, all that, food, lodging, all that stuff. And then we're not really getting enough media coverage. Like, does that make sense? It doesn't make sense to me. So that's why I did this. And when I did that 5 days and we got the 8 media articles published, I knew that I was onto something. So I was like, well, let's see. I'm going to go past this because this was a video of one of the media articles. Let's keep going. Okay. So this was one of the emails I sent. Now, a lot of people will tell me, and I will resist this, and I don't agree with it, that we need to like shorten our message down to some like bullet points. And this is the bullet points that I'm going to show you, but I'm using this to prove to you that the article that we sent to these people had an influence, and not just influence on this year, but the very next year, where we also got WLOX to publish the same article with the same bullet points a year later. Okay. So these are some of the bullet points. You can read those. Dramatically lowered sensation that gets progressively worse in age, altered stroke pattern from mere orgasm. I mean, there's a ton of information I give to these people. And I know so many people tell me, don't do this, but we're not targeting a kid at, like on social media, on TikTok. We're targeting reporters, publications. These people have advanced degrees. If they can't read a little email, I'm sorry, then they shouldn't be in that position, right? These people have degrees, right? We don't have to dumb it down so much. In fact, they need the information. And I know some of them are not going to spend the time to do it, but the ones that do, that's the ones that we're trying to influence. I'm not trying to influence 100 people. I'm trying to influence 10 people out of those 100 people, right? So anyways, this is the WLOX article. And there's at the top, dramatically lowered sensation that gets progressively worse than age. That was literally written from my email. So I know I'm having an influence. And I know when we went from like zero, almost like minimal media coverage, and we got 8 in 5 days, like that means something, right? When you go from nothing to a bunch. So what we were doing was working. And in 2009, we started again. So we waited a whole year. I got sick of what I was doing, and I was like, I got to do this again. It was burning in my heart. I said, I have to do this. So in 2019, we started again at the Southern College Tour, 15 publications in 20 days. That was the lowest number of publications we ever got while we did this. So that's a significant number. And that's like double what the bloodstainment was typically getting. Although they have done some really good times in the past. I had one that they got 15. So that was really good on their own without me. But since I was doing this, we really doubled what they were doing. And so if you imagine, if they're out there and you're 10xing their protest with one publication, and we got 10 times or double the publications, let's say that instead of 10, we got 20. That's massive increase in the number of eyes on target that I was able to influence, because I'm basically doing what every company in the world does. Every company in the world, you can sign up for Walmart, you can sign up for Coca-Cola, and you can get on their email list, and they'll send you out a whole marketing system, right? And they educate you, and they'll send out their stuff. So anyways, this is just a bunch of them, of the articles. This was a year later, same thing. So a year later, when the bloodstainment went back to that same area, they also used the same email, and they published the same article, okay? So basically, all I'm doing is the simplest thing in the world, and anybody can do this. You don't have to be, this is basic internet marketing. So the first thing is to gather data. Well, if my target is media, I had to get on the media. So guess what? We got web pages. We just go on the web page, and I go find, meet the team. Look at that. Look at emails, phone numbers sometimes. So all this information is right there for us to grab. All that we have to do is grab it. The most important thing when I was a really good trainer is that not that I'm a good trainer, but that I have a person in front of me that I can communicate that I'm a good trainer to. And then they hire me, and then I can do good in my job, and I can help people as a trainer. So anyways, the first thing is getting the list, right? Gathering the data. Okay, once you gather the data, the second phase is sending emails, okay, the written type. You can send the emails through web forms, which is this, and you can see these are, thank you, your submission has been received. These are send to the emails, which means these are going to a high value target of persons that can publicate an article that can reach tens of thousands of people, right? That easy. I can just send one email and instantly like that, I get thousands of views on Intactivism. So if you think the amount of time you spend doing this as opposed to the amount of time you spend complaining to a cutter online that's entrenched and is just going to argue with you, and that's going to eat at your soul, you get that Intactivist burnout, do this. This is way better. It's so much fun. I've got to hurry up because I've got to show you, I want to play a video. Oh, this is, okay, so let me go back. Phase 3 is tele-intactivism. This is the voice, right? You're going to call them, you're going to communicate with them. So let me move through this. So this is a broadcast we use to dial my calls. Oh, wait. Okay, I'm missing something. Okay, so dial my calls. So this is immediately send this message right there. It says Oregon Media Challenge. That's the voicemail that Eric Klopper gave me. I sent this out and 288 were successful. Took me like 5 minutes. Cost a little bit of money. Worth it. And we'll see you on tomorrow. Okay, so here's an example of some of the voicemails. Okay, these are being left on these people's inboxes. 1 minute, 59, 2 minutes, 2 minutes, 1 minute. So these people are getting the messages, right? So Eric's voice was getting to those 288 people. And we sent 2 of these. So here's a 291. This was successful. Okay. I'm not going to play that. That was Eric's voice recording, which was really good. He did a really good voice recording. So the target audience. The main thing is, what is your target audience? So as a trainer, I had to realize, okay, I can't just help everybody. I need to help the people that really can benefit from my skills. And my skills were helping people recover from injuries, right? Helping people balance their bodies so I can make them more athletic. So I started focusing on athletes, and I started focusing on injured people who want to get out of pain. And my business exploded, and I was doing extremely well. And I know that for the giving that message so long for the long time, I was giving too much. I tended to do too much. So anyways, so you have to have scripts. You want to have written scripts. You want to have spoken scripts. The 3 general points I focus on my scripts is anatomy, structure, and function. The reason why I start with that first is because if you don't know the anatomy, structure, and function, how are you going to know why it hurts? You don't know that there's Meissner corpuscles, that it's the most sensitive nerve endings. The body's got 75% of the nerve endings. If you don't know that, how are you going to know that it hurts? You're going to be like, oh, it's a flap of skin. You start with the psychology thing. You got to start with the anatomy. So I start with anatomy, then I move to the psychology, and then I move to the medical quackery. And that kills it at the end. It's coup de grace. Okay? Because at the end, they're like, wait, all that, and now you're telling me that this started as an anti-masturbation campaign in the 1870s, predates germ theory, and they have all these ridiculous excuses like club foot, cleft palate, schizophrenia, tuberculosis as excuses. It just kills it. And we have all the information. Done for you systems. This is a done for you system. What I mean by that is this is repeatable, it's scalable, and it's teachable. So I can give this to anybody else. Anybody can use this. Anybody can say, okay, I need to find a high value target. Who can I influence that has influence? Okay? So people of influence, doulas and midwives, right? Tremendous influence on circumcision. Religious leaders, medical practitioners, child and trauma therapists, college professors, students like Cockfight. Parents? Parents, yes, exactly. Parenting groups is actually a very big, important target. Yeah, great point. Yeah, see, there's so many. You can come up with your own high-value targets. You go and you gather the data, you write the words, and you send out a message, and then you call them back. That's all you do, right? How easy is that? But you're reaching somebody that has influence, that hasn't heard this before, instead of getting online and somebody, complaining at a cutter. Like, that's not going to do anything for your life. It's going to make you angry. I know. I'm just talking from experience. Okay, so this is where we're going in the future. We need to get an open source. Well, I was trying to put this Mautic system together. So, Carter. I've been trying to do this for like the past month. It's crazy. I've been doing it on ChatGPT. I don't know if I'm going to continue with this. I might have some other things, but we need to have an email marketing system that's coming soon, whether it's Mautic or not. So what I'm going to do is once I have the Mautic system set up, we're going to just connect it to the pop-ups on my website, Next Level Intactivism, and then also cockfightusa.com. If you've never been on cockfightusa.com, it's a different thing. I'm going to show you some images real soon of why it's a different thing. It's Cockfight is one of the most valuable solutions that we have in Intactivism, and I think that we need to make sure Brett Johnson has the ability to quit his job and do this full time. That's one of the most important things that we can do in Intactivism is support Cockfight. Just because it's so powerful, I'm going to show you in a second. Okay, so I'm going to finish the MIME library. It's going to be 10,000 MIMEs in 275 categories. So the MIME library, let's say you are getting on the line with the cutters and you want to have an argument. Instead of typing out every little long string of things, you find a MIME and you send it to them. Picture says 1,000 words, plus you sent it in 2 seconds. I'm going to give you the access to this. You can download it on your computer through Dropbox. You can download it. It's probably separate, 2 separate things because it's 10,000 images. You can download it on your computer. You can have it on your computer. You can go there and find out whatever topic you want and find the subject, open it up, and you have a bunch of images that you can use as responses. So I'm trying to make you more effective and efficient even with social media. We're going to finish the education library. I've been keeping 12 years of notes. I've got tons of information. I wasn't going to do that because I don't want to recreate existing structures. We already have some amazing information websites that are out there, but I have a unique perspective. I have a unique experience in the last 12 years. So I decided I need to make my own education library. So that's going to be coming soon. We need to make Cockfight fully funded and operational. Cockfight USA. We need to develop and encourage and tactics organizations to develop fundamental marketing strategies, including lead development, targeting one's audience with scripts, newsletters, and emails. We need to create newsletters to inform and target high-value targets with education emails unique to the target audience. Okay, so like I said, with the emails that I sent out, everybody was telling everybody. Everybody said, you're sending too much information. They don't need this much information. They're not going to read this much information. But guess what? The ones that do, that's who I'm trying to talk to. I'm not trying to talk to everybody. And these are educated people. They need to have the information. This is the website I created for Cockfight USA. This is what I'm talking about. Like, I use the analogy with Bloodstained Men, and everybody has a part. We've already talked about this. Everybody has an aspect where they fit in the activist matrix. But this is like, I think it's like pushing, like when you're protesting, you're angry and you got the bloodstained pants and you're out there, that's like pushing a bus up the hill, right? You're all a bunch of activists pushing that bus up the hill. Brett is like riding the bus down the hill. It's a different thing. Everybody wants to be involved. They want to get his knowledge. They want to be around him. He's the Pied Piper of activism. I swear to God, I'm Brett's biggest fan. We want our forkins back. I mean, just the wittiness of his signs. Look at the smiles on the people's faces. Do you see those smiles when we're protesting in bloodstained pants? You're not. But it's a different thing. That's on a street corner. It's like guerrilla intactivism. It's a different thing. It's a shock value. So it has its merit. But what I'm saying is, this is where, number one, this is the influential market who we're targeting is students, right? Okay, so anyways, look at this. Okay, read some of these. This is funny. Let your son keep your lucky charms. Jesus saves Paul and Paul saved Peter's. I mean, it's funny, right? And people, look at them. They're happy. Look at Kevin. Oh, by the way, Kevin is a representative of Cockfight, and he's got some flyers outside. So if you want to talk to Kevin about Cockfight, and there he is right there doing the do. So I appreciate you, Kevin. Thank you for what you're doing. There's Kevin there, leave the front. I mean, just look at the personality in everybody. You got Kevin serious. You got this. I don't know. It's just great. It's like you can't get better marketing than this. Okay, so we used our systems to get Brett this RTF or Cockfight this RTF article right here, which is the Riverfront Times. It was an amazing article. I didn't put the whole thing there. Brett did this one on his own. This is some of their media outreach and stuff. This is an article that had 177,000 views, and Circumcision is Unnecessary Roughness. 177,000 people saw that. Fantastic, right? No, the next thing I'm going to focus on is midwives and doulas. Okay, good. Okay, thank you guys. Appreciate it.
Thank you, Daniel. I'm sorry to do that. We're running out of time. I made a couple voice messages sent them to Daniel. He blasted them out. I got reporters coming back to me, right? So I'd say, oh, send me the complaint, right? From the Oregonian and elsewise. So these are things, you don't have to be a lawyer to move things forward, although it's great to be a lawyer or a doctor or whatever. But the meme warfare, the keyboard warriors, like getting out, collecting the data, reaching out to the journalists, doing that work. So this is really important. It's something that anyone can do and make a big impact. So, you know, it's really important. And I really don't like abbreviating people's talks, but we're running out of time. And I got to talk as well. And I'm scheduled for an hour. I can probably do it in a half hour. I'm not going to talk this fast. But, anyway, it is my great pleasure to introduce the penultimate talk. Oh. kind of ironic because I was talking about how the internet could help big time and they didn't hear any of that. But, you know, the point is you can make a big difference by finding media contacts, which you don't need a specialized degree or even a high school degree. Just go to the website, find the reporters, blast them with the information, and one of them will pick it up. As Daniel shared, I sent him a couple voice messages. I got reporters from the Oregonian asking me about the complaint, right? So it works. Anyway, it is my great pleasure to introduce the penultimate speaker. We are very grateful that we found our champion in Oregon who has had significant wins and advanced the constitutional law in this state itself. He had established marriage equality in the state of Oregon prior to being a federal constitutional right. So, round of applause for that. So please, Lake Perriguey.
Thank you.
Yes, I'm gonna mic you up.
And then how do I?
This advances the slide.
Okay. Oh, sorry. Oh, good. And let me have my notes. Oh,
No.
shit.
That's okay. It should just pop back.
Although, okay, well, thank you very much, Eric. I'm delighted to be here. You know, I've learned so much this weekend. Before this weekend, I really knew nothing about circumcision, although I had certain ideas about it and thought it was always kind of bizarre and barbaric, and was allied with the intersex community and thought that that was sort of kind of similar, not similar, but crossover interests. But before we begin, I just wanted to put on a little bit of skin cream called Foreskin. Before we start, I learned about that this weekend too. But I'm actually serious. I didn't really know about Intactivists. I'd never heard the word, so I feel very, very fortunate to have been invited to be the local counsel, to be presented with such an extraordinary complaint, and then to be given a crash course before things begin. So thank you, everyone, for your wonderful presentations. Incredible. But I wanted to give just a little bit of a sense of what a case, my case, the marriage equality case, looked like in Oregon and how it might work, and hopefully will work here, because we established marriage equality in like 6 months in Oregon from start to finish. It went very, very quickly. And so I'm just going to give you a little bit of that history. And we're celebrating now 10 years of marriage equality. All right, so, but to give you a sense of that, you know, it's 1993. I'm living in Austin, Texas, and I'm with a group called the Lesbian Avengers. And we had learned that the state of Texas was going to reorganize its criminal statutes and all of its statutes, because they'd gotten messy over the years and they weren't numbered correctly. And the legislators were going through all of the different laws, and they discovered that there was a law that said that they couldn't have oral sex with their wives anymore. And they're like, let's get that out of there, but let's leave that one for the gays. And so that really pissed me off and the other Lesbian Avengers. So, because it was, you know, if they're going to take it out for everyone, take it out for everyone. So we went to the state capitol and we unfurled banners from the rotunda, and that was before they searched you, before 9/11, I guess. And went to the rotunda up in the top level, and we threw paper airplanes into the legislature that were doused with fish emulsion and hair permanent solution. And the sign said, "Homophobia stinks. We say, you say don't fuck, we say fuck you." And surprisingly, I mean, I had no idea, you know, it was like an anti-sodomy law, right? Decriminalized in 1972. But I was surprised to determine that I, you know, got, let's see, do I have to press it again? Busted! I was put in jail. And I was completely dumbfounded that I was actually in jail. But so sitting there overnight in the gay cell, they had a gay cell back in Austin, very liberal place. And so overnight, you know, high thread count. So overnight, we wake up in the morning and the doors open and the sea of blue cops parted, and this, lesbian woman, it seemed like the first time she'd ever worn a skirt, she walked through and she busted us out of jail. And that was awesome. And I thought, I want her power. I want to know that, and I want to help be an activist and support my friends who are in activist causes. So I applied to law school. Well, I took the LSAT and I got a brochure for Lewis and Clark here in Portland, and there were beautiful waterfalls. So I came to this school primarily to just escape the possibility that I would be sucked in by the corporate capitalist structure and end up in New York working for a bank. So I came out here to Lewis and Clark, and while I was out here, President Clinton signed the Defense of Marriage Act, which defined for federal purposes that a legal union is between one man and one woman as a husband and wife. And that was very much a political decision. And so then while I'm also, that was a bummer. I mean, I didn't really care that much about marriage, but it was still targeted at the gays. So I graduated from law school, and a few years later, Lawrence v. Texas, which was a Supreme Court case that said that adult consensual sex between consenting adults of the same sex, same gender, cannot be criminalized anywhere in the country. So that was amazing, and it kind of was the law, the very law that I was protesting in Texas. They said that law itself is unconstitutional. And that law overturned a law from 1986 called Bowers v. Hardwick. And that was a Georgia case in which the Supreme Court, again, was questioning whether a state can criminalize adult sex in your own bedroom, in a private place, in a hotel room, between two consenting adults. And Scalia essentially said, well, we looked through the Constitution and we didn't see the word butt fucking anywhere. So yes, you can criminalize it. Go for it, Georgia. So, he was a strict constructionalist. And if the word anal sex is not in the Constitution, then go for it. Put those faggots in jail. And that's essentially what he said. But so in 2003, I'm out of law school, and this is really exciting that the law that I was protesting is now overturned by the Supreme Court. So in Oregon, we had a law. I decided to stay in Oregon, fewer banks, and it said marriage is a civil contract entered into by males of at least 17 age and females at least 17 years of age, otherwise capable of marriage. So then George W. Bush in 2004 kind of encourages the implementation of what are called mini DOMA laws that essentially say, put this into your state constitution, put it on the ballot while I'm running for president, and we'll get the Republicans out because we'll scare everyone to think that their kids are going to be gay and that there's going to be gay marriage and it's all going to be crazy and they maybe will vote for me at the same time. So that happened here in Oregon, and it passed by 57%. But, the voter pamphlets, we get them in Oregon. It's an initiative. You vote to change the laws. That we have that in Oregon. It's not just the legislature, but individuals can vote. And if enough people vote, you can get any kind of law on the books. And so there's a voter pamphlet where you can read about it. And this one was particularly interesting in this time because it was in the news a lot about whether to ban gay marriage. And someone actually paid to put this in there. Marriage is not sacred. Marriage is for wimps and sissies. Agree with us or burn in hell. I mean, there were just so much mis and disinformation and kind of kookiness out around this time, but it did pass, and marriage was specifically limited in the Constitution between a man and a woman. But in Oregon, a lot of the people in the Portland area and Eugene and Salem are pretty progressive, and there are a lot of gay and trans people. In fact, the first trans protective laws in the United States, well, at least some of the first, were here in Multnomah County in Portland, and a lot of gay, trans, and intersex people began moving here. It's kind of in the first days of the internet, a lot of trans people moved to Portland, and we protected them under city and county law very, very early. But in any event, in 2008, Oregon creates the Oregon Family Fairness Act, and essentially what it says is anybody who's same gender marriage and any same-sex couples, they have absolutely all the same rights of marriage under state law. So it becomes then the policy of the state of Oregon to give gay and lesbian people and same gender couples all the same rights that straight people have, but there's still the federal question of marriage. All right, so this is brewing, and the gay rights groups and the ACLU are figuring out how can we get marriage and how do we bring that perfect case and who are gonna be our plaintiffs, and or should we just vote on it? And so this is brewing up, not just in Oregon, but nationwide, because there is a big equal protection question, like straight people can get married. What is the compelling or even legitimate or rational government interest to exclude gay people? That's really the constitutional question. And so then I happened to be visiting my family in DC, and I went, oh, wrong one. Let's see, how do I make it go? Okay, not going. Let's see. Oh, and so I took this photograph in front of the Supreme Court that day, and I missed it, but the next day, the court decided the US v. Windsor case, and that was a sweet lesbian woman and her partner. She was very old, and she was a lesbian, and it was a question about taxes. And, you know, while Americans maybe used to hate gay people, they hated paying taxes more, and she won. And so the court essentially said that, you know, you can't, if a state has marriage equality, the federal government has to recognize that marriage. And so that meant that she saved a bunch of money because her wife was a rich Manhattan landowner. And many people don't know this, but if you're married, you can transfer billions of dollars to your spouse tax-free. But if you're not married and you're just a domestic partnership, there could be tax consequences on the death of your spouse, which was the case for her. And you have limitations on how much you can give in a gift to your domestic partner. So there were a lot of rights and privileges that weren't available. So around this time, I discovered that I'd come back from DC, and I discovered that the Oregon United for Marriage wanted to spend $12 million to put the question of marriage equality on the ballot. Not go to the courts, they want to go to the ballot, and they want to convince a bunch of yahoos in Eastern Oregon that gay people are okay, and you've seen enough episodes of Glee or Will and Grace, and so let's just let them have the right to, please vote, vote, vote. But I fundamentally thought, I don't want all these people voting on my civil rights, because what'll happen, you know, in 5 years? Could they just take it back? And there were all these high-profile people. This is the former Governor Kitzhaber, who was left office in a scandal because I guess, I don't know, his girlfriend was living there and working for, I don't know what happened really, but he left office. And this is a former governor, and everybody's signing on for this ballot initiative, and Oregon United for Marriage raising all this money. The Blazers football team and Nike are putting their logos on it. And so it's very cool to be for marriage equality. And, you know, it's good business. And this is the great, wonderful Ellen Rosenblum, my friend and former Attorney General from Oregon. And she had signed on to various amicus briefs and high-profile cases around the country related to marriage equality and gay equality going back to 1995. She was a real pioneer and made it very clear that the government's position and the Attorney General's position in the state of Oregon was for marriage equality. And so I'm watching all of this, and this is some press release from her office, and she says, Oregonians in 2004 proposed a constitutional amendment for same-sex marriage. No Oregon court has considered the kind of federal constitutional challenges to the Oregon ban that is presented in these cases. So she's sort of inviting someone, kind of, to bring a case. That's how I read it. And there she is again, publicly supporting equality. And so in my mind, I'm like, well, I'll just like sue the government, and she'll be the one that has to defend it. And she's clearly on our side. And then more vote on civil rights, vote on civil rights. And I just didn't like this idea that this is the way we're going in 2013. And so Big Gay Inc. is what I call like ACLU and, you know, the gay rights group that wants to raise $12 million and have a lot of garden parties for the next 6 months. And so, you can sort of see, they say, unlike states such as Iowa and New York, Oregon does not have the option of going to court through courts or legislature. The only way to change our Constitution is with the vote of the people. And so this is July 25, 2013. And I just called bullshit on that. I just knew that it was wrong in this picture of my bathroom. I was sitting in the bathroom here reading about this, and it just hit me, and I decided I'm going to write Ellen Rosenblum and let her know that I'm going to sue the state of Oregon on alleged constitutional theory. And so this was it, July 21st, the first email. I just say, greetings, Ellen. I'd like to schedule a call with you about a potential federal challenge to Oregon's constitutional provision defining marriage. I got a little bit of pushback. The ACLU sent me a brief. People were very upset with me because this was a $12 million campaign, years in the making, and they got word that I was going to sue instead of following in the sort of inertial vision about how we win marriage equality. But I was introduced to this wonderful couple, Deanna Geiger and Janine Nelson. They've been together for 31 years, and they signed off as plaintiffs. And then Bill Greiser and Bill Dumig, married in Canada, unmarried in Oregon, so not recognized in Oregon, had 2 adopted kids. Wonderful, wonderful people. In any event, and then I found Leanne Easton, a federal practitioner, Indian lawyer, Native American law. She signed on. And we filed a complaint, much like we did just now with Intact Global and the team here. And it essentially alleges similar, marriage is a civil contract. We had a substantive due process claim, essentially saying, kind of in a way like the body autonomy claim, that fundamentally, but in this case, there's a fundamental right to marriage, and then an equal protection claim similarly. At this time, Michael McShane, for one of the first openly gay federal judges appointed by Obama, just happens to get appointed as a federal judge here in Oregon. But he's stationed down in Eugene. So I filed a complaint in Eugene because there are only 2 judges there, and lo and behold, we got him. It was great. And around this time, I'm looking, and the state of New Mexico, they decided, I'm from New Mexico, and they decided a marriage equality case under state law. And what was unique about them is that they didn't describe it as same-sex law. They used the construction same-gender law, which I thought was very interesting. I called the lawyer for the plaintiffs and said, did you do this? It was Shannon Minter from the Lesbian Rights Project in San Francisco. She's like, I don't know where they got it, but that was great. I thought that was progressive and kind of forward-thinking. So I used that construction in all of my briefing to the court here. And then Basic Rights Oregon and the ACLU, upset with me for disrupting their advertising $12 million campaign, they joined our lawsuit and they found 2 plaintiffs. This guy then became, and he was their plaintiff, the tall guy then became a very right-wing conspiracy theorist, maybe not conspiracy theorist, but very right-wing Republican legislator after all of this ended. But in any event, after Basic Rights Oregon and the ACLU joined our lawsuit, their donate button changed because we saw on July 25th it was, we can't do it in the courts. But 6 months later, on December 19th, they say, with a parallel strategy of a ballot measure campaign as well as a case in court, we will win this, still with the same donate button there. So I filed the case, and then in Utah, the court there recognized marriage equality. And meanwhile, in our court, we're just filing a motion for summary judgment, which is essentially saying, hey, all of these facts are agreed. The law is very clear. We don't need a trial. Just give us marriage equality. So around this time, there was an intervener. This guy, wedding crasher, John Eastman from the National Organization for Marriage, he came in and he said, hey, Ellen Rosenblum for the state, she and Lake are buddies and they're just they're colluding, and you should let me come in because we really need to have a trial on all of these issues. And the court essentially said, get out of here. You can't stand in her pumps. Ellen Rosenblum is here, and it turns out she's the only attorney general in the marriage equality movement, the only head of the government who argues from a legal perspective for state government. She's the only attorney general that stood up, went to court, and said, hey, I agree with the plaintiffs. There's no constitutional justification for this ban, unlike Kamala Harris and some other all the other attorney generals who just didn't go to court. So I really appreciate that Aaron did that. In any event, the judge sent John Eastman packing and said, go back. And he litigated all of that all the way to the Supreme Court, saying he should have been able to come into the Oregon case, and he wasn't. And in case that guy looked familiar, that's the same John Eastman that worked in the with Trump to try to throw the election. In any event, so we did our case. We had our summary judgment on April 23rd. Great little, PR. That was from a local magazine. In any event, we had a legal double helix theory that Supreme Court refers to marriage as a fundamental right 17 times in different cases. And the state must have a compelling justification if it's going to limit a fundamental right to certain classes of people. And then it's an equal protection argument that there's gender equity and sexual orientation, and you're offering pancakes to one group of people but not to the other, so unconstitutional. And so we had press junkets and all of that. And then on May 19th, Judge McShane ruled, and he used the construction that I advanced, same gender couples are entitled to equal protection of their fundamental right to marriage. And so that was May 19th, 2014, so May 19, 10 years ago last year. And then we had a wonderful party and dancing, and I brought my clients some bouquets, and they look happy. That's the county offices that, for the first time, is doing legal marriage in their certificates. And so, just in terms of the way that I practice law, I like to be gracious and kind, and there was some animosity between myself and the organization that wanted to do it with this big vote. And so when the case was over, I worked with a jewelry designer, and I designed these little rings with Oregon in the center and an equal sign over Portland, and then on the back it has the date of the decision. And I sent them out to all the people, even on the people who were upset with me for doing it. And the judge, and it sits now in the judge's chambers. And interestingly enough, that judge was going to recuse himself, and his clerk said, "What do you mean? You're a federal judge. This is your job." And because he was gay and he was new in town, but he was convinced to do it, and it was wonderful. So then later, marriage equality, yeah, there it is. But it was nice. And everybody, at the end, it was great that we all got to be part of the win, including the larger organizations, because sometimes people access civil rights through donating money, and then they get information. And so it was wonderful when it was just my case, but then they came in. They were a great legal team. One went from Perkins Coie, targeted by Trump recently. But to have more people at the table, and then more people associated with those people at the table, it just meant that there were many, many people who were part of the win, just like when we win in Oregon. All of you will be part of the win. It won't just be the people sitting at council table. And so then marriage equality went nationwide on June 26, 2015. And so then that was great. And then about 2 years later, I was approached by someone named Jamie Shoup, who wanted to identify as non-binary. And there hadn't really been a legal recognition by a state for the non-binary gender category. And so Jamie asked me to do that, and we successfully did that here in Oregon. We were the first state to get the X on the driver's license. And then it kind of went nationwide. And on that one, all I did was file a simple paper in the circuit court. And then I called up the governor and said, "Hey, I did this." And then I called up the attorney general. I said, "Hey, I did this." And I'm like, "You need to change all the systems at the DMV." And so that took about 9 months because it was a very, very old system. but I didn't get any pushback, and this was before the Trump administration was villainizing trans people as a way to, I don't know, focus on other things and get people into their cause. But in any event, there was no resistance. And in fact, the government was quite supportive in changing the DMV registration and the other administrative rules associated with having a third gender identified on those documents. So I show you this just a little, to sort of show you how a legal case can work, and it worked very quickly and very efficiently, and a large part of it had to do, I think, with that it was time, and also sort of the approach that we took with the government. So I don't know what's going to happen here, although I have spoken with the head of the trial division for the Department of Justice and sent her a courtesy copy of the complaint. She said thanks. And we have a new attorney general, though, in Oregon. Not really clear what his positions are on a lot of things yet because he was just elected. But I look forward to working so much to working with this wonderful team and hope that I can bring this kind of success efficiently to this cause as well. Thank you very much.
Replicate it for children here in the state of Oregon. So we've got 15 minutes left. I have an hour talk, but I was wondering, how am I going to fill an hour? Well, realistically, it's not an hour long, and some of it's duplicate anyways. I'm going to take the hot mic from you. Great job, Lee. But before we begin, we have a very important announcement from Intact Global's treasurer to try to solicit financial support.
All right, thanks.
Yeah.
Thank you. Well, Lake is a hard act to follow, isn't he? He's not only a talented lawyer, he's a stand-up comedian. If you're still with us on the stream, and if you've been here for 2 days now and you've heard the kind of speakers I've heard, you deeply care about this issue. So we would ask you to think about supporting our effort. For those who are following the stream, go now to intactglobal.org, hit support, and under support, hit donations. You have a choice of giving a one-time donation, or you can donate monthly, as we've suggested in the past. You can donate $100, $50, $10, if that's what you can afford. It's so important for us to build that sustaining group of funders for this organization to succeed. And I'll borrow a slogan from Emily's list. Early money is like yeast. Be an inaugural donor. Support us so that we can start this legislation, so we can begin to build an organization that represents all of us in this room. So thank you, and thank you.
Thank you so much. And if the IRS is watching, Joe meant start this litigation, not legislation. So anyway, here, can I give this to you, Sam, to hold on to? So now we made it through 2 full days. I got a final talk. It's not going to take an hour, and they're going to charge us overtime if we go past 6:30. So, but my talk is going to be actually a natural continuation of Lake's talk, to an extent, and how we go from the success of the marriage equality movement to the success of the bodily and genital autonomy movement, right? Everybody gets to make these important decisions about their bodies, and we're protecting children from harm. So let me pull up the last slideshow of the conference. And then we're not done because we got the press conference tomorrow, but. So the last talk is called The Future of Intactivism. We started with the state of intactivism. Where are we? Is the circumcision rate 50%? Is it 70%? Yeah, it's pretty high. It's higher than it can be and it should be, right? And what are the strategies that we can do to get this circumcision rate to a point where really not a minuscule number of boys are genitally cut, and intersex individuals and females? Well, thankfully, very few girls are cut in this country. So we're somewhere around here in that 50 to 60, maybe even higher, and it's regional. We're going to talk about this. And Oregon has one of the lowest rates of genital cutting in the country, which is great. Great place to start. You guys are already way ahead of the game, and we're just here to circle the square and protect all children instead of 9 out of 10 children from genital cutting, right? So again, Intact Global, this organization, our main goal is to make male genital mutilation a mainstream issue, right? How do we protect all children from genital mutilation? We got 2 different types of strategies, at least with this corporation. We have the legal strategy, right? Equal protection lawsuits, what we filed a few days ago, Attica v. Oregon, with the help of Lake Perriguey. And then we also have Medicaid defunding lawsuits, which I'll touch on, and tort lawsuits, like, oh, you know, this doctor performed a negligent circumcision, or these doctors are defrauding Medicaid by saying, oh, this doctor has some pathological condition, even though he's totally healthy. That would be fraud against Medicaid. And that is a potential legal theory we could pursue, but as I'll discuss, litigation is expensive and we have to allocate our resources in the most efficient way possible to protect as many children as possible in as short a time as possible. So you get the point. And then we have also grassroots, right? Social media, podcast, you know, I'm not sure if anyone mentioned him during this conference, but the biggest podcaster in the world called Circumcision Dick Mutilation, Joe Rogan's like all about it. And, you know, but there's a bunch of other podcasters who are really hardcore against this. And legacy media, at least in the US, has not been that friendly to our position. So, but most people watch alternative media now. So, you know, the landscape has shifted radically. And yeah, just talking about MGM, right? Oh, you see someone who's pregnant, as Michelle said. Say, look, let me tell you something important. You want to protect your child. You want to protect him from harm or her from harm. Well, you know, don't cut off part of their body at birth, right? You know, respect their bodily integrity. So as mentioned, we're focusing on, in Oregon, equal protection lawsuits. Now, a great question came up earlier. Tina was like, asked, oh, you know, circumcision rate's been 50, 60% for a long time. What makes you think that you can have this dramatic reduction in genital cutting of children? I mean, which Oregon's already done, but on a national scale. Why would you think that? How is that possible? You've been at 50% for so long, or whatever, around there. Well, if we look at, you know, other progressive causes, and this is from a Bloomberg article, 2015 Bloomberg article, what you can see is, you know, the x-axis is time, and this is the number of states in the US, right? You know, excuse my laser pointer. In the beginning, interracial marriage, there was only a handful of states. As high as the bar is how many states have allowed interracial marriage. Then we had a stagnation for a while, a bunch of states, stagnation, a whole bunch of states, and then the Loving v. Virginia case, right? And so all the southern states, it's like, okay, you're coming with us whether you want to or not. We're going to end this abjectly wrong practice, right? And we have to remember, what is Loving v. Virginia? Yeah, it sounds great, but this is actual people saying, look, this is wrong what happened to me. You know, we want to be able to marry the people that we love, and I know fundamentally that race should not be a barrier to that. We're all human, right? And similarly, there's also, you can amend the Constitution, the 19th Amendment, allowing women's suffrage. And look, no states had women's suffrage, then 1 had it, that little bump, then 2, then I don't know, maybe 5, then a whole bunch of states ratified it, and then they're like, you know what, we're gonna make this a constitutional amendment. Everybody does it, no question. Well, and then we have the most recent constitutional rights issue that Lake established in the state of Oregon. So another round of applause for Lake. That's pretty epic, actually. Like, who knew that we were trying you? We're like stoked. But, and again, and that culminated in the Obergefell case 2015 in the United States Supreme Court, but it didn't start there, right? It started with that little bump. Anyone know that state? Massachusetts, baby. That's absolutely right. Shay, yeah, you know it. So I'm from Massachusetts. I'm very proud of Massachusetts for saying, look, in 2003, they established marriage equality. So I'm very proud of that. And in the Goodrich case. So I want to talk about marriage equality because that was without a doubt an extremely successful movement. And they did that in an incredibly short period of time. Look at this extreme rate of progress is what that is. And that's something that could be achieved with the intactivist movement if we deploy our resources strategically. And we also need fundraising, of course. The more resources we have, the more shots we can take. And we've done a lot with $30,000, as I'll talk with. But anyway, let's focus on marriage equality real quick. As I mentioned before, Massachusetts was the first state. And here are the 14 plaintiffs in Massachusetts. They were victorious in establishing this constitutional right in the state, not the federal constitutional right, 2003. This was after they won. And then we have a whole bunch of states coming in, and then we have like 10 states, then 20 states. And right here is the state of Oregon. As we saw, the Giger v. Kitzhaber case, Oregon 2014. And they had very competent counsel, Leanne Easton, and this handsome gentleman right here, Lake, back 10 years ago. And then it culminated, all these states were saying, okay, we're going to respect people's constitutional right to marriage equality. And the Supreme Court's like, okay, this is too confusing now. Even if we're conservative, we're going to give the national win. And obviously the court is more conservative now than it was, but that was the progression. It was state by state. It wasn't just, oh, we challenge a federal law and then everyone is on board. You have to do this on a step-by-step basis. And we've already filed the first step here in Oregon, right? And we're hoping for, if we get that first step, maybe we get the second step, maybe we get the third, and then maybe we get some type of progress where we get 10 steps, we get 20 steps, and then every child in the nation is entitled to their constitutional right to bodily integrity, right? And that's a very possible outcome. It's happened in the immediate past, and it could happen in the immediate future. We just need to be effective and organized and file this type of strategic impact litigation. So I want to focus on the tail end of this graph. This was published in 2015. This last little bump right here, that's legal cannabis, obviously a different state. It was legal in 4 states in 2015, but by current day, it's legalized in about 24 states recreationally, and that goes up to 39 if you include medicinal use. And Biden issued, I think, an executive order saying, look, we're just not going to prosecute this. So that's a huge momentous win. I mean, it's not outright legal, but if you're an advocate for legal cannabis, and we have some individuals who actually use cannabis to treat cancer patients in the audience, like Brian Turner, so who actually brought this litigation to Oregon. So now I'm bringing the connection. A little round of applause for Brian. But similarly, I'm not saying that this is the progression, but this is not just a hypothetical. This is what has happened in other human rights, social rights, civil rights movements, is we've already filed in Oregon, and it's very possible, as Zenas was saying, and I appreciate it, that this was, one of the strongest complaints that really lays out the human rights violation, the civil rights violation that is medically unnecessary non-religious genital cutting, right? It is really on its face an obvious violation of a person's right to bodily integrity, to decide what happens to their own body, to experience what God or the universe has given us, whatever your beliefs may be. And it deprives an individual of maybe deciding for themselves or theirselves how they want, whether they want to subscribe to a religion, which we're not dealing with right now. So anyway, we filed the Oregon lawsuit, but it is very, very conceivable with the stellar team we have, Peter Adler and Samir Safarini, and maybe Lake will join us another stage. We'll see if we can convince him. But that we could file, maybe 3 more, file 3 similar lawsuits in the next year, and maybe 5 lawsuits in the next year. You never know, right? And it depends. Do we get the funding? Do we get the plaintiffs who are watching? Can we find the local counsel? And there's a lot of lawyers who really believe in the equal rights of all children, right? And all people. Like when I was at Georgetown Law, I had an incredible amount of support from my student body and professors who were like, gung-ho, yeah, we should stop cutting our children. That's totally nuts. So this is not it's a mainstream view in the world, but it is a minority view in the United States I should say, it's a mainstream view in the world to not cut children, but we're still catching up in the US, but it's different regionally, and we're going to talk about that. And so how do we get these? Remember, these steps are how many states would, potentially say equal protection under the law is a constitutional right, equal protection under the law from the harm of genital cutting. So again, legal action. We had the Loving v. Virginia with interracial marriage. We have the Obergefell v. Hodges to establish the constitutional right of marriage equality. And we got better pictures coming up, but we have the Hadachek v. Oregon case in 2025. So, I mean, really, it could be this important. And so beyond just Oregon being a low rate of genital cutting, why else is it a great place to start? Well, the Oregon Supreme Court is the authority on what the Oregon Constitution means, right? And the Oregon Supreme Court had the opportunity to address the, genital cutting. Is that an appropriate procedure? Should it be done to children? And it was a custody dispute, and actually Bradley Leckman Sue, who was involved in protecting the child, was here earlier. But anyway, the Supreme Court Justice Paul J. Demunis said in the Bolt v. Bolt decision, and this was 16 years ago, circumcision is an invasive medical procedure that results in permanent physical alteration of a body part and has attendant medical risks. I mean, that's a pretty damning statement. Look, this is an invasion of a child's body, right? And it risks serious complications, bleedings, infections, loss of not just the foreskin, which is important in and of itself, but the glands. Babies have literally died in Oregon from medically unnecessary surgery. So, I mean, there's serious risks, including the risk of death. But in that case, the court didn't have to decide which side presented a more persuasive case regarding the medical risks or benefits. And as Martin said, that's not the right scale. It's advantages versus disadvantages. The advantages of having your human and civil right to bodily integrity respected, the advantage of being intact and having all the functions of this body part that's evolved over millions of years, the disadvantage of the immediate trauma, of the lifelong psychological and other scarring and loss of function. So the court may not have had Martin to write an amicus brief at the time, but we did have amicus briefs from John, and they prevailed. So round of applause for John Geishiker for supporting the plaintiffs there. And I appreciate you guys staying with us because we are here. We're running out of time, but we're going to get through this talk. So again, now the court may not have had the opportunity to address the advantages and disadvantages of the genital cutting of minors in the Bolt v. Bolt case, but it is squarely on the table for the court to address the substantive issues in the Hadachek v. Oregon case. So round of applause for Dane, who took this stand. I mean, really a legend. At 17 years old, said, look, this may have been done to me, but we're not going to allow it to happen to other kids in this state and certainly across the U.S., and that's where we're going. And of course, round of applause for his parents, Cecil and Sierra as well, who are with us. I mean, seriously, it takes a lot of courage to say this is wrong, and I'm going to expose myself and say, look, I'm going to be on the front lines of protecting kids, and we all really appreciate your sacrifice and your courage. And great news, I've said this many times, but the complaint was filed March 27th. It has a case number, and you can download it at intactglobal.org. There's buttons all over the place. Now, if you can also go to the Multnomah Circuit Court and find it, but that takes a lot more work, right? Unless you're a lawyer, and even then, it's the same document. So we've got a stellar legal team. We're very lucky. So the author, yes, so the complaint was originally drafted by Peter Adler, who is a law professor, University of Vermont, University of Vermont, University of Massachusetts, got his law degree at University of Virginia, as well as Samar Safarini, who is a current University of Virginia law student. So a lot of University of Virginia where the revolution occurred, right? The American Revolution. So really going back to our roots. And then we have Lake Perriguey, who advanced the constitutional rights of citizens in this state already, and then yours truly. So we've got a really strong legal team, a very strong legal team. I bet on this legal team, and I appreciate you all betting on us as well, including Sierra, Cecil. Thank you so much. So we're really stoked. We're very confident in our team. And the complaint speaks for itself, as other lawyers have read and testified to. So again, so the key strategies, we want to make male genital mutilation a mainstream issue. This was the legal and grassroots strategies that Intact Global is using, and the Hadachek v. Oregon, that's at the top of the list, right? This is our vanguard initiative. We're very optimistic about it, and win or lose, and we hope to win, and we think that's very possible, if not likely. We're going to keep pushing and do whatever it takes to protect these kids from genital cutting, because they're the most vulnerable among us, and they're really relying on us. So why is Oregon a great place to start, right? Well, it has specific constitutional provisions because I know it can get confusing, and Zenas had, mentioned difference between state and federal law. Well, we have federal law that applies to every state, and then we have state law that applies just to that particular state. We also have a constitution, a federal constitution that we're all familiar with and we fight about on national news, the First Amendment, free speech, Second Amendment, guns. But each state has its own constitution as well. And I had no intention to be a lawyer until, I got into a dispute with my previous employer. And so, I actually didn't know that states had their own constitutions. And so that's why I say it, because, I had a physics degree, so it's not like I didn't go to school. It's just nobody told me this in school. So each state has their own constitution, and each state law needs to comply with that constitution, right? If it violates any principles in that state constitution, then a court can strike that. And so Oregon in particular has an equal protection clause, which says you cannot give certain privileges and immunities to one class of citizens and not all citizens. And that has been interpreted by the Oregon Supreme Court, right? The body who has the authority to determine what that constitution means, to include sex. So you can't discriminate on the basis of sex because of the Equal Protection Clause. But that wasn't enough for the people of Oregon. So in 2014, the people of Oregon said, you know what, it's great we have this Equal Protection Clause, you can't discriminate on the basis of sex, but just to remove any ambiguity at all, we want to pass a specific amendment that prohibits sex-based discrimination. So it's really on the point. You cannot discriminate on the basis of sex. It is a fundamental principle the people of Oregon voted for, and the reality, and which is wonderful. But the reality is, the law that we're challenging in the How to Check the Oregon case is the anti-FGM law, which is great that we protect children or female children from female genital mutilation, but on its face, it discriminates on the basis of sex. It only protects female children. It doesn't protect all children equally. I mean, this is not rocket science. This is like a really simple argument. And so in 1999, from effective lobbying from women's rights groups, and we're grateful for, and we can learn a lot from, they passed the anti-FGM law. And what that did is it criminalized all non-medically necessary genital cutting, but only for children, only for female children, excuse me. And the purpose, the state legislature said when it passed this law, it said, look, FGM is already illegal in our state because of assault, battery laws, you name it, child abuse. But we want, just like Oregon passed the Equal Rights Amendment to expressly codify the prohibition of sex-based discrimination, it also passed the anti-FGM law to expressly codify, or criminalize, I should say, the genital cutting of female minors, right? And that's a good thing because we want to protect females from genital cutting, but the reality is we want to protect all children. There's no reason we should just protect one group of children. Let's protect them all equally. It's 2025, and it's time we face the elephant in the room and say, look, guys, we got to protect these kids. They're screaming and writhing in pain. And you have adults like me, I'm a Jewish American, who says, look, what you did to me was wrong. I'm an adult. Like, we can look at the evidence, we can experience it. Our lived experiences, as well as the evidence, is overwhelming. I mean, we're a total outlier in the world. So I'm going to just go into the legal theory a little of the How to Check the Oregon case. If you want to read the 72 page, excuse me, complaint, don't forget that last page. I really encourage you to. It's very clear. It's got an index. It's got great citations. We had a great team put it together. But what the Supreme Court said when it's determining whether or not a statute, let's say, violates that Equal Protection Amendment or the Equal Protection Clause or the Equal Rights Amendment, says laws that discriminate based on sex are only valid if they're justified by specific biological differences between men and women. Specific biological differences, and that bar is extremely high because, as Oregon courts have discussed, because they're the ones who determine what's constitutional or not, they said, look, the laws that affect sperm and egg donors, they cannot be different, despite how differently the gametes are of the sexes, right? And so if you can't treat individual, like laws that regarding the gametes of the sexes differently, then what about homologous or even analogous structures? So it's important we talk just real briefly, like what are we talking about when we're talking about let's not cut the genitals of children? Well, if you look in utero, so like, the fetus in the womb, what you could see is at 5 to 7 weeks, the genitals are indistinguishable, right? They come from the same structures, the same embryonic structures, and depending on the bath of hormones, you get the external male or female genitalia. Obviously, there's natural and normal variations in between, and we want to protect intersex children too. But 9 to 14 weeks, the genitals still look very similar. And then at birth, you have the external genitalia we're mostly familiar with. Now, not a great picture. This is a better picture here, the external genitalia of adults. And what we're talking about right now is the prepuce, right, or the foreskin. Right now, which has sexual and protective functions, and removing it is extremely painful and risks incredible complications, bleeding, infections, death, erectile dysfunction, pain with erections, you name it. And so right now, what we're going to be asking the court is, what are the specific biological differences between these two pieces of tissue that makes it totally illegal and a felony to cut and remove this part for no medical reason, but absolutely okay to cut and remove this part, except the fact that the male foreskin is much larger and much more densely innervated, right? Now, the clitoris of the female is much more densely innervated than the glands of the male. So, I mean, they are homologous, but arguably, the foreskin has a lot more sensory tissue than the female prepuce, and it's a felony to cut the female prepuce. So that's a really difficult question we're posing for the courts. And the answer is, the intent of the legislature in 1999 was great to protect females, but it's a logical and constitutional extension to protect all children. It's really where the whole world is going. The global medical and bioethical community, there's an emerging consensus. And so, as I mentioned, the lawsuit asks, okay, what specific biological differences justify this treatment? And there's different types of genital cutting if you want to get like real deep into it. And if you're at this conference, you probably have. but in terms of female genital mutilation, all of the different types, and it gets more and more extreme, are unlawful and a felony. So you can't remove the clitoral hood, you can't remove the clitoris, or the clitoris and labia, or really grisly infibulation, which I'm not going to describe, but we already agree that the top level is illegal, so we don't have to get into the graphic details of how you can mutilate an infant. But unfortunately, it's infant genital mutilation in Oregon and every state in the U.S. remains legal for no medical reason. And so we use a euphemism, circumcision, but at the end of the day, it denudes the penis and removes a lot of function and sensory tissue. Now, you can't cut off the glands of an infant, although that happens at times because an infant's penis is really small and you're not really sure what you're cutting, right? And you can't communicate. And then, castration's illegal as well. So there are 3 outcomes to this lawsuit. And we're really hoping for the best outcome. And if we get the worst outcome, we keep pushing, and it is what it is, right? Like, you didn't establish marriage equality the first time that you fought. I think when it came in the 1970s, and Lake, I'm sure you're more familiar than I, the Supreme Court said, look, this isn't even a question of law. Like, why would we even discuss or think or conceive of same-sex marriage? And then in 2015, Obergefell, they say it's fundamental constitutional right. So things change, right? Culture evolves, our understanding of human rights and human dignity evolves, and we really believe it is time that we afford that same level of dignity to have the right to your entire body to all children equally, right? It's great that we give that to girls. It's necessary and important, but it's also necessary and important that we extend that protection to all children. So the best outcome is the circuit court or maybe an appellate court reads the complaint, reads the arguments, hears oral argument, and says, you know what? We agree with you. The Hadachek plaintiffs have been harmed. They've suffered serious harm, just like many people who've undergone medically unnecessary genital cutting. And so the court essentially extends the anti-FGM law potentially to protect all children. And there is precedent in Oregon of doing that, is to correct an under-inclusive law and to extend the protection to all children. So that is a real outcome, and that would be a very brave and constitutionally just outcome. I'm not saying it will happen, but we are certainly urging the court to do that. And just the way that our constitutional law is structured, religious practices, I mentioned this before, fall under a different category of constitutional jurisprudence. So the court could sidestep the religious issue altogether. And as we discussed earlier, it's a real small fraction of genital cutting in the US is religiously motivated. So why are we gonna, I mean, this is unfortunate, but why sink a winning initiative to, it's just a pragmatic move is to say, look, we need to protect the children we can instead of protecting no children at all, right? And that's a sad reality that we have to face if we're gonna move forward in the immediate future. Another thing that could happen in the Hadachek v. Oregon is the court could read it and say, look, we agree, it violates the Equal Rights Clause, the Equal Rights Amendment, and it is unconstitutional to only protect one class of children. And again, this is not rocket science. There's an express prohibition on sex-based discrimination, and the law is literally called an anti-female genital mutilation law. If it was called an anti-child genital mutilation law, that would be constitutionally sound. It's as simple as that. Yeah, we've got a lot of cultural baggage and inertia and ignorance to work through, but Oregon's already worked through like the vast majority. As I mentioned, 9 out of 10 kids, when you're including girls, are not generally cut in this state. So this is not like some radical change in culture in Oregon. It would be Oregon leading the charge of children's rights in the US, and we believe that Oregon's a great place to do that, and the Hadacheks are great representative plaintiffs to move that forward. But what may happen if the court says, you know what, the anti-FGM law is unconstitutional because it discriminates on the basis of sex, that law can get kicked to the Oregon state legislature, and then they have to amend the law or strike it, right? And the easiest amendment could be, look, we're going to protect all children equally. And if religious cohorts are going to get up in arms, you can create religious exemptions. There are religious exemptions in other parts of the law as well, and the sky doesn't fall down. And then the last part, and we heard from Zenas earlier about this, is you get dismissed for standing. Oh, you weren't harmed, you don't have the right to bring this. Well, Oregon specifically has statutes that we're suing under, 2 of them, 28.020 and I can't remember the other number, but essentially the first one that I mentioned, it gives you standing if your rights are violated by a statute that violates the constitutional provision. You can get what's called declaratory relief, right? Which means a judge declares that, you know, you were harmed and that this statute violates the Constitution, and that violation harmed you. So essentially, if this statute were gender neutral, protected all children equally, you wouldn't have suffered that harm. And 30 years ago, when Zenas brought this case, we're in a very different place. And also North Dakota is a very different state. I mean, we have an entire generation, if not more than a generation, and a very progressive vanguard state for children's and other individuals' rights and bodily autonomy. So it's a different game at this point. And so the opposition, and it may not be the state may agree with us, but I anticipate there may be some amicus briefs on the other side, I could be wrong, but the only argument for specific biological differences is maybe the health benefits that male genital mutilation has. But the American Academy of Pediatrics has actually made the decision to, I wouldn't say affirmatively retract, but passively retract their very weak, let's say the benefits outweigh the risk, which is the wrong scale, because that expired in 2017 and they made the decision not to renew it. Because the reality is that exposed them to legal liability because it is an indefensible position. So, I mean, the conversation has moved that circumcision was not independently associated with the risk of acquiring HIV. And if you look at America versus Europe, we're circumcising, they keep their kids intact, they don't mutilate them at birth. We have higher rates of HIV, so it's not really a coherent statement. And infants aren't at risk at HIV, or certainly not sexually at risk at HIV, maybe through breast milk, but the argument is, if you're circumcised, well, you have less risk of acquiring HIV through sexual intercourse. Well, that doesn't make sense for babies, and they can make their own decisions, and we can respect their bodily autonomy, even if it were true. But we're also in kind of, we could be in endgame territory for a couple of reasons. So the medical evidence, and as people have mentioned, circumcision used to be a cure for masturbation. Then it was tuberculosis, then it was syphilis, then it was HIV. And all of those, it's a problem searching for a solution, right? It's just a problem. It's child abuse. You're removing important parts of a baby. They're writhing in pain, and some of them die. And so on. But people, the medical industry gets to charge for it, and that's really the pushing force there. But this is, I would like to say, protecting children from harm is a nonpartisan issue. You could argue, oh, it's a bipartisan. I think it's a nonpartisan. It's really beyond politics. We just want to protect our kids, right? But using the language of the time, you could argue it's a bipartisan, and we can look at both sides. Like AOC talks about bodily autonomy is an inalienable right, and your bodily autonomy belongs to you. And I'm sure she would agree, maybe in concept, that everyone deserves the right to bodily autonomy. But it's not just the left, it's also the right. I mean, RFK Jr., as I mentioned before, he really could be the godsend of this movement in that he just defunds it. Just like other nations who've defunded it, they just stopped cutting their kids because there's no money behind it anymore, right? And RFK Jr. said, some of the possible factors we will investigate were formerly taboo or insufficiently scrutinized. Nothing is going to be off limits, right? And I know some activists who are in touch, who are in personal contact with RFK Jr., and we're hoping that they get his ear and really kind of explain, look, you want to save costs? Well, save costs by cutting medically unnecessary surgeries that harm children. I mean, it's the easiest solution to the current political agenda of cost saving. Putting aside protecting children, which we should all be on board of, and at least I would say ideologically on board of. And even our religious friends too want to protect children. They just might need to be educated on the issues, which is why it was so important. Deborah Ashian came and said, look, these are the undisputed facts. This is important. It's a normal body part. It injures the child, right? Because a lot of people in religious communities, I'm a Jewish American, just don't know that, right? But not just American politics, but international momentum is on our side as well, right? As mentioned, most European health systems, nationalized healthcare, they don't fund male genital mutilation. They don't fund elective, cosmetic, medically unnecessary circumcision, especially on children. And the conversation in Europe isn't, oh, should we fund cosmetic circumcision on children or should we not? It's, should we outright ban it altogether, including religious genital mutilation? That's what Europe is talking about right now. So our proposal is actually quite moderate. And total bans were considered in Iceland and Denmark and Norway between 2012 and 2018. America came in and including the ADL and exerted pressure to kind of economic pressure and other pressure to get them to retract those. But I think something like 80% of Danes want to make genital cutting of children illegal. I mean, when do you get 80% of the population to agree on anything? But protecting children from this obvious harm is one of those things. And so our position right now at Intact Global is not that we need to do an outright ban, but that we should defund circumcision. It should be rarely done for secular reasons. And that we are the moderates in the room, right? Moderates on the global scale, moderates in Oregon. This is not some radical position. We're all, and you've heard from about maybe 10 plus lawyers, doctors, other individuals, activists, accomplished people to say, look, we're here to protect all children. This is a serious issue. And unfortunately, we're still dealing with this problem in 2025. But just like marriage equality, remember that rate of change, it could be dramatic, right? But we need the resources to do that. And I will talk about that. And Oregon is a special case in the US. So yes, male genital mutilation is practically absent in the developed world for non-religious reasons. And the data that my team was able to find is it was about 40% at the turn of the century, down to probably approaching 20. This was 13 years ago too. So the data is not, there's no systemic way to collect the data, so it's hard to tell how many people are circumcised. And if you look around the locker room, that may not be indicative because as Martin Aoa was saying, some hospitals have 90% because their policy is to bill, baby. Whereas other hospitals say our policy is to not perform medically unnecessary surgeries, which would be consistent with the Hippocratic Oath, but it may harm the bottom line. And so what litigators can do, and this is another potential strategy, but again, we have to allocate our resources strategically, is we could sue doctors for defrauding Medicaid to say, look, oh, this infant has pathological phimosis when it's a totally healthy body part, and then billing state Medicaid for it. That would be called fraud because they're issuing a false diagnosis to get public money. And so why that could be useful is it would, if it is not profitable for doctors to cut children, then they're going to stop in droves, right? So those are other things we can do, but doctors hire big law firms, which are not better than us, but they have more resources, they can throw more people and more stuff on the wall, and it just costs more money to fight, right? So again, it looks like the problem's gonna solve itself, and in Oregon, maybe it would, and we're here to just circle the square, as we say. 9 out of 10 children, including girls, are not generally cut. But if you look at the US as a whole, and this is a heat map, Oregon is doing great with very low rates of circumcision, but the Midwest, the Northeast, some parts of the South, they have very high rates of circumcision. What is that? You know, some of them are 80%, right? So this is a safe haven. Oregon is a safe haven for children, right? They predominantly have their human right, their civil right to bodily integrity protected at birth. Now, obviously, sometimes parents are misled with inaccurate information, unfortunately, like our lead plaintiffs, but the reality is most children are protected here in Oregon, but most are not protected in the United States. And if we zoom out a little more, what we can see is the vast majority of the world does not generally cut their children. This was 10 years ago. Canada's much lower now, but Central America, South America, Europe, most of Asia, Australia, New Zealand, I mean, Southeast Asia as a Muslim thing, Africa as a tribal thing, Middle East as a religious thing, but in terms of medically unnecessary, non-religious genital cutting, we are the 800-pound gorilla, and there's really not any other gorillas left. And so we really, and when you're making change, remember that graph before, you don't change this whole continent, essentially, or United States, one at a time. You do it, or at once, you do one state at a time, right? That's why we're suing the state of Oregon, suing a state statute with a state constitution. And we can scale this quite easily, but we do need resources. We were able to do this with $30,000, right? This conference, this litigation, I mean, the lawyers, haven't really been paid, but that's okay because this is so important, but we can't scale this, we can't carry this weight more than Oregon. It's just not economically feasible. So if internet, live stream, people watching the recording, if you want to see more of this, then we need donations. So go to intactglobal.org and support our work, right? Because we have a real plan and we're already doing it with what we have. But if we have more, we can do a lot more. And social rights movements, as you've seen, they're not linear, they're exponential, right? So every dollar helps more than the last dollar. It really is that important. Now, these equal protection clause or equal protection challenges are really important, and they could really establish equal protection under the law from children in Oregon and then other states. But there's other types of lawsuits, and Peter Adler talked about this. You may have a bunch of different claims if you're generally cut for no medical reason, right? But one of the other types of lawsuits that we could bring is suing Medicaid for literally wasting taxpayer dollars, because the vast majority of human beings who've ever lived have never had their genitals cut and haven't had problems by being intact, right? And so a lot of states say you can only fund things that are quote unquote medically necessary. And Sammer contrasted two statutes in Oregon and Virginia, right? And in Virginia it said, oh, if it's experimental, it's not medically necessary. In Oregon it says you need to have a problem, right? A congenital defect, an injury, something that's not working. So in Oregon, it's not medically necessary. And in fact, Oregon has defunded circumcision decades ago. But in Virginia, circumcision under that would fall under that definition. So anyway, over a dozen states have ended Medicaid coverage, and what we've seen, and Martin talked about this, there's actually more dramatic states and other more dramatic drops in other states. But when Colorado defunded circumcision, we had a slow drop going here. And then when Florida defunded circumcision here, you could see the rates of circumcision on the y-axis drop. And as Shay said, and I just mentioned as well, this is not like, oh, we're just going to go slowly to zero or just to the religious genital cutting. It's once you get to the quarter to the third who agree with you, then everyone's like, oh, yeah, we don't do that anymore. And John Geisiker, who's from New Zealand, we say woke up one day in New Zealand and say, oh yeah, we just don't do that anymore, right?
It's like a Wednesday afternoon.
They're like, oh yeah, we're going to stop. And that could happen in Oregon. It could happen in other states. And once maybe a quarter of states do it, like we saw in, well, it was actually more than a quarter states in the Obergefell case. But when a certain threshold of states do it, then the federal government says, you know what, we're just going to protect all children. You're not going to be vulnerable to having your genitals cut or mutilated because you were born in New York, for example. And we have some great work being done by Tony Lasquadro. Where is he? Oh, there he is, from Intaction. So his group, Health Equality Campaign, Inc., was able to successfully lobby New Hampshire with Emily Phillips, the Sodi family, Julius, and Adrian, to get this on the to get this bill for a vote. It passed the House. Now it needs to pass the Senate, which we'll be voting on soon. And if and when, fingers crossed, and as Tony said, you can always try again, try again. If and when New Hampshire passes the defunding, what we're going to see, and it's predictable like clockwork, the rates are going to go down, and more children are going to be protected. And, as Samer said, it's not a, this may not be he didn't put in these words, but it's not a silver bullet, it's a silver buckshot, right? So we just keep getting incremental wins, and then eventually we'll hit that tipping point. So in terms of intactivist victory scenarios, there are 3 that we were able to think of that are actually achievable in the immediate future, and they kind of play off each other. But the first victory scenario, and this is what happened with Obergefell, is let's say 14 states declared that it was a violation of equal protection under the law to only protect female children from medically unnecessary non-religious genital cutting. And so after a bunch of states protected all children equally, it comes up to the Supreme Court, they read the argument and say, you know what, it's time to move past this anachronistic, barbaric practice that harms children and violates their right to bodily integrity. That's a very realistic scenario. It's happened in the past. Another thing that could happen tomorrow is RFK Jr. just says, you know what, we looked at the medical evidence and we're just not going to fund it anymore. If you want to pay for it, it's fine. Private insurers will stop paying for it because then they're not competing with the public government to provide this service of cutting off a big part of a child's penis for no medical reason. But it is very possible that, that this administration that has already defunded circumcision in Africa, the first time that I've ever seen the United States government defund genital cutting, defunds in the US too. I mean, that's definitely within reach. And what we're seeing in Oregon and other states as well is that, we just stopped doing it, as Sam said, we denormalize the procedure. So that's happened in Oregon. About 1 in 10 children are generally cut, or more affirmatively, 9 out of 10 children in the state are protected. So let's circle the square there in other states. And when we defund it, it's going to be, so if we were to defund circumcision, it would become denormalized. It would be easier to bring these lawsuits. And then maybe the Supreme Court would issue kind of a Obergefell-esque ruling, a landmark ruling saying all children are entitled to the right to their bodies, right? Their bodily integrity. So that is a very possible outcome. And that's what we're working to achieve. And we believe we can. And we believe we can do it in the near future if the internet backs us, right? Because everyone here in this room is supporting us, but we need the global movement to come through. We need your help. So if you're watching on a live stream or afterwards, this is the time to support. And so beyond Oregon, as I mentioned before, we've raised $30,000 on the GoFundMe. And then we had another $30,000 from the NCFM, GALDEF, and Doctors Opposing Circumcision. So we should thank you for coming through, gentlemen. Should really say 60,000, not 30,000 from the GoFundMe. And when those checks clear, we'll thank you again. But we've been able to do an incredible amount of work with 30,000. This is high caliber legal work, and I've been a litigator. I've been litigating on behalf of myself against Harvard before I was a barred lawyer, but for 5 years, and you cannot do the work that we did for $30,000, but we really care about this issue. We're very passionate, we're very capable and committed, but if we want to scale this up, we're gonna need support from the movement. So really, donations are very important. To kind of give you a sense of the cost of litigation, when I was at a boutique litigation firm, I cost $30,000 a month to maintain a litigation-heavy lawsuit. We could probably do it for $10,000 a month, depending on how intensive it is. We could maybe do it for less, but that's a good rule of thumb. So hypothetically, just giving you heuristics, right? If Intact Global was able to raise 1.2 million, maybe even $1 million, maybe even a little less a year, we could be suing 10 states at once. We could do an all-out legal, I would say, we're helping states change their laws on a mass scale, right? We're your friends. We're Oregon's friend. We're trying to protect children here, right? So although suing may be adversarial, and it certainly is when you sue hospitals and doctors, when you sue states, it can be a conversation. We're here to start a conversation. Why do we only protect girls in Oregon? Why don't we protect all children? And if we're raising 7 figures a year, we could sue 10 states at once, and we could move the needle like as quickly as marriage equality did once it got going. Now, what else do we need besides money? Obviously, resources are important, but we also need more plaintiffs, right? So we have great plaintiffs in Oregon. They really are leading the charge. And also the Moody brothers, Carter and Landon, who are not presently here, but we want to thank them as well. And obviously the Hadachek family, Cecil. So we need more plaintiffs. And we have potentially a plaintiff from Minnesota in the audience, but if you've been cut and you want to protect other children in your state, go to intactglobal.org, give us your information. That website has everything you could imagine. Our board member, Will Wong, who couldn't make it, did a phenomenal job making that. So reach out to us if you want to be a plaintiff. We need more attorneys. We need more paralegals. We need more legal man and woman power, right? Because the reality is, although Oregon may be friendly, there's definitely, or most likely going to be opposition. We're going to want to counter that with other amicus briefs. We're going to have to brief a lot of issues. This is going to be a lot of work. If you read the 72-page complaint, you can imagine it was a tremendous effort from Peter and from Samer to gather all of that authority, both Oregon local authority, global authority, and medical authority on the harms of medically unnecessary genital cutting. We're going to need healthcare professionals and other doctors. We have Leaf in the audience, so great, but we need more doctors. You know, we should be teaming with doctors with integrity, right? Those who aren't there to be like, oh, well, I made a quick $400 when I performed this medically unnecessary amputation, right? It's totally nuts. But in the vast majority of doctors do not do this, right? This is an incredible outlier position, as Deborah said, in her conservative Jewish community in Los Angeles, like posing the question to them, how do you justify this position on scientific and medical grounds if you are an incredible outlier of all of the scientific and medical community, right? And then we're gonna need volunteers, because even this event, if Justin's in the room, I mean, he did a wonderful, wonderful job in organizing. So round of applause for Justin Banyai. You'll see it on the record. Oh, there he is. Yeah, do it now. Okay. Seriously. And there's, I mean, I could be up here thanking people all day, but they're about to take the hook out because we've been, you know. But to wrap up, so today, yeah, we're in the Sentinel, beautiful hotel in Portland, Oregon. We got the complaint on file. Where we're kind of strategizing. We've had 2 great days, 2 great days. We're really in line, I believe. And so today we may be, let's say, planning the attack on the Death Star, but tomorrow we go out with a press conference at Pioneer Courthouse Square. So we hope to we hope to see you there tomorrow, 10 a.m., March 31st. Thank you so much, everybody. We love you. This is for you, children. We really want you to watch this. We'll protect every child's right to bodily autonomy. I really appreciate you all coming out and supporting this. Our children are counting on us, and the time has come. Goodbye, Michelle. Goodbye, everybody. Thank you so much. Thank you. Okay, and now we're getting kicked out. But seriously, thank you so much. Tomorrow, Monday at 10 a.m., Pioneer Courthouse Square. It's about a block and a half away. You can't miss it. We got a 20 by 30 foot tent, and we're gonna